Good morning and welcome to the third day of this very special Gratitude Week, a tribute to the health guardians of our country. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, a not for profit social impact initiative to promote health for all. We are in the middle of an unprecedented human and healthcare crisis. But at ISW Council, we have thought about paying our tribute, our gratitude, our national collective thankfulness to our doctors, our nurses, our healthcare workers, and all those who are involved in providing and ensuring that healthcare reaches to each one of us. We are in the third day of this extraordinary 60-hour long observance of expressing our deepest appreciation and in-depthness to millions of healthcare workers. Over the past 2 days, we have discussed on the realities of being a doctor, the progress they have made in their fight against COVID-19, and how it has changed their lives, as well as their experiences with the society during this pandemic. On the day one, the ISW Council has also proposed, and we are continuously running that campaign and requesting the government to set up a memorial for all healthcare workers who have made and continue to make significant contribution and also sometime and not more than often supreme sacrifices as well. We are happy that the Honorable Minister of State for Health, Sri Ashwini Kumar Choube, has agreed to consider and take it further and discuss with his colleagues in the government. We will need your support to make this a reality. So I will request you to visit our social media page, and you can also sign the petition on the change.org, and the link for that is on our chat box. So do sign this petition so that we can see a memorial which is dedicated for the resilience, for the contribution, and also for the sacrifice of our healthcare workers, and also as a symbol which can always keep our society remember that health comes first. Today we will also become a little more focused in our discussions and try to explore why doctors are our eternal companions. It may sound strange, for we remember doctor only when we are sick. But think about it. We are here because some doctors helped us to come out of our mother's womb and carry on with their services until our death. Today we will talk to some doctors who belong to specialties that help us become parents and sail through the initial days to understand what really how to take care of our next generations. And we will also be dedicating this day for many other specialties and the doctors who ensure that we have a life without sufferings, without ailments. Most importantly, we have also today a panel of very esteemed doctors who are joining us at our inaugural session, and we will also be having a prominent lawmaker with us who too has been proactively working to ensure that everything which is needed as part of healthcare or any other support to this society is reaching to the people during this time of crisis. So in this inaugural session, I would like to introduce our speakers and will like to welcome them. I believe Ms. Meenakshi Lekhi has joined us. So welcome to Ms. Meenakshi Lekhi. She is a senior lawyer of the Supreme Court and an MP from the New Delhi Lok Sabha constituency. She is also renowned for her social work as a member of the National Commission for Women, Special Committee, chairperson of the Special Task Force on Women Empowerment, and Joint Secretary of the Blind Relief Association in Delhi. So she is leading lots of social work and also things which are helping people live in a better manner. Then we have Professor Ravi Kant, the director of the All India Institute of Medical Sciences, Rishikesh. He is a professor of surgery and was the vice chancellor of King George Medical University from 2014 to 2017, and has been heading the surgery of All India Institute of Medical Sciences in Bhopal. We have Dr. Sonia Malik. She is a founder and director of South End Fertility and IVF in New Delhi, and the champion of women's health, one of the finest doctor in reproductive health also in the country. We have Dr. Suchin Bajaj. He is the founder and director of Ujala Cygnus Hospital that runs a chain of healthcare facilities in North India. Combining his medical skills with that of an administrator, Dr. Bajaj was among the entrepreneurs leading disruptive change by the Economic Times and is associated with multiple health tech companies. So let's begin our inaugural panel today, and I welcome all our guests on this panel. And before that, I would request my team to play some of the glimpse of our previous days of this 60-hour-long gratitude marathon.
आपने विशेष करके जो हेल्थ केयर इकोसिस्टम को इंडिया में जो आपने एक हस्ताक्षर के रूप में ISW ने जो विषय आज का प्रसंग जो है, मुझे बहुत खुशी हो रही है कि डॉक्टरों का जो ये वर्चुअल मीटिंग आज आयोजित आपने किया है। मैं आप सबके प्रति आभार व्यक्त करना चाहूँगा, विशेष करके ISW के प्रति, और आपके प्रति शुभकामनाएं व्यक्त करता हूँ। और जो भी आज के इस कालखंड में हम लोग एक दूसरे से जुड़े हैं, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ। आइए आज हम सब मिलकर के कोविड हारेगा, देश जीतेगा, इसमें कहीं दो मत नहीं।
Doctors accept it as part of their duties, and very often they feel that this is part of what we call an occupational hazard, and patient care is paramount despite the risk that they have. And they would see patients knowing that they are infectious, they can give them the infection and still continue to do that, because what really matters is that if you cure a patient, the smile on a patient is something that is what doctors really yearn for. No one is an island. And this is something that the pandemic has really taught us, whether it be governments, whether it be countries, whether it be public sector, private sector. Everyone has to support each other if we have to fight this battle together.
Why we should also be proud of our profession is that it is a profession which is a service, not a business. And here we use our skills to serve a social purpose. And we deliver competent, committed, and conscientious service, essentially for the welfare of humanity. And that is the ultimate pinnacle of the profession's values. So I think remembering them and celebrating their contributions is a very important element, and I salute you for that idea.
I think not just the medical profession, but a lot of other non-medical people also have to play a role in mitigating this stress-related distress which is there with all these populations. That there have been several lessons that we are going to learn, several reassurances that we have already got, and I'm sure all of us have to convey to the public. Priority is to avoid getting infected rather than having to jump to reach a hospital for not so emergency, a psychiatric or neurological condition. A credit to the Indian population and an ordinary Indian citizen that he or she takes any ruling that is coming from the ministry seriously, and a good chunk of them follow.
There are enough signals for you to save yourself. Mortality is an exception, not a rule. Recovery is the rule and not an exception. This is as on today, 2nd July of 2020. This may not have been true 15 days back, This sentence may not be true after 15 days. After 15 days, we may say 0% mortality. But as on today, yes, this virus mortality with adequate and effective and early treatment, nobody should die. Thank you.
It's the joy of saving lives, the joy of seeing patients when they are getting well, the joy of Ayushman patients coming to us, and the ministers and the Prime Minister recognizing us that we are the biggest provider of Ayushman healthcare all over the country as an organization. So when you find joy in these things rather than just the money, I think medicine is a profession that will work very well for you.
Our doctors and nurses, they work tirelessly and never deny care. We salute them all and thank to them. They are our heroes and shine like a gem.
So much, my team, for putting together these glimpses of last 2 days. And I'm also thankful for all those audience who joined us in the last 2 days in thousands of numbers. We request them all for their continued support and love and the gratitude for our healthcare providers. Before I go to Ms. Meenakshi Lekhi to deliver today's keynote address, I would request Dr. Suchin Bajaj to uh, address us with his opening remark and in a way set the agenda of the day where we are celebrating the contribution and support of millions of healthcare workers and affiliated workforce.
Thank you very much, Kamal. Namaskar to everyone, and thank you again, Kamalji, for organizing this Doctors Gratitude Week. It is an amazing initiative, the first of its kind, and we are very, very happy and proud to be a part of it. We are extremely proud also of the healthcare workers working with us for fighting this pandemic as they have done in the previous few months that we've seen. We've seen that even in the most advanced of countries, health systems have broken down. There has been shortage of equipment, shortage of PPEs, shortage of healthcare staff. But compared to that, India has done really well for itself. There was no expectation that India would manage things so wonderfully. There had been a time when it looked like we would be swamped completely, but the healthcare workers, the manufacturers, the ventilator manufacturers, all of them have come together to fight this pandemic. And we, in the beginning, thought that we were fighting a 21st century war with 20th century weapons. But we have proven that we can make those weapons and those solutions very quickly. So, as we know that entrepreneurs are someone who jumps off a cliff and makes the parachute on the way down, right? Risking his life and risking his home and house and everything. In this case, we did not even jump, we were pushed off the cliff. But I feel that we have managed to make the parachute very effectively and are on the way to safety. Uh, it's an old saying, right, that problems arise themselves, but solutions have to be found. समस्या तो खुद ही पैदा हो जाती है कमल जी, समाधान ही ढूंढना पड़ता है, समाधान कभी खुद पैदा नहीं होता है. So we have been able to find the solutions. A lot of them, like Dr. K.K. Deval also said yesterday, the mortality of the virus is decreasing. Hopefully in the next 15 days, we will definitely make sure that nobody dies of this virus. Like we have ensured for other infectious diseases, for other diseases in the past as well. So we've been living through very strange times. We did not choose these strange times, but we actually can choose how we live through these times. So sometimes these crises bring out the best in people, but sometimes they bring out the worst in people as well. We've seen incredible support for the medical community, for hospitals, but it has been painful to see some people having a different kind of approach as well. You can see a duplicitous approach that, you know, if you are sick yourself, then obviously you should get a bed in the hospital. Everybody should admit you, that you should never be turned back. Doctors should come and treat you. But if you are not sick, then you should not even allow a corona patient near you. You know that we had some of these issues Meenakshi ji also knows in her constituency only one of our hospitals is there, and the RWA was filing continuous court cases against one of our hospitals saying you should not treat corona patients in your hospital, even though the Delhi government had filed a directive, just because the RW felt we are a rich community and corona patients should not come near you. So these kinds of behaviors, fortunately, have been few and far between. And in general, the country has rallied around healthcare providers, healthcare workers. They've helped them. There have been few and far cases of landlords not allowing doctors and nurses to stay there. Evicted tenants who were affected with COVID have been evicted from their houses. So there have been a few cases. Hopefully, we won't see more of them. Hopefully, we will rally around, because see, once you start fighting against one infectious disease, it never ends. Where will you stop? Tomorrow you'll be fighting against patients with tuberculosis. On the third day, you'll be saying typhoid patients cannot stay near us. So it is a never-ending thing. You cannot differentiate and discriminate against people based on a disease that they did not choose to get. So this discrimination and this antipathy towards sufferers needs to be taken care of. And I'm sure your initiative and your bringing together lawyers, lawmakers, doctors, providers, patients, all of these on one single platform will go a long way in taking this cause to the rightful place. Thank you very much again, Kamalji, and looking forward to a wonderful week ahead.
Thank you so much, Dr. Suchin. And we know that you are fighting this pandemic on the front line. You are running your COVID-19 hospital, and you are also trying to expand the capacity to make sure that as many people as possible can get this care. And we salute your effort and all those effort of people at any stage and any part of this healthcare system. Meenakshi Lekhi is with us, and we are really honored that she spared time to associate and speak to our healthcare community and the entire nation also, that we stand with our healthcare workers and we feel a really heartfelt gratitude for them. Meenakshi ji, you have seen that the government of India has done really remarkable work in terms of providing the timely response to this pandemic. And we have also seen that despite some such cases where which Suchin ji also identified, we have seen that government has come very, very proactively with the ordinances, with all kind of messages to the public that doctors and healthcare workers need to be appreciated. And we really were humbled to see when the Prime Minister gave a clarion call for showing the gratitude by clapping or by putting the diyas at the houses or by showering the flower petal by the military choppers on hospitals. So we also show our gratitude, Meenakshi ji, to you and your entire fraternity of policymakers, lawmakers, and the government of India and all state governments, and would like to hear from you what you feel about this millions of workforce who are fighting on the forefront of saving our society, our humanity from this pandemic. Meenakshi ji.
Thank you very much, Kamalji. Gratitude towards everyone who has been on the battlefront and especially handling the front line. But today I want to remember all those who have lost their lives due to Corona. And because that is where my heartfelt gratitude starts from, that in those dead bodies it could be any one of us also. And those who have lost their lives to Corona also are indicative of the fact that, as Dr. Sachin said, that we never called this pandemic on ourselves. It happened, and you're thrown into an ailment, and you have no other way but to fight it out. And you have chosen a good method, because I don't know how people like me could have gone to so many people and thanked them, though it's a different matter that I'm personally visiting all the Corona centers in my area. I've been going to the hospitals in my area. I've been trying to meet people, trying to arrange blood donation camps, trying to set up certain sea robos to be given to people who are working in these areas. I'm trying to do my bit, but nothing is adequate, nothing is enough. The more you do, the more need is there. And the more we thank them, the more compassion and gratitude comes out, because the fact is, while our soldiers are fighting a battle on the outer frontiers, because the two have kind of come together and from the same country. Uh, Soldiers are fighting a different kind of battle, and our doctors, so auxiliary staff, nurses, technicians, Safai Karamcharis, they are battling a different kind of war within the country. And we have seen the kind of dedication towards mankind, humanity, which has been shown in these times. And everybody is together in this war, which is a very, very uh, very nice feeling to me, to everyone. And as you said, the crisis brings the best amongst us. And crisis is normally a situation when feeling of brotherhood, friendliness, and everything else comes. So that is where people forgot that India, even if we may not be the richest country in the world, but we are richest in terms of human relation, value to life, and um, our sense of culture, where human life is prioritized over material things. And that sense has come out very well during this crisis. I remember when we started uh, the rescue and welfare work, at that point in time, I was told by my party that every MP needs to at least provide ration to about 30,000 people. And I can tell you today with a lot of humility that at that point in time, I was in shock. I say, how do you kind of provide to 30,000 people? And it's such a huge task. That kind of feeling comes in the beginning. You're a bit exhausted. And then you won't realize that a few lakh people have been reached out. And all that could happen because there were corona warriors on the ground. There were people helping us on the ground. And we reached out to people when people were afraid to go into those by-lanes. These people were going into those areas, carrying out ration distribution. Then immediately, we all know how WHO handled the crisis, the kind of contrary opinions which were coming. So I remember when I was reading about all this, a friend of mine is a professor in Princeton. He sent me a mail saying that kindly start a movement for everyone to start wearing masks and face covers. And face covers, because and t-shirt material is supposed to be the best, so start using that. So I wrote back that no, this is contraindicated because WHO is saying you're not supposed to wear face covers. He said that no, read up the Korea, how South Korea has managed to get out of it. It's because of face covers. Face covers are very, very important. And that I'm talking of 22nd, 23rd of March, that time. And we started making face covers at that point in time. We were the first ones to start doing that and distributing it to people. And lo and behold, that became the norm, and government also came up with the policy, etc. So I think overall the experience has been gratitude is one word, a small word, but the most important word, because it is because of this feeling that the communities could come together, the communities could take right decision, and there was never an end. Even today, if 50,000 people send me a requisition that we want ration, I can give it to you in writing that with great sense of pride, I can take it on myself and I'll say, okay, we will arrange. Just give us a little time. It may take 2-3 days, but we will be able to do it. That kind of himmat also comes because everybody has got into this feeling that there are people out there trying to protect all of us. Life is what is most important. There are doctors in the wards, there are nurses in the hospital, there are auxiliary workers. Everyone has put their heart and soul in saving all of us. And whatever little we can do, we must do. And I think everybody every sensible person, that I should say, has shown that affection, a feeling of respect towards the people who are on the ground. And I'll add police. Today we read in the papers that 8 cops have been killed, and these are the very people who were enforcing lockdown. When people were taking it so easy that it doesn't matter, everyone can go to the market together, have furlough around the place. These are the people who were playing with their lives and trying to push people inside their homes, because that kind of sensitivity which was required to be shown by the society, it was missing, and they were missing in action. And these were the people who were trying to drill some sense in the heads, who were not willing to obey the orders of lockdown. And today, the number of deaths, the kind of deaths, especially people who are, say, 60, 70, and I'm very sure if this pandemic had not come, if the kind of mismanagement which did not happen in the beginning had not happened, these people would have lived for another 20, 25 years at least. So, namaste. Thank you, everyone. Dr. Sachin mentioned about one hospital, that was Cygnus. While I thank everyone and a sense of gratitude prevails all over the efforts all of us have put in, no one can replace the place of doctors. And the way Prime Minister explained in his on the Doctor's Day tweet, that he compared a chikitsak, a doctor, with a mother. And the reason is that a mother will do anything and everything for the child. And again, 2 words, compassion and care is what you get. So if compassion and care are the features which are common to the mother and the doctor, all I can say is that selflessness, which we have seen in these days in the medical fraternity or people associated with medical field, is unheard of, unseen before. And COVID brought all that to the forefront, that this was the oath all these people took when they passed out of the colleges they studied from. And Hippocrates' oath was not a hypocrisy oath. And that is where we all come forward to thank, because I've seen in my life that many a times a lot of good people do a lot of good work in this world, and world is centered around good people, because there are good people, so world keeps running. And good people do not seek anything in return. They are not doing because they want anything back. They do because that's how they are made, that's how they are cut out, that's how their heart bleeds, and that's their intention. So when they don't need anything, the least a human effort requires is a pat on the back and a feeling of respect towards them. Just a thank you note, just 2 words, thank you, or you've done very well. That's all kind of re-establishing that faith is what everybody needs. And I think that is what society needs to give to these people. And I will say that you've given me an opportunity to say this thank you. You're running it like a gratitude week. I cannot but thank you as well for giving this opportunity. But before I close my address, I just want to say a few things which also, were not nice. And this reminds me a story of Merchant of Venice, which we all must have read in school, that there was a problem in the fraternity. Some people, I have paid some bills for some people who, like a tailor, somebody who used to stitch my clothes. He went into the hospital. Family paid up something like 2.5 lakhs or more. And the person collapsed and he died. And then they wanted 1,82,000 more and would not release his dead body. Those incidents have also come forward. So while there are people who were nasty to the doctors, who were horrible to the nurses, and lacked a sense of civility and good behavior and good civic sense, there are some hospitals and agencies which have also acted like Shylocks. So I think when we talk of goodness, we have to somewhere take care of this aspect as well, that there are sharks amongst us who feed on the bodies, and that system also needs to be corrected. And some policymakers who allowed this situation to escalate to this level. In Delhi, I remember Delhi was really not badly affected. There were less than 100 people. And less than 100 people, if I could make that, if I was kind of handling the situation directly, I would have ensured that those people are inside the agency's place, lock, stock, and barrel. Nobody comes out because it's a question of life of so many thousands and lakhs of people till they get cured. So you can handle situation differently. And that was missing in Delhi. That administration was missing in Delhi. And when you're planning corona centers, I mean, today it's everywhere. So people are, asking for tests and people have changed their attitudes. But when you are planning, there are green zones. There are colonies which are free from corona. There's not been a single case. Allowing those areas to have corona centers so that people from outside can come and infect those areas. From where do these people get this kind of sense? So I think even at the administrative level, a kind of gas which we have seen, a lack of senselessness which we have seen, and marta kya nahi karta, when Delhi is, the whole of Delhi is a red zone, what do you do now? You have to allow everyone and flourish. That's a separate story. But when it is a time when you can control and you can make right decisions, that's where I felt agencies were missing in action. I talked about ration. If a single MP only, initially I started on my own, from my pocket I started, because you don't know where to go, what to do. And then people just poured in and just came along. And I think that is what leadership is all about. End of the day, I started realizing it's not, the fun is not in asking. I never asked anyone for anything, but it just kept coming. And people wanted to help. And I think that feeling can come only when people have faith in somebody, that, things will happen in a certain way. Unfortunate for all of us, in Delhi, things didn't happen like that. There was a immense gap. Maharashtra, Delhi, we saw how Tablighi Jamaat, since most of you are doctors, you will understand that how hospitals and how administrations responded. Tablighi Jamaat, while we were handling people who have come from outside the country, suddenly this Tablighi Jamaat comes in, people are allowed to have a full-on party. And in that party, they infect everyone. And when they are taken to the hospitals, they misbehave with the nurses. The administration in the column, because you are supposed to trace the ailment, you are supposed to track the contacts, and you are supposed to treat all of them. Interesting enough, when it comes to tracing, you've traced because they all tested positive. When it comes to tracking, the column of Tablighi Jamaat is removed from the hospital records. And from Tablighi Jamaat, you make it into NCT Delhi. You still identifiable, because when you say NCT Delhi, you know what does it mean. Then NCT Delhi is converted into special group. Chalo, no problem. That is also understandable by some name. You don't want to use word Tablighi. You want to call special group. It's okay. You do that. But then from there, the tracking should happen. Then you mess the whole data. You remove the column. Who are you going to track thereafter? Who are you going to trace thereafter? So no tracking, no tracing, and definitely the pandemic spreads. I mean, this is the kind of the level of thinking, and people like me could just do nothing but, when people are coming to you for help, you have to help people. And all this I thought I will address because Dr. Sachin mentioned it in the beginning. These are some colonies which did not even have a single case. It's not about them being rich or poor. Rich pay the taxes so that we all can run COVID centers. Otherwise, COVID centers would not be running. So discrimination when it comes to death and life, saying rich or poor because some people want to make a little extra money, is as terrible. And it is here that I feel the whole society needs to work together. And if nothing, I think COVID has shown each one of us that end of the day, how much do you need? How much do all of us need put together? You need 2 meals a day. You don't even need 4 meals. At least that's what I have learned. That I don't need to eat 4 times a day. I can do with 2 meals. You need just a few pair of dresses. Keep changing because nobody can see your face. Your face is covered with a mask. Your life is more important. And what goes with you if you pop off, any of us can still, because pandemic is still around, the corona is not gone. Then all that you have done in your life to people, to others, helping them, caring for them, that good work will go with you. I think that kind of realization has dawned because of corona. A lot of us were living a very materialistic life, never cared for what's happening in the country, what's happening with others, what's happening with our poor brothers and sisters, how migrant laborers were treated in the city. I can only cry for that. And I was the one who was feeling so bad that if anybody is responsible for causing corona pandemic across the country, it is Delhi, because Delhi allowed those people and did not care for them. When ration, 36,000, 37,000 tons of ration was given free of cost to Delhi, you have a person who's sticking his face for distributing that ration and saying, Kejriwal ne aapko free mein ration diya. Is that what is needed at this time? My heart is welled up. I'm pretty emotionally connected to all these things because one has seen it happen in front of the eyes when you feel so helpless that even people think God knows what an MP can do, but you realize you're helpless. You can do nothing. And that minuscule amount that you can do is also with the support of people. I today use that opportunity to say my repeated thanks, and thank you all. May God bless each one of you because you have helped lives. You have allowed people to live longer. You have given family their smiles. Maybe not everyone has survived, but those who have survived because of you. I can only thank you. I have no other words. All those people who are part of administration, who are still on the ground, who are related to medical field, who are cops, everyone, I can say police did a fantastic job. Day in and day out, we are seeing what military is doing. I am seeing how people are responding to the call of deleting Chinese app and Chinese codes. PPE, you gave an example. We've seen how 10,000 bed hospital has been set up in Radha Swami Satsang, and this is what Delhi has only done. And when you have the right leadership, that's how things move. So I will use this opportunity to thank Mr. Shah also on your platform because he took charge. I mean, and everyone came along. Everything happened. Thank you very, very much. May God bless this country. May God bless Delhi. May the right thinking people make the right decision, and the wrong thinking stop making decisions. They allow right thinking to make decisions. Jai Hind.
Thank you so much, Meenakshi ji. It was really a poignant message, and we could feel that emotions which are, welling up inside you. And it definitely would have been a very, very difficult and arduous journey for you also to ensure that kind of community support, which you said you have been, doing, and you did a wonderful job, wonderful service for the people whom actually you are responsible to, and this is something very, very moving for each one of us. uh, Definitely, as you said, corona is not making any discrimination between rich or poor. It is not making any discrimination whether you are man or a woman or a child or a elderly. You are on a opposition party or you are on a ruling party. It has nothing to do with that. It has nothing to do with even the power. You saw those many of the prime ministers and the presidents of the country had to quarantine, or had even got the infection as well. My point, I would like to just mention that uh, when we see that this, and that's where the empathy part also comes, when we see that the patients can also be cured inside the home. Why a patient cannot be cured maybe at a colony also where there is no corona, but it is inside a four walls of a hospital? You see the five-star hotel, my heart goes sometime out when I see that, okay, Taj Mansingh Hotel has now become a COVID-19 hospital. So I think maybe that's the planning might have been definitely wrong or something, I don't know. But I believe if I get a corona patient at my home, I have to make sure that he or she is getting all possible care with all the possible protocols, safety protocols for me or for my family or for that patient. And the care must go on. Uh, I think you made very, very important points. We still did saw some kind of mismanagement, and thankfully those mismanagement was very fast recovered with the right intervention, with the people like you, with the people like in the government, and ultimately the good sense is prevailing everywhere, and that's what we are thankful for. I would request, we have been making this request to the government, and as I said that MOS Health, who was there on the first day, and Dr. Randeep Guleria, Director AIMS, they also endorsed this demand. We want that you also support this request and take it to your colleagues in the government, that like we have these so many war memorials for the people who defend us at the borders. Today, people are defending us at our home, at our hospital. We should have a memorial for doctors, for hospital, and for lakhs and millions of those healthcare workers who are working at any stage, so that people, when they see that memorial, they feel that health is the wealth. Health comes first. The country should also invest in health. The country should put health on top priority. Maybe we may request you to support us on that demand.
100%, you have my word for it. And when you're talking this, I can remember that picture right outside AIMS, within the AIMS premises, which is a beautiful statue. And I think something on those lines should be there, because we all feel, like, I think a common man has so much faith in doctors. Ever since I've grown, like, I can talk about my parents, me, children. Doctors are your first contact, and you always contact them, and there's a very long emotional relationship with them. So definitely, there has to be a celebration around it. There has to be. So we will do that celebration around it also, and whatever little or more I can do, come up with a proposal, I will do it. When the next parliamentary session comes or something, we will, or I will immediately write a letter. There's no problem. I will today itself write a letter and send it to the PMO or HM's office. There's no problem at all, because these are things which we all need to put together and do it. In fact, I was saying that when you say emphasis on health infrastructure, Ayushman Bharat was brought by this government. And imagine Delhi does not have this, even in times like this, in times like when this child called me up, my tailor's child, that master ji ki death ho gayi hai aur hamare paas paise nahi hai. You can imagine what I would have gone through at that point in time. you know, somebody who has worked with you, again, you have shared relationship over a long period of time. So the way you share your relationship with a doctor, somebody you know who has been your friend, and doctor is always a friend, irrespective of, you know, the amount of respect you may have, but doctor you always treat like a friend. So in all those circumstances, to have a greater infrastructure in terms of Ayushman Bharat is one such thing. We've seen that Delhi only had about 4,000 ventilators. 5,000 plus ventilators have been provided by the central government now, and technicians, etc., who need to work on those. Of course, hospitals need to treat. I remember Charak Palika used to have 2 ventilators, and I was planning to give it away because I said, what are these ventilators for? Because your hospital does not have a nurse and technician who's using this. Might as well give it to LNJP or some other hospital who are at least trained to use it. You're not trained to use, so train more people to use these things. So in terms of health infrastructure, ambulances, if there are 300 plus ambulances, 600 more ambulances have been given to Delhi by the center. PPE kits, N95. N95 was something we have never heard of, but yes, doctors need it, and that has to be provided for. So I think there's a greater sense of awareness also around the subject, and there's a greater sense of awareness about the kind of work doctors do, the kind of infrastructure with paucity of resources these people are working. So you have my word for it. I will be proposing it today itself.
Thank you so much, Meenakshi ji, for your kind words, support, and your so much of work for the society, for the whole community, and then your the gratitude which you showed for the entire healthcare system. You mentioned about Ayushman Bharat. We are all very grateful to the country, the people, and the Prime Minister Modi, who thought about, envisioned about this universal healthcare scheme. And I'm really also thankful to people like Dr. Sachin Bajaj, who has been a big contributor of Ayushman Bharat and has been time and again recognized for that. And all those, Dr. Ravikant has joined us from AIMS Rishikesh. They're all fighting this war at the front line. Thank you so much, Meenakshi ji, for your time, for your kind words. We look forward to have your support and your guidance
anytime,
always in our work.
One email and it will be done.
Thank you so much. Thank you so much, Meenakshi ji. Now I'll go forward to Professor Ravikant. Professor Ravikant is with us. So Professor Ravikant, thank you so much for joining us. And we have Professor Ravikant, who is heading the All India Institute of Medical Sciences in Rishikesh. And I invite Professor Kant to deliver his keynote address on this Gratitude Week, which we are celebrating to underline and highlight the wonderful, the life-saving contribution of the entire health workforce across this country, across the world. Thank you so much, Professor Ravikant. Over to you.
Welcome, Mr. Kamal. Actually, if we see the tribute to health guardians is not only during Corona, but it is a lifelong process. When you are born, when you are getting vaccinations, when you become sick, when you are elderly, when you are childbearing age, when you are say geriatric age, you need them every time. So this tribute goes on and on. But let me say what have been the issues so far. 99% of hospitals in India were not having a pressure negative environment to treat the corona infection. So that was the issue one. None was trained to use a PPE, and N95 was available to us even before corona, but it was not stocked so much. We had a fair enough stock, but not so much. So the key point is we were not ready even by what you call it engineering design. We wanted a pressure negative environment. It was not easy at all. All our ICUs are pressure positive. So that was the challenge one. Challenge two was around the India, the capability of health service is unequal, And I would say that variation is phenomenal. Having been in Delhi for more than 2 decades, I can definitely say the various focus vary too much in competency and equipment. And therefore, a better management could be that we should think about Indian medical service. And I was indeed wondering that when you're talking about a gratitude and a memorial, you can see that the statues come down very soon. We have seen in Iraq, we have seen in America, statues come down very soon. But what is the long lasting will be creating an Indian medical service, which is in nook and corner of each village, each place. That will be such a tribute that give a long time to have. Now, what we are seeing is again the capability to provide oxygenation and everything is so demanding nowadays. And the rationale is giving an example. When the bullets are being fired on the field in a war, it is very easy to say that we will manage the patient. But once the bullet is passing through your ear or near the ear, whizzing past you, that management of patient is a very demanding situation. Similar situation is when you are managing a coronavirus. You are not only bothered about yourself, you are bothered about your children, about your parent, about your family, about your friends, whether you will give that infection to your only child or to your dear parent or to wife. That becomes a phenomenal fear apart from desire to serve. So this is a big challenge. The second challenge is people were not trained enough before this event how to wear a PPE, how to take off the PPE. That is another challenge. That how do we train large number of population? And we found it was not only for we have to train only doctors, we have to train entire nurses, we have to train housekeeping staff, we have to train electricians, the engineers who will go there. It is a big challenge. But the best thing is major institutions can handle this challenge very easily. That was part of it. But what is happening to the smaller institution is another issue. And therefore we can see that testing, again I will come, what was the status of testing? I think the testing which required RT-PCR method, because it has 3 steps, viral transfer medium, then RNA extraction, and then testing. I would say we had a capacity constraint at the highest order. Even today, I can handle 200 to 500 sample or 600 sample per day or 1,000. But what comes when we get 3,000 samples in a day? That becomes another issue. So there is a major issue about how we are the capacity constraint. But at this time, I would say the Indian government has risen very well. The Indian government has done so well that phenomenal support and phenomenal leadership at the central level has made all these problems look that they can be managed and they can be managed in a positive way. So I consider that the challenge which was never thought of, the challenge which we never dreamed, it has been handled so well. And not only, I would say, due to a cooperation by entire population, but mainly due to the strong leadership support by the central government and equally commitment by not only healthcare workers, but all supporting staff, which include engineers and all other group in the hospital. So we can now, I would say, manage corona very well. But what is the spin-off? The spin-off is the cancer care has gone down, the coronary care has gone down, the serious patients who were coming, they got barred because of various obstacles. So it became a major issue how to handle other patients. Now that is gradually coming up again. We are trying to bring that thing gradually again, that is coming on road. So it has been a corona focus era in which other major diseases got lost out quite significantly. But now we are coming back to, I would say, rails. And therefore the whole team, whether it is involved in corona or involved in surgical area or wherever, it is a real gratitude to them that despite so much adversity, they have handled it very well. And thank you, Mr. Kamal Narayan and the ISW Council, that you have taken this challenge and right to say hello to everyone, because it's a big challenge to organize so many days of meeting. And also, I would say a very, very nice gesture from you that it has been taken. And I would say that right tribute will be prepared for the next war, because this war will come every 30 years to the 30% level, and every 100 years to 100% level. If are we prepared for next war? Are we prepared for next pandemic? That will be the major issue. Whether we'll have hospital which will have pressure negative areas for ICU, whether we'll have enough ventilator in future. I think it's a key component today is increase the expenditure on health from 1% to significantly 5 or more percent. That will make a major change. But even today, with so much constraint on the border, the leadership in India has done phenomenally well in supporting health area. Thank you very much, Mr. Kamal, for this opportunity.
Thank you so much, Dr. Professor Ravi Kant, and it's wonderful to hear from you. And then one important thing which you highlighted is that despite that our health workforce was not equipped, despite that our health workforce was not trained, was not prepared, still they rose up to this occasion and they ensured. And despite that all fear and dilemma and the risk of life, risk of their family's life or apprehensions, none of them, or I think we haven't heard much of that anyone would have gone away from the line of duty.
Nobody.
We have seen society tried to throw them out, but we haven't heard that the doctors or health workforce might have resigned, that we are not going to serve because there is a pandemic. So that is more heartening scenario, and I believe that people like you with leading this healthcare system, we will and you will definitely make all those arrangements in terms of infrastructure, that we are ready for the next pandemic also, as we can't avoid them. So we
the real gratitude will be ready for future.
Yes. So thank you so much. And this is a message that we need to be ready for the future. And with this kind of dedicated healthcare workforce, we will be ready for future, for everything. Thank you so much. We are running a little late, but I would request Dr. Sonia Malik, who is our another guest of honor in this inaugural session. Dr. Malik, your words about how do you feel as a doctor during this time when the whole focus and then the response, the expectation of these 1.35 billion people and globally is on somebody who is called doctor or medical professional. Dr. Sonia Malik.
Thank you very much, Mr. Kamal, and thank you very much, IWC, for having me here. And we have heard such beautiful expositions from various leaders and from various parts of the society talking about this virus, the disease, this pandemic. Being a doctor, I am also a part of it, as you know. But, I would take this forum, first of all, to thank my colleagues who are on the forefront and trying to handle this as best as we can. However, having said that, as a gynecologist, because I stand for gynecology, our role is slightly different even in this pandemic. We have our doctors standing there, bringing in life into this world, not just saving lives, we are bringing in life into this world. And therefore, the responsibility for us is immense, because we have to ensure that both the mother that we are treating as well as the child that we are bringing into this world is protected and is safe. And it's not just a normal woman always, it can be a high risk pregnancy as well, with the diabetes, with comorbidities that we are so scared of in this pandemic. So these doctors have a double responsibility. As Dr. Ravikant said, they are scared about their own families getting it, but they are more scared about the patient in front of them, that the patient remains safe and the baby remains safe, the baby that is going to come out. Because our future generations, the generations of this country, are dependent on what is the quality of newborns that we are going to get into this country. So that is a huge responsibility that the gynecologists are facing these days, in addition to saving the lives of the mothers, which we have already always done. That is one part of it. And then, of course, the pandemic has taught us many lessons. We all know that. But more than anything else, it has taught us to become a responsible nation. And I think that responsibility is something that every member of the society in India needs to understand. The doctor can only act as an advisor. We have advised that you need to wear masks, you need to do social distancing and whatnot. And the government has laid down rules. They have tried to set in their own rules. But is everybody listening? Are we responsible enough? Are we doing what we are supposed to? That is something that each one of us as the community has to understand, that it is not just you. If you are not responsible, you are harming your own self as well as the others around you. So all of us have to make a collective effort to fight against this. It's a battle against an unseen, unknown enemy. Nobody has seen the enemy, but we can feel it. We can feel it around us. And the fear that has grown out of this enemy is immense. It is much more than we have ever witnessed ever in our lifetimes. We have never been so scared of anything ever. As doctors also, we have faced all kinds of dreadful emergencies. I have my senior sitting here with me, and all of us have faced so many catastrophic patients, but never at such a scale, never at such a large scale. So therefore, it is important for all of us to undertake a pledge today, as not as doctors, but with the doctors, that all of us will act as responsible citizens. And as Dr. Professor Ravikant said, this is what is going to make us prepared for the next pandemic. If we as human beings, as patients, as community, learn to be responsible, then we are going to really do it when it comes next. But if we are going to behave the way we are, opening malls, going for shopping, going to the restaurants, doing whatever we want to without being responsible, I think it's going to hit us even worse. So that is my message to all of us, that, time to learn and time to believe that we can do it if we want to. We have done it. We are much ahead of what we were in February. We are much better off. The mortality has gone down considerably with the better understanding of the disease and better management of the disease. But a lot needs to be done as far as community level is concerned. And therefore, it's not just the government's responsibility, it is our responsibility as well, as citizens of this country, to take care of our own selves and that of the country. Thank you very much for having me here today.
Thank you so much, Dr. Malik, for your kind word, and also for highlighting that what is the role society need to play, and so that we are able to take this fight in a better manner in the future, and are also getting prepared for any such fight. And also you have set the really, the course of our upcoming discussions also, which is going to be highlighting that why every woman and every mother need to be taken care of, and how we are going to ensure that the health care reaches to each one of them. And as Dr. Ravikant also said, that in the time of pandemic, we have put many of the other healthcare requirement, or feel that it has been put on the back burner. But for there are many for whom this is never on the back burner. They are still consistently trying to reach that every mother, every woman get healthcare which they need. And I will then hand over this the further proceedings of this gratitude week, for which we are on the third day, and this is going to be a 60-hour long tribute to our doctors and healthcare professionals. So I will be handing the next session over to our very, very passionate women health champion, Dr. Hema Divakar, and with a very, very power-packed panel of some of the finest name from the gynecology and all related specialty. But before that, I would request my team to play the anthem song, which we have prepared especially for our healthcare professionals, and then go ahead with the next session. So over to you, Dr. Divakar, for the next session. And before that, let's hear the anthem song for the healthcare workers.
Sure. Thank you, Kamalji. Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
Namaskar and welcome to the third day of the Gratitude Week. And I must place on records and offer my heartfelt thanks to Kamal Narayan and the entire team from IHW Council, which has helped us not only to receive the gratitude from everybody around, but also express our gratitude to our own fellow colleagues who are the most accomplished and the people that you have helped us bring on this forum today, the panel. Can everybody mute their systems, please? I think Anita, yeah. Thank you. So, the past, present, and future of our great organization called FOGSI, or the Federation of Obstetricians and Gynecologists Societies of India, the ones who have held the topmost and the most prestigious posts, past presidents who are here with us, in the form of none other than Shri Dr. Alka Kriplani from Delhi, Dr. Nandita Palshetkar from Mumbai, the present president, Dr. Alpesh Gandhi, who hails from Ahmedabad, and the future presidents, Dr. Rishikesh Pai, again from Mumbai, and the ones who've got the brighter future, Akhtar Bajaj, who is with us, and top it all, evergreen and all-pervading Dr. Meera Agnihotri from Kanpur, who has been a great source of strength and support and inspiration to all of us. So I very fondly welcome my panelists on the topic, which is so close to our hearts, because it has been our endeavor in any which capacity to reach every girl, every woman, and to ensure that she's in the peak of health. So the first round of question will be about, in their individual and organizational capacities, what is their vision of reaching each and every one of you, that is half our population, every girl, every woman, billions of them. And the second round will revolve around special issues on COVID. What have been their personal challenges, and also what has been challenges in working the health system. The third round will address very important reflections in their own life. If they become a gynecologist just by chance or by choice, it may just be the play of destiny which has brought them here, but whatever may be the foundation or the reason for that, I'm so proud. They have all done so well for themselves and our country, and we can proudly showcase them to you today. And the last round, of course, dear friends, will be one rapid round of message, the wise words from all of these friends and colleagues. So if Dr. Alpesh Gandhi is here with us, I would like to address the first question to him. I saw Alpesh with the mask.
Yeah.
With,
Good morning.
yes.
Good
Yes,
morning,
Alpesh.
Emma. I'm there, but my video is stopped by host.
Oh, I see. Money? Can you just have Alpesh Bhai on the video, please? I can hear you, Alpesh. I still want to begin with you because very recently, yes, there you are. Yeah. Alpesh, I want you to reflect on a special event you held for the mothers on the Mother's Day. What was your thought process in organizing the event? What was your vision to do with for the mothers and the mothers to be? Alpesh.
So, first of all, thank you very much, IHW Council, for this wonderful meet, and I am thankful to Hema for important questions and discussion. On Mother's Day this year, as you know, Foxy has decided the theme for this year is safety first, and safety for whom, safety for all, which includes safety of women of India, our tiny patients, fetus and neonates, and doctors, our postgraduate students. So looking to the theme, we have planned many programs, and on Mother's Day, we have decided to celebrate it for the safety of women, safety of mothers, as well as safety of girls. And Beti Bachao, of course, was also a part of it. So many points we want to discuss. We extend the theme Beti Bachao to Beti Bachao, Beti Padhao, Beti Padhao, and Beta Samjhao. So we wanted to discuss all four different aspects, and we have separate session of 1.5 hours on each of them. What is Bachao, what is Badhao, what is Padhao, mean by Padhao, and what is mean by Beta Samjhao. So it was a very good program, and it was very well taken by 48,000 people of India, and it was appreciated well. And our message had passed to all of them. And so many dignitaries, so many celebrities, and government authorities were there to pass on this message to all of them. So coming to your two more questions regarding, one is as individual capacity, as organizational capacity. Also, you wanted this. So I believe that destiny must have thought something special for me. After my post-graduation, immediately I started my private practice in an area which is a lower middle income group and a middle income group people, and a densely populated area. So as we all know that the medical disorder in pregnancy and complications in pregnancy are more in such type of class. And so I got an opportunity to learn and create interest in high risk pregnancy and critical care in obstetrics. So that is how I'm in this field, and I'm thankful to my patients for creating this interest in me. Meanwhile, because of various schemes were introduced in our India, like Janni Suraksha Yojana and many more. So every year the maternal mortality rate was improving 15 to 20, but by 2011 it has stopped. And what we were thinking by 2015, we will definitely, we would be achieve MDG goal, but surprisingly after 2011, we nearly stopped, and every year it was improved by only 3 to 4. So by that time, I developed interest in working for decreasing maternal mortality rate and neonatal mortality rate, and I joined Foxy in organizational capacity as the committee chairperson of Practical Obstetric Committee, and I got an opportunity to move across India. I came to know that there is nearly no existence of critical care in obstetric and obstetric HDU ICU in India. So I decided to sensitize our members. So for 2 years, next 2-3 years, I worked on this. At the end of my tenure, I thought that yes, our members are enough sensitized, but I should also do something for infrastructure. Our members are now ready, but what is about infrastructure? So I decided to go ahead further in Foxy and to sensitize government of India. I tried my best, and during the vice president tenure, at the end of the tenure, successfully I could convince government of India, and then we can say the second revolution in Indian obstetric has occurred. Now we have our own obstetric HDU guideline, establishment guideline. Now then we have our operational obstetric HDU guidelines. Now we have 300 functioning obstetric HDU ICU in our country, and now the Medical Council of India MCI has made it compulsory for all the medical colleges, and government has also changed its vision from 3-tier system of Indian obstetric to 5-tier system. It includes obstetric HDU ICU. So many changes have occurred because of all these things, and the most important change which has occurred is because of this. In the most of the colleges in last 1 or 2 years, we collected data where obstetric HDU ICU is functioning, and within a year or 2 year, maternal mortality rate is improved by 60%. So that was the best outcome of this all efforts, and now government of India is also presenting papers on it. So we could, as an organization level, also we could work a lot, and now fortunately or whatever, unfortunately, we are facing this COVID-19 crisis again as the organizational capacity. Again, I would say destiny must have something for me. I was not knowing when I installed as the president Foxy, and when I took over from our brilliant immediate past president who has done lots of work, Nandita. I was not knowing at that time what is going to be happened. I worked, planned for 1 year, and I'm doing totally different thing. But I am happy that as the organizational capacity, we could guide so many of our members. We can come out with the guidelines, registry, frequently asked questions. Send our suggestions. So much things can be done, could be done because of the individual and organizational capacity. Thank you.
Thank you. Thank you so much, Alpesh. Dear friends, you have all have recognized just one lifetime, and there is so much to do, and so much has been accomplished by the person who is at the helm of affairs at Foxy. So we again thank our parent organization, because as an individual you can do only this much. How it ramifies and how together the force of all the OBGYNs and the networking partners gets us to where we are. So Alpesh, thank you very much. The men in this panel first. So I am swinging to Dr. Rishikesh Pai, who is always talking about investing more in maternal health. So through the 2 days, yesterday and day before, there have been many leaders from the country who have been saying that GDP investment is really, really too less. With so much 1.6% GDP, what can we do? How can we improve the maternal health infrastructure? Just human resource, just good intention, just the passion. It's not going to be enough. We need the monies. Rishi, your thoughts on how much more investment is needed and how we structure that to do better for the women of our country. Rishikesh.
Can you hear me now?
Yes.
Yeah. So basically, I personally feel that there are very important security issues in our country. One most important, according to me, is the national security. So because we have got limited money in our hand, and if we have to really look at this, how to spend that limited amount of money, because the country is 1.3 billion. So my first priority, if I was the Prime Minister, would be to national security, and I would increase that security, because if you don't have internal and external security, then there is no country. So then there is no healthcare system, there is nothing. So the first priority has to be security, and unfortunately, due to various issues on the border, we will have to earmark more money for, because our government is faced with a limited resource and a large amount of people. So one is that once we earmark for external security and internal in the form of police, so external is army and internal, then we look at the other securities, health security.
more important than health is the food and water security. So the next priority would be food and water security, because you have to survive. Then would be housing and infrastructure, and then that is why the healthcare is not. It's not that the government doesn't want to give money for healthcare. It is just that the resource is so limited that in allotting the resources, unfortunately, the government is shackled, and that is why we, as a private group of individuals, have to help the government in increasing the healthcare allotments. And like our organization, like Foxy and all, so I agree with you that it would be ideal to have a 5-10% of our GDP for health, but we have so many other infrastructures, other priorities in our life, and then hence the allotment. Hence, people like us, our organization, have to help. So I personally feel we should have a dichotomous kind of behavioral pattern in our life. We must have our own private practice, and we should also have a free healthcare practice, and it should be voluntarily done. We must look at how to voluntarily make our members do the free healthcare practice, so that in oversight, see, whenever there is the voluntarism fails, then oversight steps in, laws come in, legislation comes in. Before these things come in, I was once in Turkey, and I was in the car, and the doctor said that we are having a national health system. Doctors in Turkey don't make money at all. So we have a fantastic existence as private practitioners. We must be responsible, and in order to protect what government has given us, gave us free education. Otherwise I would not have become a doctor. I was given free education. They gave us free education. They gave us free access to healthcare. So it is our responsibility to pay back to them, and that is why I feel that the GDP allotment should be there, but more than GDP allotment, our personal allotment should be there. We should personally allot we have to sacrifice. I would not even use the word sacrifice, Hima. It is our duty to see that we do the work for the poor, and hence we reduce the burden on the government. The government is burdened. They need to shift army to the front. They have to maintain the army for the next 6 months on the front. So the burden is there. So where is the money going to come from? From healthcare, from infrastructure, from development. That money has to be siphoned out. And so we have to step in to take care of that black hole that is going to be created.
Thank you so very much, Dr. Rishikesh Pai. This is the future of India, ladies and gentlemen, because what can we give is what Dr. Pai has talked about. And it is a positive spirit which is to be showcased the entire country. We are willing to do our bit. We are not all the time saying and blaming that somebody else has not done it for girls and women and the healthcare systems in our country. We are ready to move 2 steps ahead in collaboration, in public-private partnership, to do more than what the world would think that we can do. Then we swing to Dr. Nandita Palshetkar. Many politicians in her own family. On the dining table, Nandita, do you ever raise any such issue? Politicians doing, how can we reach every girl and every woman? Can you help me do this and that? What is your thought process and ideas on, is the government association bane or a boon? That kind of the sense that you may have had even with the Laksha Manyata, because things may not move as fast as in private practice, where you are the decision maker, you can make everything happen, but there is a process when we collaborate with big bodies like the government. So what has been your thoughts and experience, Nandita?
Hema, I think I've been lucky to experience both the world, the politics as well as the non-politics. And being the Foxy president last year has really opened up. I'd really like to take a little bit from what Rishikesh said and what I have gained from being the political side of my family. Last year as a Foxy president, I launched these B for 3 abhiyans. They were all aimed towards the upliftment of women's health. And believe me, they aimed at all aspects of women's health, and it was a national program, and the entire Foxians actually ran with it. I mean, it was amazing the way the entire Foxy was so energized, and it became a national movement actually. And what I realized, Hema, was if you have a leadership skill to get people motivated, if you're passionate, they took my passion and they ran with it. But when I did a analysis, a contribution analysis of it, it was only that much. You understand? And that's when I realized, and when we joined, as you said, the political part of it, we joined hands with the government in Maharashtra. I mean, you are my inspiration, okay, Hema? I have to tell you that I think it was 18 months before I took up my presidency. I had a meeting with you. I spent 3 hours with you. Okay, Hema, I cannot tell you how much I learned from you that in those 3 hours. And it actually motivated me. And when I sat on the table with those politicians, see, I was able to talk to them at their level probably because of my political background, I was with them at that level. I did not, get cowered back. And I said, you cannot take it as ours. You have to give us due credit for what we've done. And he realized that we were passionate. We cared about the women. And as Rishikesh said, we did not want anything out of it. We were doing it because we wanted to give back to the society. And I think that is the passion which we need to tell the government. And we need, as even Harshvardhan ji has said, that the jasba which he has seen in the gynecologist, and this is the jasba which Alpesh has also been working. Each one of us has a quality. I've seen Alka working in anemia. I have seen you working in quality. When I attended the WHO conference in Ethiopia, it was all on quality. And that's when I got passionate about your Manyata. And I realized what you were all about. That to bring about these SDGs, to attain the SDGs, quality is so important. Especially now in COVID, we come back to it. I heard of Professor Ravikant talking just before the previous session, and he said that, we are falling short of certain things. We are not doing it properly. We don't know how to doff and don the PPs. It all comes down to the basic thing, quality. So I think our Lakshya Manyata is fantastic project, and I think the government and our Foxy together will amplify everything that we do. So yes, we have the passion, we have the jazba, we have the, the people, we have the manpower. You need to join hands with a force which will amplify it to millions. So you need to have a partnership. Sorry.
All the delegates or people watching this show, we can say, here is your powerhouse of the workforce who are most willing to join hands with anybody. Nandita says, politics, but no politics in the quality of care that we offer. And her vision has been to care for women with dignity, respect, and quality, may it be in the private or the public sector. And she has moved every inch and left no stone unturned, and continuing in her endeavor to make this dream a reality. And once again, we are all anyway from Foxy with her. We want all of the viewers to join hands with us as our stakeholders in any which capacity to help us do more. As I have said yesterday, we don't want to do for you, we want to do with you. That is the kind of an attitude that each one of us is portraying. Coming to Dr. Alka Kriplani, she has seen both worlds. AIMS, which is, it's a totally a different world, and Paras, which is in its own self an ivory tower, if I may say. So it's a kind of, sometimes when we go from one scenario to another, it's like a culture shock. It's like, oh, this is so different from what I have been doing before. So Alka, your thoughts on India. Sometimes they say India and Bharat. That's the kind of worlds that you have lived in, and you had the opportunity to have the experience. So what is your take on how to reach the best every woman in the country? Alkaji.
Thank you very much, Hema. And we all are very fond of you because of you are conducting such important meetings and with so much of substance in it. We have listened to past, present, and future Foxy presidents. I would like to, as you very rightly pointed, as an individual today, when I was in institution, see, a gynecologist, obstetrician's role is, as a in a government system, you are looking after patients. But one thing is very important in obs and gynae specialty, that pregnant patient, it may be the only contact opportunity to be with another lady, and who is the obstetrician and gynecologist. So apart from just giving her treatment, giving her medicines, conducting her delivery, the social obstetric part is very important to empower her, to give her thinking, and most important, educate her about preventive aspects of health, which is totally lacking. When I was Foxy president, I took the motto of preventive care. And preventive care is badly neglected because we are struggling with the curative part. We don't have time. We don't have resources. I think the time has come. We have to invest more. For 9 months, the patient is with you. You can educate her a lot. Social obstetrics, and you can do a lot on the preventive health of women, which will help and will empower them and will create so many better mothers and improving health. This I talked as an individual. When you talk to me at institution level, we are mostly handling curative aspect. We have to give more time, more resources, more thoughts on preventive. In government systems, we are loaded with deliveries and all the time you are doing that. In private system, I have realized one thing. Government has to be little more soft. We are doing the same thing, Hema. Nothing is different. But the mindset of the patients as well as the authorities have changed suddenly. You are not seen as you were seen as a chair at All India Institute. Somehow you have that medical legal threat, you have the threat of violence. I'll take this opportunity to put across, doctor is the same, I'm the same. Why a person who is doing the same service in private care, there is different eye, a different, canvas on her services. We have to change our mindset if we really want to get good care from these doctors.
Yes, it is, as you said, same person, same intention. That's how it is. Each and every doctor, they obviously want to do the best for the patients, despite all the challenges. They go stick their neck out and do many things that they're not even, supposed to do in the profile of a doctor. But still, attitudes, the moment your profile is changed, how the work doesn't change, but the attitude changes. That's a very, very fine point that Alkaji has brought forth, because it is becoming exceedingly a barrier to offer the best to our patients. I agree with that. Akhtaji, in your private setting, we heard your better half also speak at the inaugural. Is there something little differently you're doing in this COVID crisis? Has your experience drastically changed from the non-COVID era to this era?
Ma'am, I am attached with the Ujala Cygnus Hospitals. As you know, my husband, he is CEO of that Ujala Cygnus Hospital chains.
Yeah.
And ma'am, I would definitely say there is a difference in practice in COVID era and non-COVID era. Earlier, patients were very comfortable. We were very comfortable with the patients. There was a human touch. We had more number of OPD attendants. But now practice is totally changing. Now telemedicine has taken the place, and patients, they like video consultation and virtual OPD. That is, we are doing more. And I would like to tell that Cygnus Hospital is doing 35,000 calls per day for consultation. Yeah. And as far as practices is concerned, I think it is too much of stress for doctors as well, because we have to take a lot of precautions. We are wearing mask all the time. We are wearing PPE kit all the time. And too much of testing of COVID, and every day guidelines are changing, for COVID testing, especially in Delhi. and it is really difficult to get patients tested. And when we are treating pregnant patients, sometimes we have to take untested patients because patient is come in labor. And I would say here we are mostly treating underprivileged sector. We have access to underprivileged sector and women are not very aware. I know COVID ka aajkal bachcha sab janta hai, but still people don't have resources, and patients are coming into labor without testing, and we are taking them with due precautions. But definitely there is lot of stress, and practice system is changing, and it is becoming expensive because of lot of protective equipment, I would say.
Thank you, Akta. How it has impacted the doctor's mindset. And it's not only the 30% increase in the mental health issues to the public, they're saying, but even the care provider is a human being. And that angle has been very well thought out, because economy is hit on one side, inclusive of the numbers and extra investment that we've had to do in practice, as well as trust deficit, which may be probably even more eroded in these times of crisis, because neither the doctor nor the patient is in a good frame of mind. Both are, fuming at each other for reasons known and unknown. So lastly, first round of questions to Meera Agnihotri ji. You have established the WW Foundation. What is this foundation all about? What was your thought process and endeavor at the capacity of collaborating with multiple people? What would you envisage to do looking back, moving forward, the WW Foundation? Miraji, you to unmute. Yes.
Am I audible?
Yes, yes, Miraji.
Am I audible?
Yes, yes.
Oh, thank you very much for providing me this opportunity, Hema. I agree with most of the speakers, but my say, when I was professor and head of the department at GSVM Medical College, Kanpur, for such a long period, I have seen my working with the government also, and I know the way I was working with the government. We never know when the day started, we never know when the day ended. Day in, day out, we were working, and it was not the day of the head of the department only. All 7 days were you see, in charge. Head of the department is responsible for everything which is happening in the hospital. So a lot of responsibility, a lot of, but we were doing it very nicely. 7, 8 cesarean sections in the day, 7, 8 deliveries per day or per night. They kept on, just like a machine, we kept on working. And we were never afraid of anything. We have shown the best results to the government, and we have, our department has received a lot of honors about doing it. Now, when I'm in private practice, I understand that the same thing continues, but really mindset of the people changes. That now it has become paid, now it has become like this, and we are also covered by so many issues out of it. But I personally feel government is doing a lot for us, It is our turn to return back. And when it is our turn to return back, we must not look back, because government has spent a lot on us. It is the usual complaint of the persons, we are not getting this thing, we are not getting this thing. But we must understand what we are getting really. We are getting, even in the private practice, when I'm in the private hospital, lot of support is being given by the government. You thought of any yojana which is there are some or the other support to us. Now, in 2018, when President of India was with us for our WW International Conference, I have laid down this foundation, WW Foundation, which was inaugurated by our Union Minister, as well as President of India. Now, this WW Foundation was for women health wellness, for women empowerment. Women empowerment is a vague term, and I have included, submitted, addressed these for the women. One was Shiksha, Swasth, Swavlamban, Samvedana, Samyojana, and Samta. But I tell you, I agree with Alka that health issues which we are discharging and catering to the public, right from the very poor person to the very rich person, Singhanias and the others who can afford anything they want, the healthcare system needs something, because the health issues which we, suppose I tell to a patient that yes, you must get a ligation done. Ligation done can be taken very nicely. Yes, yes, madam. Yes, madam. But when she goes to her home, her mother-in-law will tell, no, you can't get it. You have got only 2 daughters. How can you get it done? Your this family will be like this. Then her nun says something. So our obstetrics is just going beyond the patient. So what I personally feel that the social obstetrics must be a part of these 6 S which I have told. So unless you teach, you taught, you cater services to the nuns and others, telling that this is important, this will happen to the patient, because patient herself, unfortunately in UP and other places I have seen that whenever we sell something, the mother-in-law says, oh, this is not the concern of the husband. This is the concern of the head of the family. And I am mother-in-law. I have to decide it. And the poor patient has to be with them. So I personally feel that unless we cater services to the whole of the family and this system is improved all around, we cannot come out of this crisis. So social obstetrics must also be added to these things. And Triple W Foundation, I will be joining head with the artists, and I'm pretty sure that I'll be able to discharge and cater the services which I want to do it for the common people. And I keep on telling, I have written it on the board also, that treating patients is my profession. Teaching is my passion, and women empowerment is my real passion, which I have to extend. So these are the things which I would to tell. These 6S have been passed by the government also, that they are acknowledging it, and the teaching and taught of the paramedics, others, to support us are very, very important. Because after leaving my office, she will be going to the paramedics. After leaving my office, she will be going to a nun and then to family. So we have to start from the grassroots. Otherwise, our success will be delayed. Thank you.
Thank you very much, Meeraji. This foundation is a foundation for women's empowerment and education. When you say why the neighboring country Sri Lanka has done so much more better, education is a common thread. Why in our own country Kerala has done better than the other? Then again, the education and the decision making empowered women, well, which is one of the key components in everything else that we struggle to do as the best thing for the patient. So this is social angle actually calls for a doctor's duty, as we have repeatedly said, beyond our technical duties, and that has been very well emphasized. Thank you very much. Now to Rishikesh again. We care, something that you said in the COVID-19 pandemic and the crisis. What is We Care all about, Rishikesh?
Actually, We Care is a organization. I mean, the thing movement developed by the Mumbai Obstetric Gynec Society. First of all, let me say hi to all my colleagues. I had the fortune of working with all of them. Dr. Alka Kriplani is our Secretary General. Nandita is of course been with me for many years. Dr. Meera Agnihotri, the great lady. I keep on every time I see her, I keep on wondering what drives her. Of course, Alpesh is doing a great job. He's lucky because he has got so much digital exposure which none of us had. He has, discovered. And then our young person Ekta is there with us, who is now doing a lot of great dynamic work. So all of you are there, and you are. Hema is actually. Do you know that Hema is my classmate from KM Hospital and GS Medical College?
Oh,
so
that's it.
she has done a lot of work. I think she is, progressed much more than we all have done. So coming back to the We Care program, this is launched by Rishma actually. Rishma is now the president of the Mumbai Society. And we are, me and Dr. Nozer and even Nandita is there in that, Dr. Jaideep Tang is there, Sarita Sarya, many, Atul Ganatra, all of them are there, Anaita Chavan, who is the secretary. So we are doing, we said, okay, let's do something because, so the most important thing is our healthcare workers. So we decided to help our healthcare workers, and we identified and we asked all the heads of department of various colleges, the COVID hospital like Nair, Science, JJ, and Cooper, Kama, all these Wadia hospital, and of course the KM hospital. So, and as we told them, tell us what you need, and whatever they told us, we supplied, and we have also additionally supplied to 5-6 more peripheral hospitals. The need is tremendous, and they are all our our children only. They are young people, and our colleagues are there. So there's no end to the need. The need is endless. As I told you that it's like I feel like even if I take out whatever fixed deposit I've kept for my retirement, I can give them all, and there is still going to be I would like to tell you that this is one thing which our Indians lack a lot. My brother-in-law is a gynecologist in USA, and he tells me that even the poorest of poor American, they donate money. Every Sunday they donate money during the church. They donate money. Maybe they will donate $5. In India now, we don't know what is donation. Majority of Indians, they don't donate for others. And this, we need to change this. We have to share our wealth. There's a something called Piketty where he's written on capital, a book on capital, and he has found that majority of the wealth is in the world is owned by only few people, and that they are becoming richer and richer. And so that's how the concept has come to create a tax on the wealthy. There has to be an additional wealth tax created. But if you look at Ted Turner, when Ted Turner sold his broadcasting organization, he got $2 billion. And out of the $2 billion, $1 billion he gave to the United Nations. Imagine giving half your wealth as donation. So that kind of system has to come into our mind, because I see doctors and all saying, what is this? Why this? But we are a community which got a fantastic deal from the society. We are educated. Every one of us has got a house. We have got a car. We can go for a foreign holiday once in 2-3 years. What more you want from society? So it is our time to give back all the time. You have to sacrifice. So many people are, they don't have 2 meals a day. So we have to, sometimes I feel I should stop eating 1 meal a day, because it's so that I can understand the starvation what others are having. So it's very important to do all these things and sacrifice ourselves.
Yeah, thank you, Rishikesh. Again, in the spirit and the joy of giving, the generosity of Rishikesh, again, having 1 meal a day is a good change in lifestyle. I think Alkaji was talking so much about the preventive care. So I think that will ultimately, in your spirit of giving, it will help you also. So it's a win-win situation for both concerned. So that's a good thought. Now, Alpesh, I know of the fact that you have brought some data to the table, collaborating with UNICEF, getting hold of really what the plight of some of the hospitals in your own geography of Gujarat are in the COVID-19 crisis. What is the kind of insights that you've got from that study?
Thank you, Emma. During this lockdown period, we have seen that the essential healthcare services is hampered. So we decided to conduct one study to know the problems what small private healthcare providers are facing. And UNICEF has initiated this pilot project and this study. Obstetric hospitals and pediatric hospitals were included, and we done this study in 670 hospitals, small private hospitals. And we came to know certain problems which the private hospitals, small private hospitals were facing. Now the study is already done before 1.5 months, so many things have been rectified and we have improved. So government is doing lots of, and because of this now we can see the improvement. But we also, after the study, we submitted the report to government. And then it was further UNICEF has worked on it. The observation in the study was a number of patients has been decreased like anything in hospitals because of fear, mainly because of the fear on both the sides, patients as well as doctors. And number two, the hours for the practice were also decreased. Those who were running the hospital were only running during the morning hours or something like that. Then the another problem was staff, deficiency of staff. So they were also having problem of fear pandemic as well as transportation problem. And because of these, the essential and quality care was also affected. Third problem which we came across was about the PPE. Now PPE kits are available across India, and now we are the exporter also. But the only still one problem with PPE kit is about the quality of PPE kits. And still we require some standardization and some quality check in PPE kits. At many places, the kits which we are getting is very uncomfortable and some problems are there. Another big problem was found was about the testing. It is accessibility and the affordability and then the number of tests and many problems were there. But now many of these problems are sorted out. But the still in India, 30% of the districts where we have improved a lot. Now we have 950 laboratories across India, those who are doing tests, but still in 30% of the district, no laboratory is available which is doing these tests, and they have to send these tests to the higher center. Suppose from one place like Nasik, just for example, I am telling, they have to send the report to Mumbai or Pune, and the report, it takes 2 to 3 days, and so many problems are there. So this is one problem. And now affordability was also one problem, because suppose in smaller places the delivery charges was 10,000, but because of the laboratory test of 4,500 rupees, and because the PP kits, 2-3 PP kits, because it's a team involved in delivery, so it also affected affordability was the problem. Rapid test kits were not available, now it is available. So there are many problems we have found that, and one more is I would suggest that public and private, we both are working as one unit. Government and organizations are also working as one unit. Private small hospitals were facing, and all were facing problem of stigma, which is now nearly rectified. But the one problem is we need to look after non-COVID patients also. And for that, private hospital, small hospital has a big role. More important is 60 to 70% COVID patients are asymptomatic, which are also seen by the small private hospitals. And that is why they also are the corona warriors. So all are the corona warriors. So we should be considered that all are working as one unit. And now, of course, prophylactic and many other problems were there. There was a long list. I don't want to go in detail of it. But the more important thing is now in post-COVID time, we need to be more cautious and watchful. I think at Foxy level, we require to come out with a checklist for the post-COVID practice, and which I am planning in all the disciplines. We can see from endoscopy to infertility to maternity services and contraceptive services. And all we would like to have the checklist. We have at present guidelines. And I think what I can see is now the hand hygiene and respiratory hygiene will become nearly the permanent thing in post-COVID time. And fumigation, frequent fumigation is required, which I see that it will also be a permanent feature in the post-COVID. And actually, I would say we do not know when the post-COVID time will be. It's an uncertainty. We can say the unlock time, post-lockdown time, but it's uncertain and it's a long time. So post-COVID time, when it will come, I don't know. But it's a difficult and long fight. We all have to be prepared for all these things. So this was the small study which we have conducted, and government has also accepted the study, and lots of improvement has been done. So thank you, government of Gujarat also and UNICEF also for this improvement and acceptance.
Thank you, Alpesh. This was very, very insightful. And also is already thinking of a checklist which will serve as a ready reckoner for all the practitioners. And ours was one of the first professional organizations in the country who came out with the good clinical practice guidelines, the GCPR, which was within a month modified because the thought process started changing. And this is the first time perhaps we're all seriously looking at the recommendations and trying to follow it, because there are so many things which are occupying our shelves, and we seldom look back because each one of us do our own things. Now, Nandita, since many are watching us, what is your advice to the women out there who are now planning a pregnancy and want to seek help from you for the assisted reproductive technology? Right time, wrong time, postpone, don't get into trouble. What is your advice?
I think that's a very difficult question to answer even at this stage, Hema, because as yet the jury is not out whether COVID really has any effect on the pregnancy or not. So far, whatever studies have come out of China or all over the world, and whatever we have even from our country, do say that the fetus is not affected. It does not affect the child, and we don't have any advisory to our women: don't get pregnant naturally. So obviously, I personally feel, because I have every day there's a patient calling up, Hema, with the question that you asked, Doc, I am getting older. I want to have a baby. It's getting late. I mean, it's already 5 years since my marriage. I want to have a child. So I think it is our duty as a doctor to maintain the safety of the patient, safety of our healthcare workers, and safety of the doctor. And now, at least in a lot of cities, at least in Bombay where I'm practicing, Delhi where we are practicing, the testing has become available. So we are definitely testing our patients, and we have started them on cycles, and we have opened up our centers to make the facility available. We are taking a lot of care, Hema. Our staff is being quarantined for 15 days. They are staying at the hospital facility. They're not going home because they should not travel by public transport. And I don't want them to go back and forth. Then the hospital is being cleaned. The patients are being tested. The doctors, if they are exposed, there's a triage questionnaire. So we are taking a lot of care. The face shields, the face mask is on every patient that enters. Every doctor is using it. We did have a case where one of the patients turned out to be positive, and she had come to the hospital every day for injections. So but we realized that we had taken all the precautions. We quarantined that staff nurse who was giving the injection. She was tested and she was negative. So, all those precautions have to be taken. And in the lab, let me tell you, studies whatever have been published so far is that the eggs, the embryos, and the sperms so far have not shown infection and multiple washing. I think that's going into a lot of details on this platform. But IVF is proven to be safe if you take precautions, and the labs are all air filtered. We have HEPA filters, we have air handling units in all our labs. So I think it's a much safer environment. So yes, I would advise the patients, if the clinic is very comfortable, that they are taking care and they are a COVID-free. I think COVID-free IVF center. I think you can try it.
COVID-friendly IVF center, where are there all these precautions? This, many people are asking, and they would have definitely taken two words of wisdom from what you have laid out.
On the other side was one person who was on the cycle, and she said, "But doc, what if I get COVID during pregnancy?" I said, "Listen, you can delay your treatment by 6 months to 1 year because we are not sure." I mean, if you become pregnant and get COVID, I really don't know what might happen or what might not happen. So you need to, it's difficult. I know I'm pushing the onus onto her, but that is something.
Nandita, as OBGYN community, some of you who are in the fertility practice can make these choices for your patients or can help them make their choices. But so many of us in the obstetric practice, another 20 million deliveries have to happen in the country in the next 6 to 7 months. That is the UN data. So we have to anyhow deal with it, because everything can stop during the pandemic, but not the menstrual cycles and not the pregnancies. Yes, Rishikesh.
Hema, can I? Yeah. So
please.
basically, the other aspect that has to be looked at is that we are going into a lot of financial difficulty, because though the delivery is a base of all our thing, but not, because I was even talking to the pharma that the chronic, the dispensing is okay, but the new medicine, they are not. So the incomes of pharmaceuticals has also dropped down.
Right.
That can percolate into difficulty in sponsoring our CMEs, etc. as well. We will have a lot of financial difficulty, lot of hospitals, because we are also MSMEs. So unfortunately for us, the government has sanctioned for us MSME. For example, we have applied for a loan immediately. 30 lakh loan you are getting if you have got a proper turnover, so which can be paid later on, because we have to also look at the payment of the employees. So the incomes have dropped down. So the same problem which the factories are facing, the same problem doctors, because doctors, medium size and small size nursing homes are like small factories only. So they are also facing this problem. And so the next 2 years, we need to focus on how we are going to support our own doctors. There may be financial, a lot of doctors have also taken EMIs. They are going to face financial problem. And I hope that Dr. Alpesh, our present president, will also think of these things, because these are going to be a big issue in the next 2 years.
Rishikesh said present, we have thought for the insurance scheme, that very well. And
right, yeah, yesterday only it is come and it is the best scheme.
Rishikesh,
Yeah.
even the patients are having problems, so they are not getting.
Yeah. That's what I'm saying. So
it's a whole vicious cycle.
the elective practice, even Dr. Alka Kriplani, for example, if there's an endometrioma, they'll say, "Acha, nahi, we will postpone it to after 5 months." So the elective practice, which is a very important practice. So we have to talk about the finance also.
I think this is a very real and an important point you have brought forth, because despite anything else that is happening in our lives, we are expected to provide service, and most of the times free service, most of the times concessional service. But then our outgoing payments, etc. This is also another angle why the private practitioners are looked at with a different lens, because they think that we don't have the problems which the other sectors and segments do have. So this is a good viewpoint that you have placed, Rishikesh. Alkaji, he told about postponing cases. Maybe just a few weeks back, we were reluctant to do the laparoscopic surgeries, because we said aerosol producing procedures and GA, etc. And actually, some of the surgeries were pushed ahead because the patients were very keen. They don't want to compromise and have an open, and it may not have been the right thing to do also at that point in time. So as on today, what is your advice to the patients out there who are wanting to sort their dilemma between, should I just go ahead and have an open, is that quicker and safer, or should I resort to waiting a little more and having the technologically more savvy whole surgery?
Thank you for asking this question, Hema. I'm basically an endoscopic surgeon. Whole of my life, I haven't seen anything changing my life so much as this COVID has changed. Never we were sitting idle for so many months. There was hyperreaction also initially. And being an endoscopic surgeon, I have realized that whatever studies are available, it is never in the peritoneal fluid. It is unnecessary high. See, everybody is at risk of COVID, whosoever is stepping out of their house. Most important is cover your nose, mouth and eyes, because this is the place from where it is going. So risk of GA is there, because endoscopic surgery you have to do under GA. But when you ask me, doing laparoscopy or hysteroscopy, it is not in the peritoneal fluid. It is not so. For past few weeks, we have started our elective surgeries, but the issue is, initially patients were requesting, when government was putting a danda of lockdown, they were anyhow coming and getting operated, are willing to get operated. Now patients are scared. They come and they ask me, Madam, yeah, I need surgery, but mujhe COVID to nahi ho jayega. To looking into eye to her, I say, I don't know. I can't guarantee. But all these twisted ovarians, ectopics, and today also I did one cesarean scar ectopic. All these surgeries we are doing endoscopically, taking all precautions. I would like to make one point here. We are fearing so much in the OT. I am doing endoscopy, whether there will be transmission of COVID. Simple transmission in country is happening because very few people are following real social distancing. We are renovating house, so I have to go to market. Every place I go, their mask is below the chin. I tell him, भाई साहब mask ठीक कर लो. He says, madam अभी तो अपने लोग हैं आस पास. ये अपने लोग, what is that अपने लोग? They are going to people. जब हम, then they say my nose is irritating, my ears are irritating. Nobody is following proper. And I tell you, the most important is covering your nose and mouth, which our mask is below the mouth. General public says we are not used to mouth. And in poor people, you see, they are in the gathering, they are not. These people are spreading. In my OT sister positive corona, my labor room sister positive are not getting from hospital. They are getting from places they are living where they are not using masks in the surrounding area. They are not able to or not following social distancing. That is a big problem why COVID is expanding like anything in the country. So we people are educated. We have to educate people much more for social distancing.
Yeah. Thank you, Alka. I think every opportunity, like how you said, even in the market, you didn't stop telling people what they should be doing, because many more people telling like that, then it probably gets re-emphasized, because the attitude of apne log, because there is so many advertisements going on and everybody is actually putting up the posters and saying, but the real message has not probably gone in
Yes.
to their heads. So there is a gap there. Akta, coming to you. COVID, non-COVID, सभी भेलपुरी जैसा mix होके आ रहे हैं patient, underprivileged, तो आप कैसे संभाल रहे हो? कर रहे हो?
Ma'am, actually, we are trying to test patients when they had to undergo some surgery. And like Dr. Alka said, when COVID hit the country, initially we were not doing elective surgeries. But we cannot postpone it forever. One day we have to start elective surgeries also. And definitely we are always doing emergency surgeries and semi-emergency. But there is definitely lot of stress and there is fear for patients, for doctors, and patients are scared when they come to hospital. They will catch this deadly virus. Patient is going to give us virus and and patient thinks patient has to start abundantly.
So have you refused
Definitely
some
there
patients?
is risk. She can catch infection. What about it?
Okay. Taji, there is a blame game on some private hospitals saying नहीं आपको हम admit नहीं कर सकते. That has it happened in your hospital? Have you refused a patient and then they have gone and complained?
And there is lot happening in private hospital. I remember earlier when only COVID designated hospital, they were supposed to admit COVID patients. And one of the patients, she was COVID positive. She has, उसने अपनी report छुपा ली, and she came to me कि मैम आप मेरी delivery करवाइए. And but we could discover through ASHA worker that she is COVID positive. So patients are hiding lot of things. And doctors definitely are at risk and lot of things happening every day. But definitely private hospitals, they are not refusing patients because now guidelines in Delhi, they are changing and every hospital is supposed to admit COVID hospital and private hospitals are taking COVID patients.
Thank you, Atta. Meera ji, your prime question now. अरे रोज government के guidelines बदल रहे हैं. एक हफ्ते में 500 guidelines लेके आ रहा है. So you have got your own people in the government as well as your connects and contacts. What is your take? And it's not causing so much confusion. आपके यहाँ कैसे आप संभाल रहे हैं इसको? Because educating the patient is one thing. Educating the peer group. अरे ऐसे अभी home quarantine का ऐसे rule बदल गए. अभी ऐसे testing करने का वैसे बदल गए. How you are reaching people and what is your take on this?
Sima, we are strictly following the government guidelines. We cannot get away from the government guidelines. We have to be with the government guidelines only. They keep on changing, I agree. But whenever there is a change, they just involve the persons concerned, especially the health authorities, in deciding it. So whatever we do, it is in our favor to protect the doctors who are treating, to protect the patients whom we are treating, to protect the relatives of the patients whom we are treating. So we just can't blame the government. They keep on changing the government rule. They are changing the government rule in collaboration with the health authorities themselves. Earlier, it was told that you have to keep the hospital closed and only emergency have to. So we were dealing only emergencies. Now, only a couple of days back, they have started telling that yes, you can open the hospital. Then there was a law telling that after 10 p.m. nobody will come out. Then there was a slight difficulty in transferring the patient to the hospital and getting them admitted. But I tell you, right now we don't see any problem. The supply of the mask, the supply of the kit and everything. We are managing it so nicely, but we have got two different hospitals. COVID hospitals are different and general hospitals are different. Only a couple of days back, two hospitals were converted into COVID hospitals and they were asked not to admit the normal patients. And the hospitals around this hospital, they have also complained that if this congested area gets a COVID hospital over there, then other hospitals are also involved. And that is how it was shifted to some other place. Now these COVID patients are very properly taken over. The administration is taking care like anything. And you must have seen that in Uttar Pradesh, the situation is handled very nicely and things are coming to the normalcy very soon. I can tell you, Hema, that I was chairperson of the AIDS committee when this HIV was in its infancy. That was the year, I think, 1975-80. It was very much in infancy. I have represented India in the FIGO also. But pandemic comes, it changes our mindset. It becomes a hauwa to everybody, and we are all afraid of it. And so is with COVID. We must be mentally prepared that we have to live with COVID now. It will not disappear tomorrow. It will not disappear day after tomorrow. So we have to live with it. And the way we have tackled AIDS, it is different from AIDS, I understand. But we can live with it and we can continue to live with it. Recently, while I was there on the webinar, I have received a letter from, since I'm chairperson of the committee of research and ethics, there is a government letter telling that they are going to have this vaccination trial very soon. Maybe that our Prime Minister launches it in 15th of August. It has come to our medical college.
Covaxin.
Vaccine.
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 Yeah.
This COVID vaccine. So
Yeah.
its trial will be there. So I didn't read that letter very properly, but it was a thrilling letter because the person who has brought was very excited. So being chairperson of the ethics committee, I said, yes, naturally it has to be passed. So what I understand, if the vaccine comes and that too in third trial, it will be a very good thing. So we must not be very panic. We must be very patient. We must follow the guidelines of the government. And I personally feel that we can avoid COVID. But if the Alka was telling कि हम नाक खोल के बाहर जा रहे हैं, घूम रहे हैं, so how is government in the picture? That is our baby that we are spoiling it. So we have to be very cautious and must listen to the guidelines. Prime Minister is there always on the screen. Chief Minister is talking all this. But if we are not listening, it is our fault. Otherwise, we can handle the situation very well. COVID patients are coming, but their virulence is coming down. The intensity is coming down. The mortality is coming down, and morbidity is also improving. So I personally feel after being AIDS era person in COVID era, we will also be doing very good. We cannot refuse deliveries. We cannot refuse deliveries. We cannot refuse bleeding patients. We cannot refuse incomplete abortion. We have to deal them. We cannot refuse ectopic. We have to do it.
Thank you, Meeraji. I think Alkaji, what she meant was that the imposition of the rules also is the responsibility of the person themselves. They have to understand and they have to follow, and government can only do this much. That was also what she meant, because police coming with a danda and telling Abhi ye pehno, ye mask pehno, and fining them is one part. But each citizen responsible and they understand what they have to do. That will really, break the chain of this whole, and we will, of course, we will learn to live with it. Last round of rapid fire questions. I will begin with Meeraji only. I want each one of you to reflect and tell whether you became a gynecologist by choice or by chance, and either way, are you regretting it or you'll give a positive message to all those waiting there, get into this profession? Meeraji.
Hema, it's a very
that will be your
question.
message to the audience. Yes.
It is a lovely message. It is a lovely question also. By chance or choice, I will say both ways. By chance and choice. My uncle was a doctor, very good doctor, and one of my aunts was a member of parliament in those days when I was 10 years or 11 years old. So I had a pressure that your marks are very good, you must go to the administrative services. And my uncle and others, they were telling you must become a doctor. Then my youngest brother was born when I was 10 years old. So I saw my mother in agony. And civil surgeon was supposed to be a very big person in those days. It is big even today. So I know that coming with white coats and rounds and the glamour and the glory, which I used to see, it has fascinated me that yes, I must appear for PMT. Unfortunately or fortunately, for IS services, minimum requirement was graduation. And for PMT, 17 years. So I was 17 years earlier than graduation. Therefore, I have to appear pre-medical test. And I got selected in King George's Medical College and Agra and Varanasi. They were all separate at that time. Since I got the highest marks and position and scholarship, so I joined King George's Medical College. So, but I am proud of being a doctor now. And I personally feel that I have given up my idea of going to the administrative services. Once I started getting Purridge Medal and Chancellor's Medal, so I thought medicine is just wonderful. And now I personally feel that I have lot to do, a lot to do. The sands and waters are very vast. The earth is vast. The oceans are deep. and I have to do a lot before I finally sleep. Thank you very much.
Oh, great. That's a great message. Everybody is really wanting to do many things all the time. Atta.
Yeah, ma'am. I will say here, I would say it is definitely by choice and not by chance.
So women empowered.
I come from a middle class family, and I was straight A student, and I always wanted to be a doctor, I think from the very beginning. And my father definitely played a big role. He was very supportive, and I remember in first attempt I could not get through, and I joined BSc. Then I thought, it's not my thing, I can't continue with this, so I just left in between without thinking, and then I had my second attempt, and I got very good rank in CBSE examination at that time. So I got through. MBBS journey started. It was lovely. And in our college, I did my MBBS from PGIMS Rohtak, Haryana. And in our college, there is maternity duty in third year, where we are supposed to live near labor room. There is a hostel, and we have to stay there only. And we are not even allowed to attend routine lecture theatre also. We just do labor room duty. We are seeing antenatal patients, conducting delivery, and assisting cesarean section, ectopic pregnancy, etc. And at that point, I had decided I have to become a gynecologist. And I strongly feel for women, and I am very happy I'm a doctor. I became a gynecologist. And my message to all the girls, women, I just want to say, you should follow your dreams. Marriage can wait. Make your career first. You should be financially independent. That's the way you can lead a productive, good life, and you should take care of your good health. That's it. Follow your dreams.
Thank you so very much, Akhtar. See, this is the passion which is woven into what they're actually reflecting in their work through their lives, and that's what speaks volumes. Alkaji, it'll be interesting insights.
Be very honest, Hema. At that time, I didn't realize that I have to do something great. But the thing is, being from a middle class, modest family, having 4 sisters and elder 2, getting into medical college, and all 4 are gynecologists by now, and 3 were university toppers. We were good in studies. So we thought, parents used to think, for a girl, what is a good career? Either engineering or medicine in those days. So ठीक है, डॉक्टर बन रही है, लाइन से किताबों का भी खर्चा बचेगा, एक के पीछे एक पढ़ती जा रही है. But out of mind, all 4 are gynecologists. So, but biggest thing then I realized in life, if you were very good in studies, you used to get gynae easily. So got gynae. I didn't have that being a gynecologist, I will do this, that. But today, the biggest satisfaction in my life is that I am a teacher. I have touched life of so many students, not only as gynec. I always say you have to have social obstetric gynae, and doctor has big responsibility even for students, being a teacher, to guide them in their personal problems, not only in their theses and all. And having that thought, I have only one thing in my mind all the time. Where are the teachers? They were at my time. The teachers were taking so much responsibility. So this thing always haunts me. What will be the next generation? We are not giving enough to teaching and training. Teaching training is getting, commercialized so much. Nothing wrong in it. But what basic training we are getting in medical schools, we need to have good role model teachers more and more, to be, having role models for younger generation. And I think that became my aim somewhere. And I'm very happy and satisfied that I did my duty so honestly on that ground.
Thank you, Alka. I think, your point about dwindling role model teachers is so correct. But we have the technology today. All of you role models are at one place, being seen and inspiring so many who are seeing us. So even though the numbers are few, everybody has an opportunity to see and hear them and learn from them. So that is, when something is minus, many other things are plus. That's how I would look at it. And we are proud to have all of you as assets in our organization for the community and the society. Looking at Nandita, anybody would think, oh, he is our diva and the glamour girl in the beauty with brains and this, that. You should see the kind of admiration and the comments that she gets from generation next as well. So Nandita, what was your background? Dance or choice?
I think I want to take inspiration from Mahatma Gandhi, who actually said, the freedom movement of India, he said, was his destiny. So I would like to say that OBGY actually was my destiny. My parents always wanted me to become a doctor, right from when I was a 5-year-old, ki ye doctor banegi. So it was ingrained into me ki my doctor banungi. So there was no question about it. I went into medicine and, I got into gynac also. And then at that point in my life, it was fantastic surgeons, C.N. Purandre, we had JJ, we had Shirodkar. The legacies which were there were amazing. Sareya, Shirodkar. And there was technique versus technology. Technology was this fantastic IVF and, fabulous, futuristic, totally. So I really had to I was confused. Oh my God, what fabulous surgical skills you can really do. And then, of course, I took a path which was less trodden. I followed Dr. Rishikesh Pai over there and I went into IVF. And the best part about that profession is you see this little life which you've created under the microscope. It's, cells. And then I love to deliver my patients. When I do a cesarean and that cells comes out as a human being, alive, kicking, crying. I think that joy you cannot get in any profession. I just love my life and that joy. You change life, not of that woman, you change life of that whole family. I cannot thank God for I could not have done better in any other field, Hema. I love it. I just can't imagine being anywhere else.
These are some of my lovely people who love everything that they do. Wow, wow, statement by Nandita. That's good. Rishikesh, I know that we were all inspired by your father, Dr. Datta Pai, who has, I cannot even imagine how much more he had done and what we took out of that. So what has been your journey when you entered the field of medicine?
Hema, basically I was born and brought up in the, like I would say, shadow of my father, who was such a big man. And, he was very poor and he went to Harvard and he came back and then he did the director of family planning. And, I was overawed by him. When you are staying with such a man, he got Padma Shri. Of course, he should have got much more. But so when I actually, I was in two minds whether to take engineering or medicine. And he said, you do what you want. Then I, of course, whenever you are told to do what you want, to take the thing. So I took medicine. But I was a very confused soul. Like throughout the MBBS, I didn't know what was happening to me. Then again at the MD level, I wanted to take preventive medicine. He was the head of department. I got highest marks in PSM and I said that I would like to take PSM. So he told me that there is no money in it and people will not respect you. He said that people will not respect you. I am different. I came from a different background. You need to become a surgical person and then implement public health. And so I said, okay, fine, I'll listen to you. And that's how I took gynaec. Again, when I did my MD, everyone, you knew I was with you as your colleague. I again was confused. At that point in time, I didn't know what the hell I was doing. And again, I said, okay, that Dr. Indira Hinduja was doing some dabbling in IVF. I said, maybe this is a good new thing. Let me do it. So everything came by, just out of chance. So I went to Australia and that's how I went into IVF. And then it's like a full circle because that helped me to come into Foxy and hopefully, becoming a Foxy president, and all of them are there here. And it gives you a lot of, options to maybe contribute to changing in public health. And this probably the circle is getting complete now. And now I am getting into public health, but from a different route. I'm getting into public health. So I feel that overall, maybe the destination, ultimately, I reached the destination, but by a very wrong, circuitous kind of route. But of course, if you ask me, I am very happy with my my life. When I look back, and as I told you, becoming a doctor, it gives you a lot of things. It gives you financial satisfaction. You get security. You have a lot of access to do public health. I feel pity about Rotarians and all because they get into Rotary because they want to. The business people, they don't know. They have to do public health, so they get into Rotary line. here every moment we are talking about social service. So our profession gives us the both parts of life. It gives us the part.
So what has come across is, this generation whom we are speaking to, mostly the engineering and doctor, there were the only two choices perhaps, which were broadly laid out, and, by destiny, by chance you went, and now you're thriving. And preventive medicine, which Alka talked about, social medicine, which Miraji talked about, preventive and social medicine, your father's dream, you're going to fulfill in more than many ways, Rishikesh. So congratulations once again for your futuristic thoughts and the position that you're going to occupy. Final last 1 minute closure by Dr. Alpesh Gandhi, the president of the FOXY, which is Federation of Obstetrics and Gynecological Societies of India. All of us, the members of FOXY, 35,000 are before you, offering our services in partnership to any sector of stakeholder. Alpesh.
Hema, 1 minute before Alpesh starts, I would like to say that Meera Agnihotri is also like an honorary president of FOXY only, because she has done so much that she is as good as all of us have been as president,
Digitally declared. Yes.
Thank you very much.
Yes, Alpesh.
Emma, can you repeat the question? Sorry, I was...
No, I was just saying that the choice in those days used to be only engineering and doctorate, and by default many of us made the choice in that sense. But then everybody who has taken this has a larger purpose than just the back and forth professional identity or entity. So what was your reflections on how you got into this? Any regrets? Any pride? How you move ahead?
As everybody has told and you have mentioned, during those days we do not have much choices, only medical or engineering were the... Now at present generations have many choices. Even my son has done IIT Delhi from BTech from IIT Delhi. He could easily get in medicine, but he has not opted medicine. I opted medicine with choice. Then I opted during post-graduation time, out of 15, 20 available options, my choice were only two, medicine and gynec. I could not get in medicine because of few marks. I was having less few marks, so I have selected my second choice, that is gynec. And today I am happy, I am proud that I could take care of so many thousands of women, to bring happiness and joy to their lives and their families, and I could work to decrease the maternal mortality of our country. I can get an opportunity to work for the obstetric HDU, ICU, and I could also get opportunity during this COVID-19 time to continue the essential maternity services, abortion services, and family planning services, and many more things. And now I wanted to work for the supporting aspects of the critical care and high-risk pregnancy, that is making blood components available across India, because in 30% of the medical colleges, 40% of the medical colleges, it is not available. For the capacity building of our staff, and for the pre-conceptional, why they should become critically ill. Now I wanted also to work on these aspects. So the pre-marital counseling and pre-conceptional counseling is, I wanted to emphasize more on that. So as everybody has mentioned of preventive aspects, this is one also we can say preventive obstetrics. So pre-conceptional counseling and pre-marital counseling, I now going to work on it once critical care HDU, ICU are there. Now my next aim is why they should become critically ill. So thank you, because of my patients and FOXY, and because of destiny, I could get all this opportunity. So I am happy, I am proud, I am satisfied with this, my choice.
Excellent. Ladies and gentlemen, this is the president of FOXY who is speaking to you, representing each one of the 35,500 members who have the same mentality, the same jasba or josh, the same enthusiasm, the same keenness on wanting to do more. We have done a lot, but we are looking back with satisfaction without any regret. But we have a long way to go. That also we are very well aware of. And once again, I place on records my humble gratitude to all of you this Gratitude Week, brought to us by the IHW Council. CEO Kamal Narayan has joined us back. And there are two little children, Aryan Gupta and Shashwat Gupta, who are waiting in the wings to thank each one of us and offer their gratitudes. And on my own behalf, all my Foxy galaxy of stars, Dr. Alpesh, Dr. Nandita, Meeraji, Ekaji, and Rishikesh, my heartfelt thanks for deliberating. I said to everybody, they'll say, and they have really done their job from their heart. Doctors are going to be also having in the near future, endorsed by the government, a petition which we request all of you to sign. Yesterday was a great initiative by on the July 1st by Dr. Alpesh on organ donation. This is yet again to acknowledge the sacrifice made by our warriors, just like the war memorial, the memorial for doctors who are warriors in a very special situation. That is the vision of HW Council through Kamalji that has been placed in front of the government, and there is complete support and endorsement for that. So we hand over to Kamal and request him to tell our little children where our guests will stand by to very humbly receive the gratitude from Aryan and Shashwat. On my own behalf, namaste and thank you to each one of you for very spontaneous deliberations in today's panel. Thank you very much.
Yes.
Aryan beta, Shashwat. Yes, Aryan, we are ready.
Yes, ma'am. Hello, I am Aryan Gupta of St. Columba School. I have written a poem to pay tribute to the warriors of this pandemic, our doctors. Serving humanity is a joyful ride. Conveying facilities voluntarily makes you contented and satisfied. Today, the threat of COVID is traveling the entire land. Offering a shoulder is like being God's right hand. The world is waiting to see children gang making castles on the sand. Saluting our real life heroes, working 24 hours, protecting us and facing a numerous hazards, looking at everyone with an equal eye, advocating secularism is flying high. Yes, it is your selfless dedication that has made us proud. Stepping up marks you as a special one of this crowd. Dear doctors, this is for you. Thank you. Thank you very much.
Thank you, Aryan. Thank you very much. Shashwat is getting ready now. Go for it, Shashwat.
Namaste everyone. I am Shashwat Gupta of Class 3B from St. Columba School. Today, I am here to show my gratitude towards all the doctors, nurses, and the helping staff who are in the front line and
side wali.
a big thank you to all of you. I'll start with two beautiful quotes dedicated to you, followed by a poem. Dear Thank you. If the only thing you say in your life is thank you, that would suffice. By Mr. Edward. God gave you a gift of 86,400 seconds today. When you knew what to say thank you? By William A. Ward. Doctor. To earn the title doctor is an honor. It is true. Crucial of a lifelong dream achieved by just a few. It's a journey that has brought you to this time and this place where you can make a difference with each challenge you face. But still the wisdom you acquired is only just a part of the thing that makes you special, the kind and gentle heart. And when a doctor cares as much as you sincerely do, the world becomes a better place, no doubt because of you. Thank you, Corona Warriors, for saving our lives.
Thank you so very much. And I think this was a very fine closure. Our gratitude to Kamalji, IHW Council, and all our panelists on behalf of all the viewers and personally by myself. Thank you very much. Namaskar. Over
Thank
to
you
you,
so
Kamal.
much, Dr. Devakar. You wonderfully conducted this session, and I was really, humbled and very, very, you know, it was wonderful to hear that how doctors were describing that whether by this because of chance, choice, or destination, you became doctor. But what you did after that is absolutely wonderful, and you are really helping every human being, and especially the panel of doctor we had about caring those mothers, those women, and I heard that how you are helping reducing the maternal mortality rate. The idea is that everyone, each one, every woman, every mother should keep getting that health care, and I really salute all of you for doing your wonderful work in that area. Now our next session is going to be, as you know, we are actually tracking the whole life cycle of a human being and trying to identify that how doctors play an important role is there. So as we have heard about pregnancy, maternal health, and infant health, we are now going to move towards the children health. And as you know that the childrens are the future of any nation, and so is for our country. And there are doctors who are doing their wonderful work in making the children achieve their life's potential, saving them at a time when they are maximum vulnerable. So let me go through the new session, and I'll introduce our esteemed panelists also. So the next session which we are going to have is Saving Children, Saving Nation. And there are doctors who are working with a clear purpose of making this happen. Children are the future of our nation, and therefore their health is not only the concern of the parents but also of the country. However, we probably cannot say that India took great care of children, going by the numbers. But according to UNICEF, 25 million children are born in India each year. That accounts for nearly 1/5 of the world's annual birth rates. We have not been able to do much on that in some areas, but the kind of lives we are now able to save with the modern medicine and with the doctors like you is really a heartening scenario now. There are many regions that we are seeing that children still die before they turn 5, but there are a range of problems that can continue to affect them throughout their life as well, or post their 5 years of age. For all these disease areas, and to make sure that no disease, disability, or defect lead to a life where they cannot make the maximum optimum uses and realize the potential of it. We have doctors who are working day in day out out for these kind of patients group. I would now introduce our panelists. Today we have Dr. Prakash Singh, who is also a soldier doctor. And the theme which we are carrying for last 3 days in our 7-day long gratitude week is that we need to bring about that emotional and social support for our doctors who are working like a soldier for our health. They are our guardian. And Dr. Prakash come from that background also. So he is not only fighting the diseases, he has also fought on the borders. So he is director and unit head of neurosurgery at Max Super Specialty Hospital, Saket. And he has been a doctor with the Indian Army and is a recipient of Vishisht Seva Medal by the President of India. So thank you so much, Dr. Prakash, for joining on this special session where we are talking about the role of our doctors in saving our children from all kind of diseases. We have Dr. Sumit Mrig. He is the principal consultant and head of department of ENT at Max Super Specialty Hospital. He is one of the youngest cochlear implant surgeon in India and Asia, and has already conducted more than 250 cochlear implants in pediatric and adult age population so far. We have our third doctor, Dr. Vikas Dua, is the additional director and head of pediatric hematology, hemato-oncology and bone marrow transplant at Fortis Memorial Research Hospital, Gurgaon. Along with his team, Dr. Dua has also done more than 200 pediatric transplants and is known for excellent outcome in stem cell transplant. Welcome, Dr. Dua, on this panel.
Thank you, Kamalji, for the kind introduction. Thank you.
Before I go to discuss that, what keeps you, all moving on in your profession, ensuring that you are bringing that kind of the health, the boon of health to the children who are our future. I would like to hear some of the stories of the real patient who actually experience that what it means that when you have a certain disability or certain defect or a disease which makes you not live life that in a fulfilling manner. So I have a patient, I think her name is Ria. She has joined us today. I like to hear from Ria that, Ria, what was your experience and what happened and what kind of help you got from the doctor? Is Ria there?
Yeah, I think they need to unmute.
Want to say something, Ria?
Yeah.
Good afternoon, everybody. Good afternoon, everybody. I am Ria Ghai. I study in class B1.
Do you like a machine?
Yes, I like a machine.
So I think let me add a few things before she speaks. So Ria is my daughter, and myself Rahul Ghai, and I'm a qualified chartered accountant working as vice president with Barclays. So yeah, we got to, first of all, I think I need to take this opportunity to thank the godlike creatures on this earth called doctors. So yeah, real thanks to you guys, because I think you've been the one who've changed our life and helped us lead a very normal life. We got to know when Riha was 2.5 years old that we always thought she's not speaking, but then we realized that she's actually not hearing. So the world turned upside down for us. Like, so if you realize that we're from a happy-go-jolly family, everything was going fine, and all of a sudden we understand my daughter is not hearing and she'll never be able to speak. I think that was the time when the world turned upside down for us. I think it took us almost a month to realize, is this something we'll have to live our life with, and this is how the new normal would be for us. But then we realized, and we actually met a godlike doctor called Mr. Sumit Mrig, and he guided us. He guided us big time. He first of all educated us that no, these are certain things that can be cured. First, he guided us, yes, okay, take your time, get this thing done. There is an issue, but there is always a resolution to every issue. And the resolution came across in the form of cochlear implant. And I think that's a majestic thing. When I first heard about it, I never thought my child could speak as normal as what I can now. She is now 8 years old. We've been into in this treatment for 5 years now. And I can tell you that she speaks everything. She enjoys everything. She goes to a normal school. She can hear everything, right? You can hear everything. You love your machine? You want to say thank you to the doctor?
Thank you, doctor.
Thank you for the machine.
Most welcome.
You're the best.
The best doctor.
In the world.
I want to make doctor.
She also wants to become a doctor now because she wants to help everyone. Right? Which doctor do you want to become? Yes. Huh? Why do you want to be a doctor? And you want to help everybody because they're the best, right? So yeah, I think now she does everything. So what are your interests? What do you do the most? What do you like to do?
I like drawing and drawing. Coloring.
And
Coloring.
do you like dancing?
Yes, I enjoy dancing.
Do you like music?
Yes. And my favorite music is Lamborghini.
Lamborghini. Do you want to say 2 lines for Lamborghini? Lamborghini chalai jande ho?
Lamborghini. कल्ले कल्ले जाए जाने
Very good.
मॉडल
Very good. Very good. So yeah, I think that's the kind of relief that I get. That yeah, she enjoys anything and everything. She goes to a normal school. She enjoys music. She can do even swimming now because the technology has gone that far that she can swim along with her machine. So yeah, I think one message that I really want to pass on, and my gratitude and my thanks to all the doctors, in fact, including I think, and special thanks to Dr. Sumit because he guided us. He took us through the most difficult time that we had in our life, and he got us to a point and my daughter can speak, can talk, and she has an aim to become a doctor and can help others. So that's our small story, and we love it. We want to tell it to everyone so that everyone can go through this journey and be the ones who can live a normal life and enjoy everything. Right? Thank you.
Thank you so much, Rahul. It is really wonderful to hear this story of, a real story when when you discover that maybe God might have not given something which you can get sometime from a doctor. And I really salute all those doctors, including Dr. Sumit, as we can see the wonder you have achieved here. But at the same time, also all those people who work hard in even finding out these technologies, those who brought these technologies, those who innovated these technologies, and the doctors who have brought and made sure that the technologies are put to the right use for the right person for the right time. So thank you so much. I think we have one more patient with us. So before I go further on our talk, let's hear her experience as well.
Hello.
So, Insha, that's how you pronounce your name?
My name is Insha. Good afternoon.
Hi, Insha. Yes, good afternoon. So, please tell us how did doctors, help you, and what was lacking actually? So,
Dr. Vikas is a very, very nice person. He is very calm and he always treats his patient like his children. And वो हमेशा से सबको बहुत अच्छे से ट्रीट करते हैं और कोई भी बच्चा उनके पास जाने में कभी भी हेजिटेट नहीं होता कि जैसे पेनफुल इतना पैनिक ट्रीटमेंट में.
Dr. Vikas, what was the conditions
I can
he
add on to
was?
that. So Insha is now 15-year-old girl, and she was diagnosed at the age of 10 years with acute lymphoblastic leukemia. So acute lymphoblastic leukemia is a type of blood cancer, and she was too young at that time to understand what is actually happening with her. I think Insha, you were in class 5th at that time when you came to us.
I was in 6th class at the time.
All right. So she was
2016.
2016. So in 2016, Insha was diagnosed with acute lymphoblastic leukemia, and that too a high-risk acute lymphoblastic leukemia. She came to us with a very high WBC count.
Dr. Dua, can we get a little bit more volume? A little.
Yeah, sure. Can you hear me now?
Yeah, it's better.
All right, so Insha was diagnosed at the age of 11 years with acute lymphoblastic leukemia, which is a type of blood cancer, and that too was a high risk. So we characterize blood cancers into standard risk, intermediate risk, and high risk. And she had a stomy course at the beginning. She was given chemotherapy. The family met us for the very first time. They were staying in East Delhi, and we were actually in Gurgaon at that point of time. So they traveled all the way from East Delhi to Gurgaon. And you can very well understand when a child is being diagnosed with acute lymphoblastic leukemia and you disclose for the first time to the family that your child has a blood cancer. So what sort of things go to their mind? So they came to us. She underwent chemotherapy, and the journey was not very smooth. Initially, she had quite a number of ups and downs, and the therapy lasted for almost 2 years. And it's been 3.5 years post completion of therapy. Insha is doing well. She is in class 10th, living a normal life. She's a dancer. She dances very well, and that's how her journey is all about.
Thank you so much, Doctor. Insa, you are a fighter yourself also, and you have done wonderful, and I'm sure you will have a great future, going forward. And thank you so much for joining to share your gratitude for your doctor. But as the doctors are going to help you, you also need to help yourself and keep, looking for better in your life, because whatever impediments will come will definitely be somebody will be there, the doctors, so many people who will make sure that all your impediments are removed. So wonderful, and best of luck for you for the your very bright future. We have one more patient, and then we quickly go to the our discussion. So bear with us, doctors. We This is a gratitude week, and we want to see the real stories of people who have experienced that there is somebody after God who can help them at all kind of misfortune or in bad times. So can we hear the other patient?
I think Narayan, they are Kamal, they are having some issues with the audio. Rishika has joined us, and maybe I think
all right.
Shweta, can you hear us? Yeah, Shweta, Shweta, can you hear us? I think there is some issue with the audio, I think we are not able to hear them. Maybe we can start, and they can join in between, and we can take them again in between. Yeah.
All right. So let me then quickly go to first to Dr. Prakash. He a soldier doctor, and I'm sure right now he's taking care of a lot of patients. May not be on the front line of Corona fight, but at the same time, Corona is not the only problem our country is facing. We are facing.
Yeah. Good afternoon, everybody.
Yes.
Hello.
Yeah, Dr. Prakash,
Good.
you are audible.
Yeah, good afternoon. I hope I am audible.
Yeah, you are audible. So, Dr. Prakash, just want to understand from you what you are doing, when it comes to the diseases related to children. I know you are a neurologist. So, what are the neuro problems? So we saw a problem where the hearing impairment was treated by Dr. Sumit, and we'll come to Dr. Sumit on that. Somebody who was kind of cured of leukemia. Dr. Prakash.
Yeah. In children, we find a certain neurosurgical problem, like some accumulation of brain water in the brain, which is called hydrocephalus. So, which retards their mental growth. And if it is not treated at an appropriate time, then it causes a lot of damage to the brain. So, this is the one condition which we treat. We have two procedures. One is endoscopically, which is much better, and we also have a shunt which we do for them, so their brain grows normal and they lead a normal life.
Just one interruption. Himani, could you please mute yourself when you are trying to coordinate? Thank you. Yes, sir.
Yeah. This also results sometimes from tuberculosis, which is very common in our country. So tuberculosis also sometimes causes infection in the brain, and therefore it also results in hydrocephalus. So that also we treat. There are certain other congenital conditions of the spine, which if not treated properly will cause a lot of morbidity to the children. If they are properly treated in time, their life becomes, quality of life becomes better. Then there are patients who get some brain tumors in children, and that is the one we treat. In addition, we also treat trauma to the spine and the head, which is also quite common. So these are the few conditions which in the children which we treat neurosurgically.
Thank you so much, Doctor. You are actually treating some of the very I think critical conditions, and they can definitely be either cause disability or can cause sometimes fatality also. So wonderful. I think our other patient has got the audio fixed. If they have already got the audio fixed, can they share their experience?
Shweta, just unmute yourself.
Yes.
Yes, yes.
Madam, can you say, let us know what was the story of this child, Shweta?
Yes, sir. Hello, sir.
Yes. तो
Actually,
जी जी जी
ये by birth normal थी बिल्कुल. She is a normal child. At least 2 years before 2 years इसको फीवर हुआ था. तो इसकी पेरेंट्स मीटिंग में मुझे इसकी मैम ने कंसल्ट किया था कि ये अटेंडेंस का रिप्लाई नहीं देती. देन हमने कुछ नोटिस किया कि इसको हियरिंग प्रॉब्लम है. आफ्टर देन हमें फिर डॉक्टर सुमित मृग से मिले. इसका हियरिंग टेस्ट हुआ, पैरा टेस्ट. देन डॉक्टर सुमित ने इसका सर्जरी की. ही इज अ वेरी गुड डॉक्टर. ही इज वेरी कोऑपरेटिव, वेरी सपोर्टिव एंड वेरी फ्रेंकली विद अस.
तो ये
माय चाइल्ड
बच्ची अब सुन लेती है अच्छे से.
Yes, she is doing very well.
And she is
now
doing,
she is बिल्कुल normal child की तरह behave करती है बिल्कुल.
and she is doing good in the schools also, no, in her study.
Yes.
And everything. Thank
She
you.
is doing very good.
Wonderful. What's her name? Ishika.
ऋषिका. नाम बताओ अपना. बोलो.
हाँ.
बोलो.
Thank you.
My name is
Ishika Gupta.
Thank you, Rishika Gupta. Thank you so much for joining. So I think these are the purpose of showing these and talking to these case study was that I think these are the joy which keep the doctor moving. These this is where you start sometime feeling that okay, if I can't get something from God, there can be somebody who can help me on this. And to all our three panelists, today's session and the whole gratitude week is to find out what are those what are those traits, what are those feelings which made you become a doctor, and then go forward on your specialties, and what keeps you keep moving on that line. Since we spoke to two patients of hearing impairments, Dr. Sumit, what this problem is, hearing impairment. There is one who was fine by birth, so apparently God did not leave any gap, and then the diseases did something which was disastrous, and I think apparently what she's saying that it was an infection which might have led to this kind of hearing impairment, while we see the other patient where by birth there was some gap, and it is you can only kind of complain or lament that you haven't got or God did something which was not enough for you. So in both those cases, what is this problem and how it is impacting our children, because that is what can be a very disastrous for their future. Their whole life can be kind of not complete.
Yeah. First of all, Kamal, thank you so much for running this lovely ISW Council Gratitude Week. In fact, I have never seen such a vast, extensive Gratitude Week running for about close to a week. And I have been in touch with a few of the sessions, just trying and logging in and logging out through my busy schedule. I think I must congratulate you and your entire team. You are coordinating with top surgeons, top anatomists, physiologists, and policy makers, politicians, bureaucrats, technocrats. So, and thank you for giving us the platform and the platform for my patients. These are not my patients; they are my children. I said I have now 308 children. They are my children because they are all my cochlear implantees. I don't treat them as my patients. They are our families, and unfortunately, this problem of deafness is very vast in India, and it is all across the world. And India is no different from that. If you see, as you rightly said about the birth rate in India, that's too high. Every year, about 25 to 30,000 children are born deaf. this is mainly a genetic problem because of some genes which get manifested, and when a child is born, he cannot hear. Although if you can go back to Mahabharat, where Abhimanyu could hear everything in the womb of his mother, because the cochlea is generally the hearing organ of our body. It is mainly functional, but he couldn't hear the complete story of entering into the war zone and getting out of the Chakravyuh. So the cochlea is the main organ which is generally responsible. That's the engine of the ear for collecting the sounds, the external sounds, and processing it and sending it to the brain. Now we have chosen these two kids, lovely kids, Rishika and Ria. Both of them are very dear to me, and I'm very happy that they are doing excellently well, and they are into the society without any boundaries, without any limitations, and I feel pride in seeing them. But if you see, Ria on one place was born to absolutely normal parents, Rahul and Sanjana. I know them, and I still remember Ria's mom Sanjana was completely into tears when they came to know after the result that the child cannot hear. So her first question was, why me? Why us? Why my child? And I kept on consoling her and trying to explain that this can happen to any individual on this earth, and this is something related to the genetic makeup. But then Rahul, he has been always the front leader in the family. He has taken some good calls, and he and his wife took some time to understand the problem, but they were quick enough to take a call for the surgery, where I explained them. Luckily, we are in the era of technology, where we have reached the moon, with the Mangalyaan, and so has ENT been completely revolutionized. Um, Trust me, children who were born before 1990, born deaf, they couldn't get this technology of cochlear implant. But cochlear implant started in about 96. It is called as a bionic ear organ. So in case of Ria, the problem was that her eardrum was fine, her ear bones were okay, but the processing place called as a cochlea was not functioning, and the nerve from the cochlea to the brain was also okay. So we have a technology, what we call as a cochlear implant, where we have an external device and we have an internal device. So you can see what Ria is wearing on her right ear there is an external component, what we call as a processor. It is just like a hearing aid, but then it is much more advanced than a hearing aid. And through a surgery which lasts for about 2.5 hours, we place an inner implant which goes into this spiral structure called as a cochlea. So the electrodes go inside the cochlea, and the sound signals are transmitted from the external processor to the internal component, and the electrical signals are generated, which generally go to the brain as sound, and the child hears. So it takes about a while, because these kids who are born deaf generally need about 3 to 6 months, or sometimes even an year of speech therapy, because it is the day one when they get the implant activated. And this is where, if they get a good speech therapy, a dedicated therapy, and I must tell you, full marks to the parent, 100% marks to the parents, to sensitize the requirement of AVT therapy. It is not like a normal speech therapy, which is done for stammering, which is done for stuttering. It is a special therapy called as auditory verbal therapy, where they are taught to hear from the basic things. And I'm happy that Ria is performing excellent in the school. She has won many awards. She is doing into recitation, she is into dancing, she's into singing, she's into swimming, and of course, with great hard work, they have gone back to their life. Now, on the other hand, if you see, every year we have about 25 to 30,000 patients born deaf. But on the other hand, we have patients like Rishika, where a child is born normal, and everything is going fine, but suddenly a child can get viral infections. As you know that Uh, Fortunately, now the medicine has advanced so much that we have a lot of medical treatment available to most in the urbans and to almost few in the rural. So they can get the infections treated with good antibiotics, vaccination. The immunization program is very robust in India, but still, I cannot give you a count, because what we see in deafness is the tip of the iceberg, and what we don't see is what lies underneath. Patients like Rishika, where the family is satisfied that the child is hearing, the child has started to speak, but you never know, some viral infection may actually affect the cochlea, the hair cells in the cochlea, and the child started to lose hearing. And in a matter of 6 months to 8 months, the child who was absolutely lively, speaking, hearing everything, became completely deaf. So I would again like to, thank the parents, Sachin and Shweta. They are from a place, Tarau in Haryana, and they realized that they got the test done. They got convinced with the factor that my child needs a cochlear implant. And let me tell you, Rishika is a bilateral implantee. She is wearing 2 implants on both the ears. And in a matter of about 1.5 years, she has done fantastic. They are back to their normal life. I can see Ria is showing a painting she has made. So you see, these are normal kids. In fact, I would say that they are even brilliant in some of their skills. And every time I speak to them, every time I talk to them, they bring tear into my eyes. And so cochlear surgery is a boon. And fortunately, in our country, thanks to the Ministry of Social Justice and Empowerment, that it is done in government hospitals, in private hospitals. I started my program in private about 10 years back, and I was one of the youngest cochlear surgeons. And at that time, it was quite expensive, but now the prices have come down. I'm really happy and glad to see all the beautiful paintings she's making, and it's making me feel proud of the fact that she's back to her normal life. And but then we need to be adverse to the fact that you can treat this, but if we get these patients on time. So the family is to be very, very supportive. And let me tell you that in this era of technology, every child who is born deaf can be tested by a simple test called as otoacoustic emission, and which can be done on day one of birth. In fact, I am a executive committee member of Cochlear Implant Group of India, our national body, who looks after the cochlear implant committee and the surgeries and everything. We frame guidelines for the various surgeons in the country. And just before Corona, on 3rd of March, I met our Honorable Health Minister, Dr. Harshvardhan, and we are in the process of getting this national immunization program and integrating it with the national universal newborn hearing screening program, so that like a child who is born gets a BCG vaccination at birth, should get this universal newborn hearing screening program, which is to be implemented through the center all across the India. It has been implemented in states like Gujarat, Rajasthan, but unfortunately, when we met, the Honorable Health Minister was very keen. We had a very good meeting in the Nirman Bhavan, but the Corona completely gripped us, all of us. So I'm sure once we have this universal newborn hearing screening program implemented across the country, there will be testing at district levels, at sub-district level, at villages level, so that this problem, if we can diagnose at a very early stage, at the newborn stage, the results are going to be fantastic. Because
Thank
these
you
kids
so much.
can, yeah,
Yes,
because these kids can get surgery done, and the early we do the surgery, the results are superb.
Yes, so this is very important, and we in the last 2 days also we have been hearing some of the doctors who also said that while the society need to be gratitudeful and thankful towards doctors, sometimes doctors also need to be thankful to their parents, the patients, and that's what you also highlighted, the same emotion that the parents in these case cooperated, they understood that there is a problem, and they followed what treatment was being suggested to them. So that's wonderful. Also, I would like to highlight the point which you said, that these are not your patients, they are your children. And that's what I think the Prime Minister Modi also in his tweet on National Doctors Day highlighted, that doctors are like mothers. They give you that care, and mostly the selfless care, try to get back to you, go beyond any impediment which you face physically, mentally, or psychologically. Let me go to Dr. Dua now. Dr. Dua, so Dr. Sumit said that there are some, 25, 30,000 children who are born deaf. And that's where Dr. Sumit is bringing his expertise and these technologies to help many of them get out of that. What you are, treating children who have got cancer or many, similar problem. What is that number and how it is happening? Are they all, by birth, or they are also because of, the overall NCD being increased on our society? What is that, and how do you, bring that kind of care to them?
Don said, thank you, Kamalji. I hope you can hear me.
Yes, yes.
Yeah, thank you for making me a part of this Gratitude Week. And let me tell you what I do. I am a pediatric hemato-oncologist and a bone marrow transplant physician. So I look after children who have blood disorders, not just blood cancers. I look after benign hematological disorders. I look after cancers, whether it is a liquid tumor, a solid tumor, and I do bone marrow transplants. So answering to your question, so let me tell you, the number of pediatric oncology cases are increasing day by day. If you ask me, what is the percentage in terms of how many pediatric patients enter a cancer center? So if you see, out of 100 patients who enter a cancer center, 3 to 5% are of pediatric age group. It's not very common. So out of 100 patients who are entering a cancer center, 3 to 5 would be of pediatric age group. When I say pediatric age group, that means those who are less than 18 years of age. So it's not a common thing. But over the last couple of years, the number of pediatric cancers are increasing day by day. That the reason may be, or probably the people are more aware of it. Previously, people were not being diagnosed. The facilities are getting better day by day in our country. Probably that might be the reason, or might be the incidence is increasing. And the second thing is that what Dr. Sumit was pointing out, that their patients have genetic problems. So pediatric cancers are not genetic. So if you have to ask me, what is the most common cancer in pediatric age group? The most common cancer in pediatric age group is blood cancer. And among the blood cancers, the most common blood cancer is acute lymphoblastic leukemia. So acute lymphoblastic leukemia is not a genetic disease. Though it is happening in pediatric age group, though it is happening to even to a very small child, we have seen a 1-month-old baby having blood cancer. It's not a genetic thing. So why it happens, nobody knows. But we have treatment, we have cures. So as we speak, on 3rd July 2020, 90% patients do well. So the OS, or overall survival, for patients who have blood cancer is around 90%. And that's just by chemotherapy. Just 5 to 10% are unlucky kids who have relapses or who have issues during therapy, but 90% do well. So the answer to your question is, it's not a genetic disorder, and the prevalence, the number is increasing day by day.
So the number is increasing, and the bad part is that we don't know what is actually causing it. But at least the good part is that there is a, some kind of management available, some kind of cure is available, and you are saying that most of them, once they are diagnosed on time, are able to, come out of it, or being managed in a manner which is much more helpful in continuing the normal life. Dr. Prakash,
That's the most important thing. Timely diagnosis for these kids is very important. Timely referral to a center where there is a dedicated pediatric hemonc team there, where you have a dedicated cancer center, you have a pediatric oncologist over there. A timely referral is important, because you never know when things start deteriorating. So if you start the therapy on time, you may be able to achieve a good cure rate.
Wonderful. Dr. Prakash, so you mentioned about certain neurological disorders which are happening among the kids. But what is the volume of that, and what are the risk factors children have? And why do you feel that curing them is important? Because I think that is the life which has just started, or has a huge potential for the country, for the nation. And as I said, they are nation's assets, and
Yes.
taking care of them is the most important aspect. So Dr. Prakash.
Okay. It's important because a child brain or nervous system grows in the initial 3 years, and if that time it doesn't get appropriate environment for its growth, it's a lifelong disability. So it is important that these conditions are treated in time and prevented. For prevention, we need to have, which we have in the country, a good antenatal program, so that when the child is in the womb, there are certain conditions which could be avoided. A mother has to be instructed properly, so that some congenital anomalies doesn't occur in these children. That is one. Secondly, if despite that they occur, in that case, they should be picked up early. And clinically, they can be picked up, but to diagnose, we need investigation. So today, investigation which is available is CT scan and MRI. Unfortunately, CT scan is very harmful to the children's brain. So they should not be exposed to CT scan. At times, we find patients, young, who come with a CT scan. So we should preferably do MRI. So this needs to be inculcated, or should be make awareness in the society as well as in medical setup, that don't expose young children to radiation. So it will prevent damage to their nervous system, which is very delicate at the young age, and they don't tolerate radiation well. We don't do any CT scan till the age of 5 years in the children. Prefer MRI when required. So that is one. Secondly, if certain condition which still happen, then they must be treated at right time, so that they don't cause permanent damage, which become irreversible. So that morbidity will remain. And those surgical treatment are much better today. The technology has improved so much that neurosurgical problems, though they cause a lot of apprehension in parents, and because of the disability, as Dr. Sumit said, that the family is devastated the moment they hear that there's a neurosurgical problem to a child which they love so much. But with today's technology available, everything can be handled fairly well. So the damage can be reduced, and the outcome can be much better. Another thing which is a trauma, which is young children falling from the cot, table at home, and even little grown-up children driving vehicle and all. So these are devastating injuries, and they will have permanent effects. So we need to have that the children are looked after very well, and avoid those traumas, make home safe for the children. There are a lot of things which need to be done, but which is probably not possible all across in the country, in all families. Sometime, because we see so much poverty, the mother is working, the child is left to his own things to do, so they have injuries. So these are the preventive aspects which we need to look into.
Doctor, we have also seen, so you mentioned about that, sometimes the things are, developmental issues, or maybe, by birth. But as you mentioned, there are huge number of cases coming, or maybe coming. I just, anticipate, but you may be giving the right kind of picture on it, where the trauma, the injuries, some kind of those incidents are happening, or accidents are happening, which are leading to do this kind of problem. What is your opinion on that? How much of it can be avoided, and then how much of you have been able to mitigate it in terms of after the case has come to you, and you have been able to deliver the good result? Because every time a parent will discover or will see an accident has happened, they will come to rush to the doctor. They will feel that, okay, now the doctor, once you reach to the doctor, this thing will be cured.
Any trauma, the basic principle is prevention. Whether it is in the due to road traffic accident, whether it's at home, or whether it's a battered baby syndrome. Sometimes everybody has different temperament. The home environment is there, then child is unprotected. Parents sometimes lose temper, they bash up the child so badly that we do see cases who come with battered baby syndrome. So they are devastated. So for that, I think social movement should be there to educate people. The children's brains are very tender, the bodies are very tender, and so there should not be any physical violence on the child. That is first thing. In brain injury, unfortunately, there is a primary injury which occur because of the direct trauma, and there are certain secondary events. We can prevent the secondary events so there is no further damage take place. But whatsoever has been damaged by the primary insult, that only can cover up over a period of time or may leave some residue, whether it's in physical disability or some intellectual cognitive disability. So our role becomes to reduce or take care of secondary damage, and then it needs a rehabilitation program to recoup whatsoever you can recoup. Because children generally do better than adults because their brain is growing. So central nervous system of the brain has got that capacity that in young people it does well than it do in elderly people.
Thank you. So now I'll go to the second part of our discussion. It is about what actually made you guys to think of this medical profession, and also why you specialized in what you specialized, and what was the driver, and which is now still keeps you driving towards achieving more, saving more, when it comes to life, bringing as many smiles as possible to the people. May not be all the time. We can't expect 100% outcome every time, but I'm sure you all are also treating a age, a target group or a patient group who have very high expectation. And when it comes to children, the parents who are bringing them to you, whether it is for something which is a birth defect or something which is the trauma, the expectation is very high, and then the emotions are run very high on that, and that leads to a lot of other pressure also on doctors. So I'll go to Sumit first. And Sumit, what actually made you to select to be a doctor, and then that too an ENT expert, and then go ahead with the I think the micro specialization of being a cochlear transplant expert? You are on mute, Sumit. Okay.
Kamal, thanks. Lovely hearing Dr. Prakash. In fact, we are both in the same hospital, in the same campus, and it's been a pleasure working with sir for the last about 4.5 years. He's a thorough gentleman, and always love interacting with him. And the story is quite long, but I'll just cut it short for this one. I used to play a lot of cricket during 9th and 10th, and I was completely into sports. Although I come from a family of doctors, my maternal uncle, aunt, my cousins, they are all doctors. We have grown in their nursing homes, seeing my aunt. We just lost her about 10 days back. She was a gynecologist. My uncle is a physician. And so you can say that the seeds were sown, but it was not up till class 10th, where I was completely into game of cricket, and I was selected under 14 in the national stadium, selected for county cricket. But I met, we saw some wrong things being happen there. And this is when I decided to get back to studies. And I thought that in that time, parents only gave you the option of becoming a doctor or an engineer. And I think the ball started rolling during my senior secondary school. And I always wanted to be a doctor and a surgeon. So I, after 12th, I couldn't get into the first chance into the medical school. So I dropped it because I was very passionate about becoming a surgeon or a doctor. And I got into University College of Medical Sciences. I did my graduation, and then I gave for my post-graduation exams. Honestly speaking, I never wanted to be an ENT surgeon. I always wanted to be a plastic surgeon because I thought that it was a great branch where people could actually do aesthetics and cancer aesthetics, reconstructive surgery. So I thought, yeah, I picked up ENT, and I wanted to do MCH plastic surgery because ENT surgeons are also, they can do MCH plastic surgery. I didn't like general surgery quite a lot, and didn't want to undergo that, extensive trauma of general surgery. So I thought I'll do my MCH from CMC Vellore. And, so I got myself into Maulana Azad Medical College. I think that was the best thing which happened to me, which actually paved the way. And thanks to my teacher, Dr. Arun Kumar Agarwal, and he has been a father figure to me. He still is. And so I got into interest into ENT. I joined ENT only because I wanted to do plastic surgery. And my thesis topic also I selected in plastic surgery. And I was actually called a plastic surgery resident rather than an ENT resident. I used to work more in plastic OTs. And I never had an inclination into ear. In fact, ear is such a complex organ, I can tell you, that it is of the dimension of even just the tip of your fingers, that it is difficult to think about something like a cochlear implant into the inner ear. I couldn't even understand about the anatomy of the middle ear. But as you say that, when destiny is destined for you, you start getting your interest. So I became the in charge for the temporal bone dissection, and this is where I got to dissect few cadaveric bones, and I really got my interest into cochlear implantation. In fact, I am the founder resident member who started CI program on a regular basis at Maulana Azad Medical College. And thanks to two of my teachers, one is Dr. Milind Kirtane, who is the father of cochlear implant surgery in India. He is at Hinduja Hospital. He has been a great inspiration story to me. I used to travel to his place and to see him operate. And the second, so one was an inspiring teacher, the other was who let me grew, which was Dr. Arun Kumar Agarwal. He realized my talent and never stopped me. And I can tell you, I was one of the youngest cochlear implant surgeons, and I came into this, and I completely love my branch. I love the smile on the face of these children, the parents who come with absolutely, they are disheartened that their child cannot hear. And I'm into 10 years of being the director of CI program, operated about more than 350 patients all across the country. Now I'm into training of surgeons across the country and across the world. We started about 14 centers, and we have started cochlear implant program in Africa as well, providing training as well. So it has been a completely roller coaster journey, and my gratitude to all my patients, my teachers, my colleagues, my team, my audiologist, my therapist, and most important, my family, my parents and my wife. And, they have been rock solid support to me. Trust me, Kamal, there have been times when I have been doing camps in the interior of cities in Punjab, Haryana, Uttar Pradesh on 26 Sundays in an year. So I hardly used to stay at home because every Sunday we used to have a deafness camp in a locality where we used to detect deafness, because the newborn screening program was not that robust. And I have spent hours and hours and days of doing this testing with my team, and I really thank. And I'm glad that now cochlear implant surgery has become a common surgery. It is accessible to most of the deaf children in the country through the government program, through the private program. And I love my branch. I just love it. And every day I always follow one single motive, that getting up in the morning, if you feel that about for a week that where am I going, then I think we need to change our job. We need to change our profession. But I every day, 7 to 7 days, I feel that I have a lot more to give back to the society. And these kids actually have given me such a wonderful satiety, such a wonderful satisfaction, that I just feel like, treating deafness beyond boundaries and beyond every human being. So I'm into also adult cochlear implant program. Now we are running the geriatric cochlear implant program because they are also a neglected part of the society. And we have some wonderful stories of adults being neglected, being depressed because of losing their hearing. And now we are quite a lot of patients we have done, and quite happy to continue so. And thank people like you know, who give us a platform to share our views, our emotions, our expression. And the patients, they have to understand that every doctor, like Dr. Prakash said, these kids, the surgery is costly. It in a private sector is cost somewhere about 7 lakhs. It can go up till 24 lakhs depending upon what implant you choose. So the stake is high. The uh, the limitation, the outcome, what they want, the pressure is high on the surgeon. But I always tell my patients that I will just do my best. And you know, just with the name of God and the trust in the God and myself, I've been going through.
Thank you so much, Sumit. It's a good journey. It seems that you wanted to be a cricketer first, but I think the children had a better destiny that you decided finally to become an ENT surgeon. I'll go to Dr. Dua, because Dr. Dua, you become an oncologist, and then you know, also the pediatric oncologist. You know, cancer is a terrible disease, and you know, I think families, person, whomsoever get to know about this disease, once they hear it, it's completely a devastating you know, information. That's a different thing, that gradually, since the treatments are available, but it is never a pleasant, you know, it is a never a acceptable information for anyone to hear that they have a cancer. And that, you know, I think that's very dreadful to go to an oncologist for anyone. You know, you will be happily going to a gynecologist, you will go to a, you know, ENT expert, and to a physician, uh, you know, but going to an oncologist is dreading you know, experience for anyone. Why you decided to become an oncologist, and what is the, you know, what is that keeps you going, and then, you know, work more on pediatric oncology?
Thank you, Kamalji. Okay, so my story is totally different from Dr. Sumit's story. So we didn't have even a single doctor in our family. I was the first person to become a doctor.
Your voice is still not very.
Okay, can you hear me now?
Yeah.
Am I
sorry.
audible now?
Yeah, you are better.
Okay. I'm saying that my story is totally different from Dr. Sumit's story. So there was nobody who was a doctor in my family. I was the first person to become a doctor, and I don't think even now somebody would like to become a doctor after seeing a struggle what we have gone through. Okay, so I joined medical school because my parents wanted that, to be very honest. At that point of time, my parents wanted me to become a doctor, so we gave entrance exam, got into MBBS. And till the time I was doing my pediatrics, I did my MBBS and MD pediatrics from PJMS Rohtak. So I gave my medical school exams, got selected in Rohtak through All India, and then I entered into pediatrics. I did pediatrics for three years. So when I was in third year pediatrics, at that point of time, I realized, what am I doing? Do I really want to become a doctor, or should I change my life? At that point of time, there was nobody in our hospital, in our pediatric department, who was actually looking after patients who had cancers, who had I would say leukemias, and we were actually referring those patients to Delhi. So Rohtak is quite near to Delhi, so it's hardly 65 kilometers from Delhi. So at that point of time, we were referring all the patients to Delhi, to all India institutes, or some patients who were actually going to PGI Chandigarh. I'm talking about way back 2005, 6. So at that point of time, I thought, why don't I entered into this specialty of pediatric hemo. So when I searched for that, there was no DM program in pediatric hemo at that point of time. There was I think there was just one center, and that was PGI Chandigarh, which was offering DM program, and there was just one seat in that. So national board started their fellowship through national board program at that point of time, and I got selected in that. I got second rank in that. I took Gangaram Hospital, and I joined Gangaram Hospital as a fellow in pediatric hemong. So I spent 2 years in pediatric hemong, and then when you at one point of time, when you were in Rohtak and you were not able to manage those patients who were having blood cancers and bad cancers, and you were referring them, and coming to a point when you were seeing these patients getting cured, and living a normal life. And when we were in Gangaram, we saw patients who were treated 10 years back and living a normal life. That actually kept you going, actually, I would say. And then at that point of time, so the number of pediatric heme doctors were also very less. I'm talking about 10 years back. So the number of pediatric heme doctors, I'm not talking about general medical oncologists or adult oncologists. I'm talking about the pediatric heme people. The number of pediatric heme doctors were very less at that point of time. And there were a handful of people who were actually trained in pediatric transplants. So when I completed my pediatric heme training from Gangaram, so I thought, why don't I enter into pediatric transplants? Because the number of patients who actually need transplants are very many, and you don't have pediatric transplant patients. So there are conditions like thalassemia. So India is the thalassemia capital of the world. So if you ask me, a thalassemic patient would require monthly blood transfusion from the age of 6 months. So these patients were actually getting blood transfusions throughout their life. But the permanent cure was bone marrow transplant. And at that point of time, there were very few centers who were offering transplants for thalassemia. And there was just one center who actually had well-trained transplantation, that was CMC Vellore. So people used to travel from Delhi to CMC. So that at that point of time, I thought that why don't I enter to pediatric transplant? And there was no formal pediatric transplant training in India at that point of time. So I had to move to Singapore. So I stayed in Singapore for 2 years. I did my pediatric transplant fellowship from MPS. And then I came back, and it's now we have done more than 250 transplants. And when you see patients of cancers who had at one point of time no hope, and you bring hope to their lives, and when you see the smile on these kids and the families, so that actually keeps you going.
Thank you so much, Dr. Dua, and interesting that you are moved by something which is becoming a major concern for the country, and then as you said that we are becoming a thalassemia, or we have become the thalassemia capital of the world. So important to take care of this set of patients. Dr. Prakash, your story is definitely going to be much.
My story is probably more like Dr. Dua's. Nobody doctor from the family, but my brother sort of decided for me that you will take medicine. So after our pre-medical, he said, select biology and then get into the medicine. So we went into the medicine. My friend, after doing graduation, was interested to join Indian Army. So he said, we'll appear in the exam. Unfortunately, he didn't get selected and I got selected. So I joined Indian Army as a young. And then got an opportunity to do surgery at Pune. Did surgery, and then got another opportunity to get super specialization. I was more interested as a general surgeon in doing urology, but somehow I think it was destined for me to become a neurosurgeon. The things happened that way that I got neurosurgery. I'm very thankful to Professor Kak, who was heading the department at PGI Chandigarh, who took me under his umbrage and then trained me very well. And after that, I think it is how you grow up. It depends on how you take a challenge. My personal experience is that if you take challenges very prudently, then you are going to be successful. If you chicken out in surgery, then you will not grow. But if you are, you don't do it prudently, then you mess up things. So my basic I think instinct was do no harm. That is a basic principle of medicine. It is has been said by father of the medicine. The first principle is do no harm. So I think it stuck somewhere in me that whatsoever I'll be doing, I will not chicken out. But at the same time, I will not harm with my knife, that if you use it in such a way that your patient is get harmed. So that is what. But accepting challenges was a thing which let me grow. And God was kind that things have been very good. And what drives me is that when a patient comes to you in the OPD after surgical treatment, his relatives or patient himself is very happy. He's relieved of his suffering. Neurosurgery problems are such that they are devastating. We are the last hope for them because the medicine doesn't work. Similarly for surgery, why I went to surgery initially was we had seen during training that there's a point up to which the medicine can treat, and beyond that surgery takes over. So we had seen those things. Look, no, it's not the final thing. The final thing is surgery, and many things can be treated by medicine, but there are many things which cannot be treated by medicine. So I think that led me to surgery and then neurosurgery. And probably it's my attitude that accepting a challenge and not chickening out is what brought me here, where I am today. And I think probably it was destined, and God is kind, that things have been good so far, and I have been able to contribute in reducing the suffering of children who suffer from neurosurgical problems.
Thank you so much, Dr. Prakash. I'll go for the last round of remarks from all of you, and this is about that because one of the reason we planned this gratitude week is also to bridge this growing trust deficit between patients and doctors. And this trust deficit many times comes because a lot of those perception which are built or the news which come, and this trust deficit or the dissatisfaction also come from, I think, the over expectations from medical professionals and doctors. What is your message for them, and what has been your experience about that aspect where somebody, because everyone who comes to you, as I said, that it's a very high risk and a high stake thing for them. It is
Yes.
a very big emotional trauma. Once they bring and roll in the patient in your OT, they will expect that you will bring back and you will ensure that the life will continue, and which might have not been a case always.
Yeah,
So how do you deal with that?
That's true. I think we have to be realistic while briefing these patients when they come. What is doable, what is achievable. So that is what is there, and to be realistic. I know that patient have very high expectation at times, and which always doesn't translate, the result doesn't translate as per their expectation. So it is very important for us to have a realistic assessment of the situation and explain them. If they accept it, fine. If they don't accept it, it's their choice. Trust deficit has been, I think, over a period of time, once medical profession was put into service by law, I think it has grown. And to an extent, it is overdriven by media. And that is why this is there. We had seen big heroes criticizing medical profession for no reason and rhyme. There may be some aberration. Those aberration has to be investigated and addressed, but not to generalize it. The generalization of this aspect has caused challenge between the patient and the profession. I think it needs to be addressed at a much larger platform. The society has to realize what is achievable, who's doing what. And I do agree there's a trust deficit, but I generally find in my own thing much less. But there are people who are very emotional. They want everything to be done, or every result to be the way they expect it. It's not possible in medicine. Medicine is just not science. It's not 2 + 2 = 4. It is an art also, and there are limitations of the medicine, surgery, and the doctor himself. So certain things, I think probably God has kept to himself. I think that's how we should look at it.
Wonderful. That's what one of the session which we had, that should we consider our doctors gods, superhuman or human?
No.
I think we should consider our doctors human and who have the skills to serve the humanity, to save the humanity. But it cannot go beyond that. We should always have that there is a limitations for everyone. Dr. Sumit, you said that you are dealing with the patients again, very, very high expectation group. And once you say that there is a technology, and you have also talked about that there's a cost, and the cost sometimes is very high, and so double stake are involved in that. What happens if the result are not in line with the expectations?
See, Dr. Prakash has very well summed up. I would say that the onus is not only onto the doctor, it is onto the society as well. We are like the real partners, you know. The patient comes to us with a hope, and he always think a doctor is there to fulfill their. But then I think case selection is the most important thing. What you are selecting, are you capable of treating it or not? Number one. Number two, how you think that you can be, you will be able to fix that patient. You will really be able to provide that. So maybe a realistic expectation has to be presented. That expectation has to be understood by the parent. Now, like in my branch in cochlear implant surgery, my job is just the 10% of the 100%, just to do a good surgery. But the 90% of the job is post-surgery rehabilitation. Now, that rehabilitation onus is onto the therapist and onto the parent. So you have to make them understand that my job as a surgeon is only for 2 days, that I'll admit the child, I'll do a good surgery, the child will be discharged. But after that, the real struggle starts is how to get that therapy. So I would say that yes, nowadays the family, they spend money, they spend a lot of money, but they want quick results. But you have to understand that everything has got a cycle. You need to invest time also to get that result. Now, you are absolutely right in saying that there has been a mistrust. Of course, there is a mistrust not only in the medical profession, but in all the professions you see. And of course, media has highlighted that. I just ask you one question, Kamal. When has it happened that a patient has been treated by a neurosurgeon or Dr. Dua or by me, where the media has shown that the patient has come and given a jadoo ki jhapi to the doctor, that you have done wonderful. So we are always there to criticize. We are there to pinpoint one mistake, but we are never there when we save lives. So I think we have to become more, we have to show more of gratitude to our fellow doctors, to our colleagues, to the society, and the reciprocation has to be 100%. Once this reciprocation is there, then our society will have less of anguish, less of frustration. They will be more open to the understanding by the doctor. And moreover, I would say that this is mutual. Fortunately, India healthcare, I've had, we have my friends, parents who are admitted with COVID. My friends sitting in New York tell me that the treatment given at Max Hospital Saket or in any of the corporate sector is far better, far New York, maybe in Wisconsin. We are able to save life of patient of 80 years. I think good counseling with the patient. Always speak to your patient, whatever may be, is it good or bad. More and more counseling and more discussion is going to build that trust. And I would say to all my fellow colleagues, seniors, that I have realized that being truthful to your patient and the family is going to build this trust. That's it. Thank you.
And thank you so much. Communication is the key between the doctor and patient also. That's an important aspect, and I think everyone has highlighted over the last 2-3 days as well. And I'm happy that at least there is one thing everyone is kind of anonymous to say, that there has to be more communication between these two. Dr. Dua, your last remark on this.
So, Kamalji, I deal in pediatric cancers. So when I say pediatric cancers, we do lose patients. Nobody can deny in this world that pediatric oncology, you have 100% cure rates. So we do see patients, we do see cancers in which there is a 90% cure rates. There are cancers in which there are 40% cure rates. So it's very important to counsel these families, and we do multiple sessions before we start the therapy, and we tell them that you have to see the field side of the class. If you see the empty side of the class, you would not be able to go up with the therapy. And this is very, very important for the families, for the caregivers to understand that it cannot be 100%. The doctor can try his level best. He can give his 100%, but you cannot foresee the future. Your path should be correct. Whether you will be able to reach to the destination, nobody knows. And that's what we tell the families. Majority of them do understand, but yes, we do face problems, and if that happens, we try to tackle that at that point.
Thank you so much, all three of you, and wonderful, and I'm really grateful for Dr. Dua and Dr. Sumit to bring those patients also. And this gratitude week would not have been complete without hearing the real stories from patients also who have really gone through that life-saving, life-transforming experiences. And thank you so much for also highlighting that when it comes to the medical professional, where all of you are doing wonderful job, along with the care, concern, and courtesy or compassion, communication has also become an important aspect. And I believe that you are doing all that possible to ensure that the right care is going to your patients and your anyone who is coming with suffering to you. With this, I would conclude this session, saving children and saving the nation, of third day of our gratitude week. And the next session will be hosted by my colleague Anisha Dhavanar. She has just joined, I could see. And we are also seeing our next panelist have started joining it. But before we go to that, I'll request my team to play the anthem song, which has been especially created by our artist, Mr. Sahrawat, to give a gratitude and thank to our doctors, nurses, and the entire community of healthcare professionals. So, and post that, Anisha, over to you. I can see that Anisha is on the screen. Thank you so much, doctors, for joining on this gratitude week, and our heartfelt thanks and gratitude for your work, for your contribution to the society. Thank you.
Thanks, Kamal. Thank you very much. It was really good to have such lovely panelists, Dr. Vikas and Dr. Prakash. And I just wish all the best to rest of the speakers. And I wish you should run this gratitude week every year. There are very few people who actually, take this opportunity to get everyone on this platform. And thanks to you. Thanks to
Great initiative.
ISW Council.
Thank you so much. Thank you.
Thank you.
Thank you very much. Thank you, Kamalji, and thank you for making a part of this meeting.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
अपना सुकून भूलकर वो सबकी जान बचाते हैं। भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं।
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ફિલ્ડ ડ્યુટી તે હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ સે આપકા શુક્રિયા. દિલો ધન્યવાદ. God bless you. Thank you.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
And I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artists, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist Bengaluru. Be the health and well-being champion of the day by answering the ABCD health quiz brought to you by Team Artist from Bengaluru. Question for the day is on B, building contraceptive choices, reaching every girl, every woman, and marching towards building Bharat. What do male condoms offer that the other forms of birth control do not? Is it option A, least chance of failure, B, the best protection against STDs, C, the cheapest to use, or D, all of the above? Answer now and be eligible to be declared as the health and well-being champion for the day.
I'm Anisha Nair Dhawan, and I'm proud to welcome you to this session of the Gratitude Week, which is running from 1st to 7th July. This is an initiative of the Integrated Health and Wellbeing Council to bring everybody together to show a never seen before emotional and social support to our doctors, nurses, and the entire healthcare ecosystem. During this Thanksgiving marathon, it is our endeavor to thank our healthcare heroes for a whole week and carry this gratitude in our hearts forever, not just for one day or a week, but forever. Now, it is now time for our spotlight session, which is Rich or Poor, Every Life Counts. Experiences from India's mega hospital. Now, in this session, we will try to understand how doctors in mega public sector hospitals serve as many patients as possible. This is an attempt to understand how public sector hospitals try to serve every strata of the society to the best of their abilities. This is the life story of all those doctors, nurses, and medics who decide to serve humanity, to work with a purpose so that there is no life lost or anybody left impaired in health. Now, in this session, we'll have accomplished doctors share with us their own experiences, their own ideas on what truly works and works best. In this session, we are going to be joined by Professor Dr. Vinay Kumar Biswas. He's Head and Director of the Department of Anesthesiology and Pain Medicine at ESI, PGI, MSR, and ESI Medical College. We'll also be joined by Dr. Sanjay K. Agarwal, the Professor and Head of Department of Nephrology, AIIMS, New Delhi. And we also have with us Dr. Roma Kumar, the Senior Consultant, Clinical Psychology at Sri Gangaram Hospital. So I see at this point in time, we have Dr. Biswas and Dr. Roma Kumar with us. Welcome to this session. Thank you so much for sparing the time to come here, and thank you for sharing your experiences with us. Dr. Biswas, I'd like to start with you, and we request you to share with us your experience of working in a large public health hospital, and tell us about what an everyday for a doctor is like, and what is your number one priority when you go out to work on any day.
Hello, can you hear me?
Yes, I think
Yeah.
I'm Mr.
Thank you. Thank you for organizing such a nice integrated meeting. Should I say that from the integrated council is an integrated meeting? Because we can, in this lockdown, we can see each other, we can talk to each other. There's some great moments for all of us. Again, thanks for the integrated council for welcoming me in this gala meeting. If you see, for the last 30 years, I'm in this profession. Career started, obviously everyone starts with their career from the youngest, and gradually where we reach and where we will be reaching, we don't know. But at this moment, probably we started meeting with fewer number of patients at the beginning of the career. But at this moment, not only patients in a public sector hospital like us, we have too many faceted responsibilities. That is, most of them are hidden. That common people, they can't see that what we do for the nation. First of all, I say that large number of medical students, the doctors, they are being still produced by the public sector hospitals. If you see, the number of government hospitals and government medical colleges are still more in number than the private medical colleges. So the health care of the country, the backbone of the healthcare system, still the government is producing through these public sector organizations. And these public sector organizations is being run by public servants like us. So people might think that what we are doing, but people, difficult to say what we are not doing. See, I started my career just by meeting with patients only, but right now my morning, it starts with seeing the patients, then it goes to administration, then it goes to academic administration, then it again comes to patients, then it comes to teaching, then 24/7 it comes to the online with the patients. Because I belong to such an organization that serves to the poorer segment of the community that we must not forget. Like ESI Corporation, very few of will be knowing what does ESIC do for the country. Just for a small example, we have 6 lakh employee under our panel. Out of these 6 lakh employee with their family, we have around 70 lakh dependent altogether. Because 6 lakh employee plus their families, plus their parents, plus their in-laws. Everyone is included in our insurance scheme. But how much they are paying for us? If our maximum earning ceiling level is 21,000. So those who are earning more than 21,000 in a month, we are not including them. But from 1,000 to 21,000, to all of them, we are giving the health cover at the cost of what? Only 1.25% of their salary. Just remember, just if it is a 10,000 salary, they are giving just around 100 to 150 rupees per month. And in a year, 1,000 to 1,500. With that, we are giving 10 members in the family whole healthcare, full sum, holistic, starting from palliative care to super specialty, to neurosurgery, to cardiac surgery, to implant, to transplant, to eye surgery, to neurosurgery, everything free of cost, including transport, including after operation 10 days medicine. So I believe that public sector organization, what it is doing is great for the poorer segment of the community that no other insurance is going to provide it. So it's this focus, this forum. I'm delighted that this forum has brought me to express the concern of my organization. I'm very happy and delighted to share you that the country and the public sector is doing a great, because see, 1,000 rupees payment for 1 year, they are getting 5 lakh rupees knee replacement and a 10 lakh rupees renal transplant. So we are giving it free. Obviously it is free, but at what cost? It is the involvement of the public servant. Each and every public servant is doing their job from morning to evening, meticulously doing, until now probably you won't come any question of integrity in the public service in ESI corporation. So I'll give you a break so that if you want to communicate further, I will go to other segment of the teaching and education and research and other poorer segment beside the public sector that my organization is doing for the country. Thank you very much.
Thank you so much, Dr. Biswas. You said that for 30 years, you started by looking at patients. Now, what the general public, the view that they have of public hospital is, it's super crowded. If you don't know the right person, you will wait forever and you will not get treated. So there is this entire mafia of intermediaries, and this gives the public sector hospitals a little bit of a little nervousness in the minds of even normal people. Now, even if I have a lot of money, if I can afford private service, I know that when I go to a public sector hospital, the quality of the doctors is unprecedented. They have seen all kinds of patients from all over the country with all kinds of diseases. They have the best hand. But even if I can afford private service, I feel a little hesitant about going to a public sector hospital. Jaan pehchan nahi hai to treatment nahi hoga. What do you say to that? And for the normal patient who comes from very far off in a small village in our country, what is the experience in a public sector hospital? Doesn't have the insurance.
If they do not have the insurance, this fear was there 30 years back, 40 years back, and the fear there was expressed, it will be there 20 years after also. But over the decades, the public sector hospital is treating patients and people are going home and again they are coming. See, every day there is a queue of thousands of patients in every public sector hospital. That means there is trust somewhere. There is fear as well as trust. So the fear they have, the fear is mainly because it's the human health. It's your health, it's my health. When anyone of our family or I myself or anyone gets sick, the first of all we think we want to get the most comfortable and comfort zone where we can communicate the best in each and every moment. But obviously we all will try. If I wish I could talk with my physician whenever I need, that desire will always be there because there's the health, because if it's once gone, it doesn't come back. So that fear will always be there, and it's not 100% possible to alleviate that fear from the public sector hospital, because the time and the number of patients they come to the public sector hospital and the number of persons we work. So one-to-one holistic care is not always possible. But this is also true. Once they come to the hospital, probably they find different. Okay, they came with a lot of fear, but when they go out, probably they don't have that much of fear they had come with. And that is the reason.
Dr. Biswas, the fear is never about the treatment they will get. They are 100% sure about the doctors and the ability of the doctors, which is why they come there, which is why they wait. The only fear is getting the access to the healthcare, because there is a genuine demand supply gap. You trust the doctor, they're the best. You're just like, will I get that treatment? Because there's so much gap.
It's probably where you can play your role, because we need more number of hospitals in every community and every block. So if they have their own access in your own locality, probably this fear will be a little bit less. So if someone has to come from Jaipur to Delhi, suppose, or from Moradabad to Delhi, definitely in an unknown place, he will have more scary situation. But if we can generate more and more number of caring hospital in the locality, probably we can reduce it to some extent, because the physicians and others who are working there, they get a mix up with the community, then they become close by. That is one of the solution. Otherwise, hello.
Yes, Dr.
Okay. That's fine. Otherwise, we have to go and gradually. We are, see, what the fear was there 50 years back. Probably it has improved a lot. Over the communication skill and the medical ethics and the medical council and the teaching methodology, all have inculcated some sort of bondage with the patients, the relatives, their communications. And this time the government of India has recommended that after entry in the MBBS course, everyone has to go through 2 months of rigorous training, how to be with the patient, how to speak with the patients, how to deal with the patients. This has been introduced from the last year. So probably when it gets out, when these students come out, probably they will have more bondage, more interaction, and these things will gradually wear off over the time. I believe we have come across a lot of, and we have improved a lot, and it will also. That is the reason people are even still keeping trust in the hospital and they are coming. Obviously, at this moment, it's very difficult to say the fear will not be. Even when I go to the other, suppose if I go to Delhi and I get sick, even if I go to any government, that fear I will be. Or gradually, when you interact with the physician, gradually the fear goes out. That thing is there also in corporate also. Even if you have an insurance also, then also you have that fear, because I paid money.
Dr. Viswas, what I wanted to ask, what I wanted to get was that when you go to your hospital, you have already enumerated for us 70 lakh people you cover with just the insurance. Now, somebody who's not insured can also walk into your hospital. So when you go on a normal day, when you start your day in the hospital, when you look at a patient, does this play in the back of your mind that there are many more patients waiting after him? Does that impact the way you will treat the patient or talk to the patient?
Probably health sector is the one of the place where we complete the whole number of patients in that the same day, then we go back. In bank, probably they will say tomorrow you can collect the draft. The railway will say that tomorrow you come for the booking. In any other sector, only in hospital, whatever patients come for that day, we see all of them. At any cost, whatever turmoil we have in our mind, physical, mental stress, anything, we never allow it to be exposed. And hospital is the only thing till 3 p.m. or 4 p.m. or 2 p.m., whatever is the hospital norm, whoever's made a ticket, we see, we meet, we talk with all of them till is it 6 p.m. or 7 p.m., it's 8 p.m., it doesn't matter. We never say come tomorrow with today's ticket. That is the gracious thing that our Indian health sector is offering. I just want to highlight that hardly there will be any other sector. They will be doing the same day all things. We don't keep any work pending for the outpatient department. That's a great job all physicians are doing all over India. I think whatever stress and whatever, we never say no. And obviously, we will hardly become harsh with them. Even with so much of pressure, so much of patients around. In OPD, if you go, there will be 15 patients, right? 10 right, 10 left in front of 5. And brain is working like a supercomputer. One patient is different from the other, and other is different from the other. Still, we are doing hardly any mistake to all of them. Otherwise, your media will be flooded with such of news every day. I don't find such news in the media. I don't find such news in the print media or digital media. That means our brain computer is work superbly. Be it in the Northeast, be it in the Jaipur, be it in the Kerala, be it in the Andhra, everywhere the physicians community working for this nation and for this population wonderfully, I believe so. And also you will be watching this every day. So be it go to Medicity, be it go to AIMS, be it go to Faridabad, everywhere you see morning to evening, all OPDs, thousands and thousands people have come, and at the end of the day, OPD is empty.
Right.
So I believe they go out happily. That's why next day again people come. So there is some trust. Some trust is there.
in your OPD and not sending anyone back empty-handed. It's really amazing. Dr. Roma Kumar, I would like to come to you. Ma'am, you would have seen many patients in your lifetime. And I want to understand with you, what goes on in the minds of the patients when they go to public hospitals. And as Dr. Biswas said, that there is a fear for their lives. Is there also a fear that they may not be attended upon? The belief is if you go to a private hospital, you pay and you get treatment. But that parameter is not there because the services of a public sector hospital are affordable for everyone. So, what is the fear that you have seen patients with in your practice?
Thank you, Anisha, for getting me here on this platform to talk to all of you. I've been in this field of mental health as a psychologist for past 30 years. And I set up the child development clinic in Gangaram Hospital. So I work from Gangaram Hospital. We have, apart from the private OPDs, we have general OPDs, and we are taking care of all the people who are coming into the general OPDs. It's mandatory for all of us to maybe run 1 or 2 general OPDs, or maybe even 3 or 4, depends on which clinics we are attached to. So for me, I'm attached to a couple of clinics where in the hospital where I have to do those general OPDs. We cater to all the population. We don't just cater to the people who are actually able to only pay us. And since it's a mental health profession that I am in, sitting in the hospital setup, we do a lot of crisis intervention. We do a lot of therapies for individuals who come in. And there is the psychiatry department and the department of pediatrics with whom I am attached with. And also the other departments where people do refer cases for any mental health support. And currently, Anisha, that you must be also aware that the mental health is very badly affected of everyone because of the pandemic situation. And the hospital is completely geared up to deal with all the mental health issues. And yes, people who come to the hospital are scared. And also when people come to mental health facilities, they start feeling that we don't want medication. We are not, because of the stigma attached, and they start feeling, again, this thought is coming from the print media or the digital media, that if you have psychiatric medication, you're going to get hooked onto that medicine and you'll never get okay, or the psychiatrist or the mental health person is going to put you off to sleep and then you're not going to get better, and so on and so forth. So a lot of stigma being attached there. I think the work of the mental health professionals in the hospital is to help these individuals come out of their anxious situation, come out of their depressive states, and also as a part of being in the hospital, since it's a academic hospital also, we are supposed to also teach students of the DNB faculty in all the disciplines, and we teach them also. And also we have regular camps being held for the general public, where it is not charged at all, and that camp will cater to even the mental health needs of all those individuals who come in there. So we are catering to all the public,
So ma'am, I want to understand, when you hold these camps, do you see good turnout? Because mental health is still seen as taboo. There is still some stigma attached to it. Like if it's a free eye camp or a free gynecological camp, people will go because, eye camp, we want to get it checked out. But when it comes to a mental camp or a mental health checkup camp, what is the turnout like? And even in your everyday life, when you go for these public OPDs, do you face a lot of patients coming in, and do you feel kind of overwhelmed by the number of patients there?
Well, the patients which come in are, in my language, it is the clients who come in into seeing us are quite a few in number. And the camps, we have large numbers coming to us at the hospital. And also we hold lectures for these people, not just examining. The examination comes post the talking. So we're talking mainly in Hindi at that time, so that we are addressing the general public, and the psychiatrists are addressing the issues. Maybe it could be alcoholism, it could be substance, it could be relationships, it could be children, it could be any disorder, or it could be any mental health issue. So we first discuss those issues, which is over 2 hours. We are holding the people there and we are talking to them, and then comes the examination. And also there's a little bit, also we distribute free medication at that time, and all the therapy is also free at that time. So there is that attraction, and people do come in, and we've been doing these camps for over 10 years in Gangaram Hospital, and it's doing very well. So we do camps on various occasions, and the clients do come in there, and then we follow them up in their general OPDs also, which is a free OPD.
Right.
And yes, people are coming out and talking, and I would say that because of this week that we are talking of, were we actually waiting for a celebrity to commit suicide to be able to talk about anxiety and depression? Now we can see so many people talking about anxiety and depression. Why were we not addressing those before? I mean, it's not just a celebrity, but we have so many people who are committing suicide, and suicide is preventable. So what is it that is holding us back from even sensitizing the lay public, talking to children, talking to every person that this is preventable and anxiety can be treated? You just have to talk, and we are there to listen to you. So there's no stigma there. It's like going for any kind of like you said, for an eye camp or for dental. So if there is a physical pain, I would run to the doctor to get that help on the physical pain. But we are not seeing, in our culture, we do not even address the emotional side of the pain. We're not allowed to vent out our emotions. What will people think about us if we talk about it? So when you talk about my wisdom tooth coming out at 60 years of age, people don't say anything. Why would people talk about my emotion? And I need to take care of myself. That's what needs to be done.
Definitely. So you're saying even in your general OPD, there are a number of people who do come and approach mental health professionals, because now perhaps there is more awareness, and the work being done by our hospital to create awareness perhaps also reduces the the hesitation that people may have. Dr. Biswas, you said that in your OPD you will see all patients in a single day. So as a doctor who's consulting, perhaps you can do this. But in many public health, in public hospitals, if I have to get a surgery done, or if I have to get a procedure done, I have to wait my time. I get on a waiting list, because while the doctor's intentions are always good to see that all patients are treated on time, sometimes the infrastructure itself doesn't allow you to do everything in real time, especially when it comes to surgeries or those kind of treatments. So how can this be improved? Is it just a matter of not having the adequate infrastructure, the health infrastructure, the equipment? Could the usage of technology help better streamline the waiting timetable so that people's expectations are managed better? How can that, the waiting time be managed in public sector hospitals?
A nice topic you have raised, because whichever, maybe even in corporate hospital also, it's not that if you go tomorrow, day after tomorrow, you can be operated. So there are two reasons for the delay or postponement from your visit and the date of operation or some procedure, be it cath or operation or anything. One thing is it needs the minimum preparation for any person, but medical preparation. I'm not telling about mental preparation. If it's suppose you are going today, and if I say that you have an appendicitis, I need to take out your appendix, you will be out of your mind. No, I cannot get operation today. I will go home. Then after 1 or 2 days, I will come back with my relatives. I will talk. So there is a cooling period that it's around 5, 6, 7 days, and also basic investigations like blood test, blood arrangements. So that obviously, if anything between 1 week to 2 weeks, we should take it as a normal. Because you need to arrange the blood, you need to do the investigation. Suppose I advise for echocardiography, then you would do that, X-ray and other things. But unprecedentedly, we are not unaccustomed to see that 4 weeks, 8 weeks, 2 months, 3 months, even 6 months delay also are there. And to the large extent, I'm telling you, it's because of the number of service required and the number of service provider. There is a discordance. There is no concordance. The number of service provider and number of people who want the service. Suppose if I have 4 surgeons in my hospital, and if I have 40% to be operated, And if there are only 8 hours in a day for operation, it cannot be done for all the patient's operation.
Yes.
There are solutions, and here your council and our organization, they can take up to the government that we have to change the paradigm. There should come a paradigm shift in our ideas and concept. We cannot keep our hospital closed by 4 or 5. We have to make out some way so that day and night, the same equipment, same laboratory, same hospital, it is closed for the night. Why it should remain closed for the night when people are there who needs operation? We may
But you
recruit
need personnel then, right? You
we
can't have somebody working day and night.
We have person. We have to recruit in 3 shifts. That's all. We need to, the government still have the proposition that I will have a staff for a single shift duty. They will come morning at 8, 10 or whatever, they will go back at 6. No, let us do 3 shift duty, 3 shifts. So then it will be rotated. Then at least let our equipment's operation, it should work for 12 to 16 hours and let them give 8 hours for the cooling and maintenance. Out of 24 hours, we can enhance it.
So you're saying our existing infrastructure can be utilized better should the government get more personnel and put them on shifts?
It can be augmented. For the time being, let us augment our existing service by recruiting more people and expanding the hour of work. So morning 8 or 9 and finishing 4 to 5. That we cannot go against labor law. We have to give 8, 9 hours, okay. But let us bring another shift. Let us bring another shift. We don't have, we have, India has a full of people who needs employment. It's not that we are overemployed people are more here. We have a lot of unemployed
but then
people.
we do not have the trained staff, isn't it?
We have.
The number of medical.
We do have. If you go to the in state department like AICT, UGC, there are governing bodies, and if you see the vocational training nowadays, and every state they have augmented the training person to 1,000 times. And those people have been trained and they are working in a mini center with their big expertise, with mini salaries, and there are many people are there. And then parallelly, more hour of work we start, and people will be trained also. We can take training people also there. We can do the training and service parallelly, the way we are doing in the daytime. That we can do in the night time, because nurses training, paramedics training, they are being done in the daytime. We can just increase 1 shift more from 2 to night 10 at least.
Okay.
Then it will be doubled. You can imagine that whatever service we are giving just will be doubled. At the same time, we can enhance the other setup. So this is one of the very, very vital issue that we can. I share one. Around 15 years back, around 18 years back, there was a crisis in the number of medical manpower in the country. And the government of India thought how we can increase the medical manpower. Then they decided that we can start 2 batches of MBBS in the same college, morning and evening. Nowadays, many of the colleges you see, there are evening classes.
Evening shifts,
yes. So very well we can do. It is one of the proposition that you can very well place. 2 shifts will be employed. Maybe there will be 2 superintendents. Maybe there will be 2 principal. That's okay. But we can use the ideal infrastructure. The light, OT table, fan, bed, everything can be used. Turnover can be raised up. If once turnover goes high, we can reduce the waiting time by 50% by this way. So otherwise, then next is to enhance the number of hospitals, but that's very cost effective, not so cost effective, because one hospital to build up and to employ 1 more shift of staff, there is a hell and heaven difference.
Definitely.
Yeah.
Definitely, but I mean, we have to add more hospitals as well, because even with the additional shift, we may not meet the.
We may consider. I'm just telling. We may consider. It's a viable option.
Right.
It's a viable option.
Dr. Kumar, I want to ask you: do you see patients who have traveled from outside the city to come and see you? And does the hospital help in travel or stay arrangements? Because this is one of the reasons why for normal public it looks like that these public health centers and public hospitals are not doing such a great job, because they keep seeing a horde of people who are just lying outside the hospital, and they are camping there because they've come from far and they've nowhere to go. Is this the responsibility of the hospital at all? Because your merit is to give treatment how the patient survives, where he stays, what arrangements he's made. Is it really the patient's responsibility, or should the hospitals also be involved in this? And do you see a lot of patients who travel outside Delhi to come and see you for mental health problems? How do they, stay stress-free when they're seeing you?
Yeah, so as far as mental health goes, yes, we do see people from outside Delhi NCR and who are coming in from the other parts of the country or sometimes internationally also, or people who are traveling and who are staying here for a period of time. So the hospital has a very good reach out program, and they do take care of the clients who are coming from outside, and they do take care of their staying facilities where they tell them where they can go and stay. They reach out to them. They also give them that facility where if you need a nursing aid or somebody else, that is also taken care of from a point of view of the reach out program that Gangaram Hospital does. So we do take care of those areas also.
All right. So I think we are now joined by Dr. Agarwal as well. Dr. Agarwal had to go in for an emergency surgery and has now found the time very graciously to speak with us, Dr. Sanjay Agarwal. He is a professor and head of department at nephrology, AIMS, who's joining us now. Dr. Agarwal, thank you so much for sparing the time for the Doctor Gratitude Week. We were speaking with Dr. Biswas and Dr. Roma Kumar about what's the life of a doctor when they work in a public health in a public sector hospital. So, Dr. Agarwal, do relate to us what an everyday normal day for a doctor like you is when you go to see your patient, when you start your morning in the hospital.
So you were talking at the moment or otherwise?
So otherwise, I mean, I want to know as a doctor, when you wake up in the morning, you go to the hospital, what's the experience like?
See, in our setup of a hospital like All India Institute, there is a very much freedom in the sense that if you want to do, there is too much things to do. If you do not want to do anything, there is nobody going to ask you whether you are coming in time or whether you are going in OPD in time or not. So a large number of things depend on the person himself. Okay. My usual routine is I usually come by 8:30 and in the morning and go by 6:30 or 7 in the evening. Because most of the time I understand in most of the other doctors in other hospital also, during hospital timing, you can't do any your own work related to research or your study or want to write a paper, because most of the time is occupied with some patient or a teaching activity. So if you are doing extra thing related to research or your own things in the form of writing paper or if you are editing something, so you have to do this either once the ward is start at 9:30 or 9, or after the regular ward activity finishes by 5 o'clock or so.
So it looks like a very long day, Dr. Agarwal. How many patients on an average do you see daily?
You see, ours is a super specialty department. So say I do in our department, we are, many people may not be knowing that All India Institute is significantly short of the faculty. So if we are 800 faculty sanctioned strength, then we will be having 600 faculty who are appointed. There is at least 20% faculty who those seats are vacant. So same is true in our department. We have got 8 sanctioned seats of faculty, but we are 5 people working. And that is going on for maybe 7 years now.
So, Dr. Agarwal, you're saying that along with seeing the patients, even your teaching requirements take up quite a bit of your time, and since you're short-staffed in your faculty, you have to spend a lot of time there as well.
Number one, I am not able to listen as clearly. Loudness of the sound is a little less.
Okay, Dr. Agarwal, I'll repeat the question. So what I was asking was that along with seeing the patients, you're also teaching at AIMS. So, so your time is going there as well. But how many patients do you see in a day? And is it a lot of pressure on doctors in public hospitals? Are there too many patients when they go out to the wards and do the surgeries?
So I tell you what I started saying. How many faculty there? I go twice in a week to outpatient and see somewhere 120 patients in 3 hours time. Out of which there are new patients are 7 or 8. The rest of them are old patients. But I can tell you the worst portion of life in All India Institute like us is that if I am seeing 100 patients in outpatient and our specialty is such that 80 to 90% patient will be requiring either lifelong dialysis or kidney transplantation. So the worst part is that every day I have to face a question from the patient that if I don't have a money, it means I don't have a right to life. Because both type of treatments are costly. There is a lack of facilities for dialysis and there is a lack of donor in the society for the transplant. So it is not very easy to listen to the question of patient in this language that if I don't have a money, it means I can't live. So it is very depressing from that way.
So you're saying
And
more than the actual number of patients and the volume of those seeking treatment. It is how you handle their issues of health that is difficult because of the reduced infrastructure and their own paying ability.
you see, if you ask really truly speaking, I am not able to utilize my expertise. Probably I am using my expertise not more than 20% or so. 80% of expertise is not being used because the type of patient we see and the affordability of those patients is such that we cannot give them much benefit while being in this setup.
That's a real shame.
So it is very, it's really very, and other thing is that the number of patients has grown. This hospital was not meant for that anybody can walk to the hospital for showing him. It was always meant for as a referral hospital.
Referral, yes.
But now it has become a general hospital. So number of patients coming, you might be knowing approximately 12,000 patients per day comes to the All India Institute as an outpatient. This is regular, not in the COVID area time. So the issue comes that those patients who demand expertise, your work is diluted by caring the regular patient and you are not able to give that much time to those patients who actually need expertise of All India Institute.
Right. So, Dr. Agarwal, then the question comes that how do you then streamline the inflow of patients? Would you then use technology? Would that be the first filter for anyone seeking treatment, so that you know that if you do not need specialized treatment, that patient can be referred to another place where he may get that treatment. Does technology come to the rescue here? How can we have a more streamlined fashion so that we can utilize the available facilities and the expertise of the doctors? You yourself are saying that I'm seeing all kinds of patients and my specialization is in nephrology, and there is a mismatch for what you're specializing in and what is the kind of patients you see. How will we manage to streamline this?
You see that the concept of starting AIMS-like institution in the country was based on this, that people from different part of country will remain in their own area and will not come to All India Institute in Delhi. Not only AIMS-like institution, many other institutions were grown. Say like some of the example I can give, Indira Gandhi Institute of Medical Sciences, Patna was made, say, 25 years back. The aim that, say, All India Institute cater approximately 40% patient of total who comes to All India Institute are from Bihar.
Okay.
And Patna Institute, Indira Gandhi Institute of Patna was made 25 years back. Initially, the doctors from All India Institute supported for development. But if you ask today what happened, that institute, either people don't have trust, or I cannot tell what is the reason, but still very few people go to the institute. And for minor complaint, they are being referred by the institute itself to go to All India Institute Delhi. So what I am trying to say that in spite of so many aims like institution being developed, still the number of patients coming to Delhi hasn't decreased, while this was never a aim. Aim was that in every area, once the government is planning in every state one institute like All India Institute, we expect that the number coming to the All India Institute should be restricted, and those patients who really need expertise, only those should come. But that hasn't developed. Say, the initial 6 All India Institute aims like institution started 2012, and we are running in 2020. So it is 9 years has gone. But all those 6 aims which started in 2012 hasn't reached to the stage that even every facility, every department is there in the institute. What to say of expertise? So none of those 6 institutes, at least in my field, none of those institutes are doing kidney transplantation.
Okay.
So the point is that the government has to understand that the disparity of salary of the public hospital and teaching institution versus the private setup is so huge that very few people are interested in joining academic institution and carrying academics. So those institutions which are there, hardly people, I mean, out of 6 institutes, only 2 institutes has got nephrologists. 4 institutes still hasn't got a nephrologist, in spite of 8 years has gone.
So, Dr. Biswas, would you like to add here and give us your perspective on this? When public health or public hospitals are being built in other parts of the country so that the pressures of AIIMS in Delhi, why aren't these coming up? You know, if I am a local of Patna, I much rather live and work in the same city. And you know, if there is a hospital, a good hospital, a big hospital where I can go to, then why is it that they're not coming up to part with the bigger hospital in Delhi? Why should all healthcare be centered in one place? Why can't it be a hub and spoke model where there are many hubs of healthcare?
Yeah, Anisha, keeping full respect and honor to Sanjay sir, I just want to say that I also had spent 3 years in AIIMS as a senior resident, and later on I came out for my career in different way. But what Sarah has highlighted, it exactly there is not concordance in the salary and the amount of job. You see the country, what was there after independence, and the country what is today, there has been a paradigm shift in the aspect, concept, and attitude of the people. And the availability and the possibility of career in different segments have come up. So AIIMS is not the only segment where career can be grown up. But as Sarah told, that government has to thinking differently to retain the faculty. I just told in my previous talk that either we have to share cash or kind. So cash I didn't mention, but I just mentioned kind, that make 3 shifts. One shift, one shift, one shift. So if you cannot give, India has an Equal Remuneration Act. So what an officer in one ministry gets, another ministry, same officer cannot get more salary. There are more or less equal salary. So if you cannot do that, your change, but lawmakers can do it. In the parliament, they can do it. Because ultimately, what Sarah has told is correct. In 2012, we built 6 AIIMS. Each AIIMS cost 1,500,000 crore. I mean 1,500 crore, supposedly like that. So what has yielded? These have yielded absolutely nothing probably, because no DM, no MCAs in a few, even not all MCAs postgraduate till now. Only they are linking with undergraduates. So only already 10 years, 1 decade is over. So we have to think in a paradigm shift in a different way. If required, the lawmakers should sit in the parliament and they should change it, because otherwise we are draining money, we are wasting money in the drain. Building one aims with 1,000 or 2,000 crore and it is not giving that adequate yielding for next 10 years, then what is the outcome of proposing such aims? So if that money has been, if we can make salary or something high, more faculty can be retained, or if we cannot do, then at least 3-4 shifts can be done. So at least we can, some people like time in their life, so they will join, they will develop the stream, but you will be there for 12 hours at a stage in a day with the same remuneration and also will get the large number of patients. That cannot go together. These have been established by new 6Ms. Now it is proven that it doesn't work. So I have a full respect to sir what he has, Dr. Agarwal has highlighted. It's absolutely correct. But thing is that who will build the cat? That's the thing.
Yeah, I can give you another example. I'm in institute since '85.
Ah, sir.
And I did nephrology here and then got faculty. So if I give example of say 1990, for one faculty post of nephrologist in All India Institute, the number of application used to be 15 to 20. Now if you talk of last year 2019, for 2 posts of nephrologist of All India Institute, there were 4 application only, and only 2 candidates actually appeared in the interview. Now somebody should ask why. Of the all public hospital, I'm not comparing, every hospital is good, every hospital has got good doctors. But it is a general concept that even salary-wise, institute has got maximum salary in all public hospital. But in spite of that, people say for 2 posts only two applicants are coming. Somebody should seriously think that if this trend remains, then after 20 years, you may not have enough nephrologists to care for the public if academic institutions are not nurtured and academics is not given importance. So this is a very wide thinking government has to do, that it's not only patient care, academic institution has got a major mandate of creating the new breed of specialists.
Yes.
So after 15 years, if teaching institutions are not having faculty, who will train the new specialists?
So, what is the biggest impediment, Dr. Agarwal, to your mind, to get more people into training? Is it just the salaries? Because if I practice, I can get my own clinic. I have a better earning. Is it just that, or is there anything else why people are not driven towards teaching or increasing capacities in the academic sector?
One of the thing I can say that the society has changed in last 40 years. The type of people who were there before, say I can compare when I was resident in 82, 83, my way of thinking, or I can say that probably majority of people thinking was different. Now today's resident, we handle 13 residents in our department. Their concept of, you can say, life or society has totally changed. You can say, if I can give you example of, I'm forgetting the movie name of Amitabh Bachchan's movie, Bhagwan. Many of you must have seen the later portion of when Amitabh Bachchan was making his statement. And the statement was that you can apply today's resident have become much more wiser and more practical. So they already plan that what they have to do after residency is finished. So if they have already planned that they will go to private setup or they have got their own nursing home, so they will only concentrate during residency those things which actually pay them at a later stage. Second thing is that why people are not joining. There was a time when the academic institutions were having enough money to care for the poor patient also with the advanced medicine or advanced machines. But if you see, probably private setup will get newer machine much earlier than the All India Institute.
Okay.
Because those machines generate money for them. So what is implication is that the newer medicine which comes in transplant or otherwise in nephrology in my specialty, we are not able to use those machines, those drugs or those therapies in poor patient because of the cost involved. While the type of patient goes in a private setup, they are able to use the newer medicine and newer technique much earlier than the government setup. So even in a academic fora in the society, when we discuss, say if I give example, Medanta might be presenting a drug which they have used in 200 patients while we have used in 10 patients only, just because the type of patient we see cannot afford. So even academic institutions are nowadays becoming little lacking behind for the medicine or procedure which are costly. And you understand the current newer medicine and monoclonal antibodies and more precise medicine and the research and the cost goes are becoming costly and costly, which we are not able to use in sizable number of a patient. So it is not only salary, but the job. That's what I told you, that I am using my 20% expertise. 80% expertise I am not able to use because the type of patient we see, they are not able to afford. It is not only salary, but the job satisfaction and the type of advanced procedure or medicine use is also becoming less in private, in public sector hospital as compared to government sector hospital.
But Dr. Biswas, is this set to change because of the Ayushman Bharat model that the government has come out with, where there is insurance, more insurance for people who are really poor. Will that mean then that all hospitals also upgrade to latest technologies and offer these if they are coming with an insured under an insured plan?
Yeah, Ayushman Bharat is one step that might change a little bit, but change in the government sector's problem may not change much, but people might get benefit a bit better. I'm telling that because the Ayushman Bharat also has linked not only private hospital but also government hospitals. So the same Ayushman Bharat insurance program, anyone can go to private hospitals also. But there is a possibility that government hospital might get some more fund to buy, as Dr. Agarwal told, that hospitals not being able to procure medicine and other things. They might get little bit more, but Ayushman Bharat also ceiling effect. It has a yearly ceiling. It has a structured treatment program. It is not unlimited, because if you stay for this ICU for this many days, only this much amount of money you will get. For this surgery, this much money is allocated. But still, there is a possibility that some more money can be used by the government sector hospitals to procure new medicine and new devices. But this doesn't translate to the salary of the doctor, because this cost expenditure will go to the hospital infrastructure and equipment. But there is no linking of Ayushman Bharat's money to in-house doctor salary. So there is no translation of this to that. So that way it will be very difficult to retain physicians in the government hospitals. As I told that if this continues, then one day we will not have ample setup and centers to produce our next generation physician in this country, and there will be total bankruptcy of super specialized doctor in the country. That will be a very difficult situation. At present, it is there even in any state. If you go, if you advertise for any job for a super specialty or specialty, there will be 60 to 70% less applicant than required. So we have to think, government have to think. Oh, sorry, sir.
No, I will bring a issue. You see, these things are so complex, and the general public doesn't actually get into deep into it. Now, what is the major lacunae of Ayushman Bharat? Now, if you see, if you divide society into 100 people, then only 10 people are below poverty line, and 10% people are who can afford everything. Now, 80% people are not in below poverty line, and Ayushman Bharat is for below poverty line. So 80% of the population which cannot afford doesn't fall into category that they are benefited by Ayushman Bharat. Plus, so you can imagine it is there for 10% people, but 80% cannot afford and doesn't get benefit out of Ayushman Bharat. Plus, Ayushman Bharat has also categorized everything, is every disease or every treatment is not included in Ayushman Bharat. Say, for example, transplant is not in Ayushman Bharat, even though if you are below poverty line, because the disease is not included in Ayushman Bharat, so you will not get benefit.
Okay.
So you can imagine Ayushman Bharat has got a very big issue of that 80% which is neither able to afford nor fall into category to get a benefit out of it.
All right. So the intention seems to be good behind the Ayushman Bharat program, but as you have pointed out, as Dr. Biswas has pointed out, really there needs to be investments into the faculty, into the doctors who are performing at these public hospitals outside Delhi. In the salaries that they are given, there are ideas of increasing capacity by adding more shifts, so that in that given time, the doctors aren't stressed, but they get their good salaries for those 8 hours that they spend in the hospital. But the same facilities can be used more optimally in another shift again. So thank you so much, Dr. Biswas, Dr. Agarwal, Dr. Kumar. Okay,
I'll just add one more thing before we are concluding. See, as we are thinking to bring change, you see, in our country, not all people pay their tax. It is very true.
Yes.
Hardly some percentage have their PAN card, but we all want the government healthcare system. It is very true. Everyone, whoever is living in this country, they want that I should be supported with the government healthcare system. But some reason or other reason, either many of them do not have PAN, even someone has PAN, they are not taxpayer. Even though they are paying tax, they are giving. But we can do a block level, some sort of mini insurance scheme. Each and every family will contribute 100 rupees or 200 rupees in a month. Minimum, I'm telling, from my experience, I'm telling, our employees are giving only 150 to 250 rupees per month. And with gathering that minuscule amount of money, we are surplus with 70,000 crore rupees right now. The parliament few days back, one of the MP raised question why the ESIC money is not being distributed to the country of the people at this moment. Because we are having surplus money of 70,000 crore, giving this kind of full treatment to all our family, be it transplant or anything. So this is the power of government funded money. So I request that every block under the leadership of BDO or sub-divisional officer, let every family contribute 100 rupees in a month. It is not a big issue. Let every family have a card, PAN card, let every family contribute 100 rupees, and block level we develop small hospitals and they will be treated with their money there. That is one of the way all of them will contribute and they will feel that it is my money, so I should use the healthcare judiciously. It is possible. From this insurance scheme, state and insurance scheme, we have seen that if you gather money small amount, you can give the treatment to the whole. So that AIMS and other hospital, that 80% people, those neither below poverty nor cannot afford, where they will go. Please show them a way that you contribute 50 or 100 rupees in a month. Large amount will generate and we will support. The much
So
of the government etc. will come down.
Right. For that, Dr. Biswas, we need to have that awareness amongst
Yeah.
people that this is not an expenditure. This is an investment into your own health. Thank you so much, Dr. Biswas, Dr. Agarwal,
I will
Dr.
take
Kumar.
only one sentence I want to say. everybody should understand that health has never been a priority for the government for years and years, and that probably explains everything.
Yes, that is true. And we are just hoping and praying that after this shock of an epidemic, suddenly, for everyone, healthcare will be center of everything.
Yes.
And, they will bring it upon the government to now think about this. You cannot keep glossing over the lack of healthcare in our country. It affects everyone. It affects people's lives. And it affects the economy. It affects everything. Health is a basic that we all need. And if all of you have raised your voice, you've spoken about your experiences, sooner than later, the government also has to wake up to the reality and make those changes. Thank you so much, Dr. Biswas,
Thank you
Dr.
very
Brahma
much.
Kumar,
Thank you. Thank you
Dr.
very much.
Agarwal for speaking with us and sharing with us your experiences of working in public health hospitals, where doctors are doing an exemplary job to treat the number of patients coming in there, as well as teaching in these hospitals which have medical colleges attached with them. Thank you so much for sharing with us your experiences of how public hospitals are run.
Thank
Now,
you.
we are very lucky to have with us Rohit Datta. Rohit Datta is an inspiring patient because he was one of the first persons to be infected by COVID-19. Now we have a huge tally of those people who were affected by coronavirus. Rohit has beat coronavirus and he is with us to talk about his experience. Rohit, thank you so much for being with us. Um, you know, being even now, 3 months later, people are scared of corona because they feel that it's too new, treatments are not foolproof, it is too dangerous. What would you tell people after you have gone through the experience?
First and foremost, good evening to everybody. My experience, I cannot actually tell you in words. You see, today after reading hydrochloroquine, remdesivir, plasma, so many things. At my time, it was just a mystery. COVID was a mystery. So whatever I had to fight was with the help of my doctors. Whatever my doctors told me, I just did that. Nobody was very sure what needs to be done. But however, my health was improving only with the positivity which the doctors was passing to me. You see, I was just kept on antibiotics and some anti-flu tablets, and I am here in front of you with the help of those small medicines only. I don't know how big a medicines anti-flu is, but Tamiflu is no medicine to be given in corona. So it is just the positive attitude which kept me running, and it is only due to doctors and the entire medical fraternity who helped me during those times.
Right. Rohit, I have, read experiences of many corona patients, and while some people have, blamed the media for increasing the fear and, sensationalizing the disease, saying that it's only a cold, it's like a cold, it's like a virus, it's like a cold that happens. But there are some people who've gone through it who say that, no, it's not a cold. You feel physically completely drained. You know it's different from a cold. Was it the case with you, or did you have a experience which was easier?
See, initially, I was, as you know, I was the first in the north of India to get the COVID. See, at that time, media wanted to tell people. Nobody was aware what the symptoms are. Everything they had just heard from others. So what mischief they had done on me also, because of which a lot of rumors and lot of schools and societies fought with each other. Lot of hotels were closed. That Rohit was everywhere. So that is what media was trying to do. Right or wrong, I don't know, because you see all type of media is there. The bestest of newspaper we read was giving wrong information about me till the day I was discharged. They wrote in newspaper, the best newspaper of India, they wrote that I had gone to Agra and I infected people there. So that is not journalism. What I had see, all of us read newspapers for truth. but that is not journalism, that you cannot write without knowing the exact cause. But honestly, certain difficulties like lack of smell or excessive smell, nobody knew. Even I did not share it with my doctor. When I used to put my head in this position, I used to smell that there is some cigarette in my head. So I thought maybe in Italy I was there, people were smoking a lot. I although have never smoked in my life, I thought that maybe that cigarette from that taxi driver which I had taken is still in my head. But after coming out and I did a webinar somewhere, I told them that I was feeling like this. So they said that, sir, it is a symptom. But up to 15th of March, people did not know that lack of smell and excessive smell also is a symptom.
So basically, we are learning more as we go. This is it's a new pandemic. It's a new disease. Everybody is dealing with it as they go. Uh, at your time, perhaps it was, ignorance, or perhaps you didn't know that you were in an exposed condition, or, perhaps there were things that you could have helped, but you didn't because the awareness didn't exist. But now, there's so much campaign about staying safe, washing your hands, wearing a mask, and people are doing that. And yet they find that they have contracted the disease. So now this whole blame game starts. You did this, you were careless, how could I do this? How can you affect the family? All this, the emotional aspect of it. How do we deal with this? I mean, is it fair to blame? I mean, we are all making as much change in our lifestyle, bringing in as many precautions as we can, and yet, I've seen a few families where they cannot explain how they got the disease, but there are a few members who got it. So, I mean, what do you do here?
See, emotionally, you have to fight it out. Like I can only tell you a few examples of people I know that emotionally you have to fight it out. And anyhow, if it feels like a crime if you infect somebody else, God willing, I did not pass it on to anybody. But when the reports came, the people I had met in 4 5 days, there were around like my two kids and my mother, my wife, who had met many people in those times. But emotionally, seriously, it will surely, if you don't have a positive attitude, it will drag you negatively only. So but nobody goes to a supermarket to buy corona or to get corona. You just get it. You have to understand that. You have to just understand the fact that you can take only your precautions. I know of people who have not even moved out of from their home, but one newspaper seller or one sabji seller, he comes and he spoils everything. So it is not their fault. It is just, I feel it is just what God wants. That is just my thinking. You have to be very cautious. You have to wear a mask once you go out, but it is not sure that whatever you are doing is you're going to be saved. I don't feel that.
So should you take those precautions or not? I mean, not
No,
taking them would be very foolhardy.
Understand, ma'am. I take those precautions even though people tell me that, Rohit, now it cannot happen to you. But I am not very sure about Chinese media and Chinese reports. Data when comes from Europe, India, or US, I understand that better. But ma'am, there are people who think they are invincible. Like I've started going out now. It's been 3 4 months now. But one of my friend, he does not like wearing a mask. He says, मुझसे सांस नहीं ली जाती mask पहन के. क्या करो आप बताओ? वो कहता भैया मुझे आपसे हो नहीं सकता. But I am scared. I tell him to wear a mask. He doesn't wear. What needs to be done? People need to be aware. I tell him, तेरे को लगता है you are invincible, but you are not. मैं भी मिनरल वाटर पीता हूँ इटली जाके, मगर मुझे भी तो हो गया.
So, Rohit, what would you like to say? You mentioned that you really bounced back from this because of the doctors. At that point in time, the doctors were also handling something new. They were also trying many things. Would you like to say something about the way the doctors treated you and how that helped you to recover? Do you think learning the ropes, they did something that helped you? How did they reassure you that increased your resolve to beat this disease?
Ma'am, there are few instances actually in everybody's life which drives you along. For example, when it was broken to me that Rohit, you are corona positive, there were 3 doctors who came to me. I could not see their faces, but they told me, Rohit, बैठो. जैसे ही they told me बैठो, I understood I am positive. So it is like what we see in movies also कि आपको कैंसर है तो जरा आप बैठो. So it was something like that. The very first thing they told me, all 3 of them, they were trying to tell me, Rohit, don't worry, it is a normal flu. You will be fine, and we are sure that you will be going back home in 28 days. Please understand, 28 days was the first time the doctors told me that you will have to stay in isolation, which is now 5 days. It was brought down to 14 days, but initially it was 28 days. Ma'am, now the second instance, see, doctor reassuring you, and trust me, when you are in bad time, doctor is a god. I felt, see, our ancestors used to say, भगवान हो डॉक्टर साहब आप, वो actually hospital में भगवान ही लगते हैं. दूसरा, ma'am, I made a list because I had to stay for 28 days in Safdarjung Hospital. So I could not stay in one room without a laptop or a television. I made a small list of things needed for next 28 days, including clothes, a blanket, a pillow, which I generally take. Ma'am, the doctor was such kind enough. He just told me one thing. I would like to specify his name also. I have never mentioned his name. It is Dr. Nitesh Gupta. He told me, Rohit, शराब और सिगरेट के अलावा कुछ भी मंगा लो. So I told him, डॉक्टर साहब एक टीवी मंगाना है. वो कहते टीवी तो मंगा लो मगर केबल नहीं है. So those were the things. If he would have acted negatively and told me नहीं ये नहीं आ पाएगा वो नहीं आ पाएगा तो शायद मैं भागने के लिए अप्रोच लगाता कि सर मुझे कुछ भगाने का यहाँ से अप्रोच करो. Number 3 point, ma'am, just understand what our country does in time of war or pandemic like wars. I told him, Doctor Saab, somebody has sent me a message that drink vitamin C, and I understand that orange juice has a lot of vitamin C. So can I tell my family to send vitamin C? Tell my friends. Family could not come out; they were quarantined. So can I tell my friend, ma'am? He brought 500 milliliter pack of juice, orange juice, from his own pocket, and I told him, sir, I cannot pay you now. He said, Rohit, आज के बाद ये पूछना भी मत. Please understand, a doctor of Safdarjung Hospital bringing 500 milliliter packs of juice, unbelievable. People are saying all sort of things, but this has happened to me. Number 4 thing, ma'am, again, he told me, Rohit, 24 hours of that day, please don't look at your watch. If you are at a problem, just call me. And ma'am, at one night I had received some breath issues, so I called him, not called him, at 12:01 I called him in the night. 12:02 he sent a SMS back to me that I am sending team of doctors. Please understand what people are doing for us. And ma'am, cribbing, we even crib at home कि नमक कम है, मिर्च कम है, ये सब तो चलता रहता है. So we have to understand what our medical staff, ma'am, leave the medical staff. I am talking about a person जो झाड़ू पोछा मारने आता था रूम में twice. I could not see his face. I told him, and there was a lot of guilt inside me कि why Rohit, you are troubling everybody. So I told them sorry कि आपको मेरी वजह से तकलीफ हो रही है. वो कहता है सर इसमें सॉरी होने की कोई बात नहीं है. इट इज माय प्रोफेशन, मैंने खुद चूज किया है. You don't be sorry. I just pray to God that you are relieved out from here ASAP. So ma'am, that is what the focus is, that what doctors and people around you, positive people make you positive, ma'am. आप कोई भी सिनेरियो क्रॉस कर जाओगे, नेगेटिव सिनेरियो, अगर आपके आसपास पॉजिटिव पीपल हैं तो. मेरी थिंकिंग ये है मैम. अगर मुझे वो डॉक्टर ने ये नहीं बोला होता कि आप कुछ भी मंगा लो शराब और सिगरेट की जगह, तो शायद मेरे को वो 28 months लगते.
That is true. And thank you so much, Rohit, for sharing with us your experience, because we have a panel of doctors and we cannot thank them enough for the work they do. But when they listen
only
to
one
a
thing.
patient.
Sorry, intervening. Only one thing. मैम, दवा अपना काम करती है, मगर डॉक्टर जब एक बार सर पे ऐसे हाथ फेर देते हैं ना, इट इज लाइक अ मदर्स का हाथ. प्लीज समझो, दैट इज मोस्ट इम्पोर्टेंट मैम.
And that is the reason why we're having this gratitude week, because We want to thank the doctors for doing the exemplary work that they're doing, and you're a living testament of this, of the care that you've received. And thank you so much for sharing with us your experience. And we really want to thank the doctors who are doing this tireless work for all patients around the world, even without a pandemic. They have never stepped back from what is their duty, and have always stepped forward and claimed whatever they could, whatever they can with the facilities that they have. Thank you so much. I would like to thank the panel of doctors.
Whenever the pandemic is over, I would request Government of India to give them 1 month off.
I'll just excuse me. I'll say congratulations to Rohit, because my hospital is a 100-bed COVID hospital, and today we have 97 patients.
Oh.
In my hospital, COVID positive 97 patients. Every day we are discharging 15 patients. Every day new 15 patients are coming.
Sir,
so thank you for your support we are doing from our side.
Thank you, sir.
Thank you so much to all the doctors on the panel here. Thank you, Rohit, for coming and sharing with us your experience. The Doctor Gratitude Week is for this reason, that we want to say thanks to all the doctors who are doing this relentless, tireless work for their patients. We want to thank them for all the effort that they make. We'll now move on to the next session, and until then, we'll take a short break and bring you some important messages. Stay tuned. We've got more panels coming up in the Doctor's Gratitude Week.
Thank you.
Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
अपना सुकून भूलकर वो सबकी जान बचाते हैं, भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं.
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ, ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ફિલ્ડ ડ્યુટી તે હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ સે આપકા શુક્રિયા. દિલો ધન્યવાદ. God bless you. Thank you.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artists, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist Bengaluru. Be the health and well-being champion of the day by answering the ABCD health quiz brought to you by Team Artist from Bengaluru. Question for the day is on B, building contraceptive choices, reaching every girl, every woman, and marching towards building Bharat. What do male condoms offer that the other forms of birth control do not? Is it option A, least chance of failure, B, the best protection against STDs, C, the cheapest to use, or D, all of the above? Answer now and be eligible to be declared as a health and well-being champion for the day.
I am Harshit Lohia from class 3C. This song is dedicated to all the doctors and other health workers. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. Ho ho ho. We just want to say thank you. Ho ho ho.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया.
दरियाओं को आर पार आशा है.
It's coming fine, this Siddharth. It's coming fine. So keep it.
आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव पे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
Rajiv, you're like.
I hope everyone is enjoying Gratitude Week, and it's been third day, and I can explain you how much good time we're having, and I hope all the doctors are enjoying the gratitudes and the spirit what we have. We have seen amazing spirit in kids. We have received so many requests and videos from many schools, and kids were so excited, and our doctors in the panel, they have really enjoyed the gratitude they paid. And we have almost 3-4 days more left for the show, and we know that all the doctors will be enjoying this. Entire gratitude week is for the fraternity of entire healthcare ecosystem, where we paying our gratitude and requesting everyone to join this, the longest web marathon for gratitude. Before starting the amazing performance what we have lined up, I will introduce you to Siddharth. He's, I think, one of the amazing artists now and a singer, and had very good track record of giving very satisfactory performances and various events and live performances. And he willingly agreed to play and perform here. And I think we should make him live. And I would like to give one message to everyone that we have started a movement for a gratitude cause. This is Gratitude Memorial. And we have requested Government of India to build a gratitude memorial for all the normal and people like us, and anybody can go and pray there and give their good wishes to all working healthcare staff, doctors and nurses. and we have signed. We are signing a petitions, and we want all of you, and also tell your friends and family to go on change.com and sign the petition. So we have more number of people. So we'll take it to the Prime Minister of India, Government of India, to have a kind of memorial where we can go and pray, and people can go and remember the amazing godly work what doctors and healthcare staff, nurse doing, and they've been doing since ages. So sign the petition. There will be amazing support. So Siddharth, over to you, and all the audience are waiting for your lovely songs. And next almost half an hour, you can just play your best numbers. We will also get some requests from Facebook. That also you can address, and I hope all audiences will have good time. All doctors and nurses who are watching live, they'll have good time. So you can pay your gratitude here. Over to you, Siddharth.
Thank you so much. Thank you so much for having me here, and a very good evening to all the people who are watching this live. And I would first of all, I would like to congratulate ISW Council for organizing this beautiful initiative. It's actually a very beautiful attempt to honor and to present the gratitude for people who have been probably forgetting themselves in order to protect the society and each one of you watching this out there. I would like to thank each one, all the doctors, nurses, and everyone who's been fighting for this beautiful cause. And so I would like to begin with the song. So this song goes to hopes. The song is about hopes और गाने का नाम है आशाएं. तो जितने भी डॉक्टर्स, नर्सेज और आप सब लोग देख रहे हैं, ये गाना मैं आप सबको डेडिकेट करना चाहूँगा. So here I go. कुछ पाने की हो आस आस, कोई अरमा जो खास खास आशा है. हर कोशिश में हो आर पार कर दरियाओं को आर पार आशा है. तूफानों को चिर के मंजिलों को छीन ले, आशाएं खिले दिल की, उम्मीदें हंसे दिल की. अब मुश्किल नहीं कुछ भी, नहीं कुछ भी. आशाएं खिले दिल की, उम्मीदें हंसे दिल की. अब मुश्किल नहीं कुछ भी, नहीं कुछ भी. उड़ जाए लेके खुशी अपने संग तुझको वहाँ, जन्नत से मुलाकात हो, पूरी हो तेरी हर दुआ. आशाएं खिले दिल की, उम्मीदें हंसे दिल की. अब मुश्किल नहीं कुछ भी, नहीं कुछ भी. आशाएं खिले दिल की, उम्मीदें हंसे दिल की. अब मुश्किल नहीं कुछ भी, नहीं कुछ भी. Thank you so much. If you're listening, just you can write down on the comments how you find the song. And if there are any song requests, you can just let me know as well. I would love to have more inputs from you. Yeah.
So we have one request, Siddhant. क्या हुआ तेरा वादा?
Yeah, I love the song. Okay, I can do that.
Thank
So
you.
we have a request. Kya hua tera wada? It's a beautiful song. So let me just try it for you. Okay. क्या हुआ तेरा वादा, वो कसम वो इरादा, क्या हुआ तेरा वादा, वो कसम वो इरादा, भूलेगा दिल जिस दिन तुम्हें, वो दिन जिंदगी का आखिरी दिन होगा, क्या हुआ तेरा वादा, वो कसम वो इरादा। फूल खिलते हैं लोग मिलते हैं, फूल खिलते हैं लोग मिलते हैं यूं ही, पतझड़ में जो फूल मुरझा जाते हैं, वो बहारों के आने से खिलते नहीं, कुछ लोग जो यूं ही बिछड़ जाते हैं, वो हजारों के आने से मिलते नहीं, एक बार चले जाते हैं जो दिन रात सुबह शाम, वो फिर नहीं आते, वो फिर नहीं आते, क्या हुआ तेरा वादा, वो कसम वो इरादा, क्या हुआ तेरा वादा, वो कसम वो इरादा। थैंक यू सो मच। सो ऐसा मुझे लगता है कि शायद मैंने दो गानों का मेडले मैशअप बना दिया शायद अभी गाते गाते। सो ओके,
that was amazing performance.
Thank you so much.
Next you can play what you like.
Okay. So I hope people who are watching this are enjoying the performance. You can let me know how you're finding this, and if there are any requests, आप मुझे you can just put it forward on the comment section. I can read the comments as well. So feel free to put in your request, and I'll surely try to do all your favorite numbers. And again, I would like to congratulate IHW Council for this initiative, for pulling this off so beautifully, and all the people who have been there on Facebook watching this, and making it all worth the initiative. So thank you so much for dropping in and listening and being here with us. So okay. So it's a not a retro song, I would say, because people still love this. It's a song called Pehla Nasha. I hope you're gonna like this one. Pehla Nasha, Pehla Khumar, नया प्यार है नया इंतजार, कर लूं मैं क्या अपना हाल, ऐ दिले बेकरार मेरे दिल बेकरार, तू ही बता, पहला नशा पहला खुमार। उड़ता ही फिरूं इन हवाओं में कहीं, या मैं झूल जाऊं इन घटाओं
मैं कहीं एक कर दूं आसमां और जमीन। कहो यारो क्या करूं क्या नहीं। पहला नशा पहला खुमार, नया प्यार है नया इंतजार। कर लूं मैं क्या अपना हाल, ऐ दिले बेकरार, मेरे दिल बेकरार, तू ही बता। पहला नशा पहला खुमार। Thank you so much. Okay.
So you received the next request, or you continue?
Okay, I hope you can listen to me. Am I audible?
Yes, yes.
Yeah, okay. Okay, so
you all are enjoying.
Thank you so much. That means a lot.
Lovely.
Next song is it's a song from a movie called Kabir Singh. So it's actually been more than 3 months that we have got to perform live since the lockdown. Like our industry is totally it's quite settled down right now. So it's a good feeling to be here performing for all of you, and I hope all of you are enjoying. Let me just introduce myself one more time. My name is Siddhant Gupta, and I sing for my own band, which is called Peprico. And a lot of people know us, and I hope all the people who are listening, they know me now. And so I'm with this lockdown, I have also discovered a few more things about myself. So I have also started to compose my own songs and write my own songs. So I have just released my first own composition called Parvato Ke Pare, a song that speaks about dreams and life. So it's there on YouTube, guys. The song is called Parvato Ke Pare, and I'd be happy if you guys can stream it sometime when you have time right after the session.
You can play that song
And you
for
can
us, for all the
subscribe my
audience.
channel. Okay, I can just sing a part of it. I would love to sing the song for you guys. Okay, so the song is called Parvato Ke Pare. I've penned it down. So the idea of the song comes from a journey in the mountains. Like, because I love to travel and I love to walk in the mountains. I love to trek. So this is a song that comes from an idea of the trek. So I hope you like this. Let me just sing it for you.
Definitely.
दिल से सोचो खुद से पूछो रास्ता ये जाता कहाँ। ख्वाबों की धुन में चलता चला ये होगा क्या किसको पता। पर्वतों के परे एक दुनिया है क्या, सपने रहते हो जहां। देख के वो मुझे सपने वो सभी हकीकतें हो ये रजा। बादलों के परे सहर हो इस तरह, मीठी रोशनी हर जगह। सिरहाने सपने ये मेरे हंसी ये ओढ़ के रख लूं महफूज वहां। पर्वतों के परे एक दुनिया है क्या, सपने रहते हो जहां। देख के वो मुझे सपने वो सभी हकीकतें हो ये रजा। So this is just a part of the song. If you guys like the song, do go to YouTube and you can search the song Parvato Ke Pare, or you can just write down my name. That's Siddhant Gupta, and you can listen to the song. Thank you so much. I hope you liked it. And with this, let's do a song from the movie called Kabir Singh, guys. So here we go. Okay. साथ छोड़ूंगा ना तेरे पीछे आऊंगा, छीन लूंगा या खुदा से मांग लाऊंगा, तुझे हर बारी अपना बनाऊंगा, मैं तेरा बन जाऊंगा, मैं तेरा बन जाऊंगा। सौ तेरी मैं कसम यही खाऊंगा, कितने वादे आनुमरा निभाऊंगा, तुझे हर बारी अपना बनाऊंगा, मैं तेरा बन जाऊंगा, मैं तेरा बन जाऊंगा। मेरी राहें तेरे तक है, तुझ पे ही तो मेरा हक है, इश्क मेरा तू बेशक है, तुझ पे ही तो मेरा हक है। साथ छोड़ूंगा ना तेरे पीछे आऊंगा, छीन लूंगा या खुदा से मांग लाऊंगा, तुझे हर बारी अपना बनाऊंगा, मैं तेरा बन जाऊंगा, मैं तेरा बन जाऊंगा। सौ तेरी मैं कसम यही खाऊंगा, कितने वादे आनुमरा निभाऊंगा, तुझे हर बारी अपना बनाऊंगा, मैं तेरा बन जाऊंगा, मैं तेरा बन जाऊंगा। थैंक यू सो मच। And the next song is for all the Arijit Singh fans out here, in case we have any Arijit Singh fans over there. So the song is called Hawaii. I hope you have. I hope you know the song. It's a famous song.
It's a very beautiful
so I hope I do justice to the song. So here we go. And वैसे मैं आप लोगों को सुन नहीं पा रहा हूँ, of course आप लोग मुझे सुन पा रहे हैं, but आपका मन करे तो आप लोग मेरे साथ गुनगुना सकते हैं, can just sing along with me, because जब हम live perform करते हैं तो I usually ask people to sing, the audience to sing with me, and that feels really great to be on the stage and people just singing along with you. So आप लोग भी अपने घर पे जहाँ भी आप मुझे सुन रहे हैं,
yeah, we all are enjoying clapping,
sing with me.
There are a lot of people enjoying. We have requests also for you, like after this song you can play Teri Mitti.
Sure. Which song?
Whatever next you'll play, you have this lined up. We have a request from Ria Gala. She wants you to play Teri Mitti. But this Hawaii is a beautiful song. After this, you can play.
Okay, let's do Hawaii for all of you. Here we go. तुझको मैं रख लूं वहां जहां पे कहीं है मेरा यकीन, मैं जो तेरा ना हुआ किसी का नहीं, किसी का नहीं। Please sing along. ले जाए जाने कहाँ हवाएं हवाएं, ले जाए जाने कहाँ हवाएं हवाएं, बेगानी है ये बागी हवाएं हवाएं, ले जाए मुझे कहाँ हवाएं हवाएं, ले जाए जाने कहाँ, ना मुझको खबर ना तुझको पता, वो बनाती है जो तू, वो यादें जाने संग मेरे कब तक चले, इन्हीं में तो मेरी सुबह भी ढले शामें ढले मौसम ढले, ख्यालों का शहर तू जाने तेरे होने से ही आबाद है, हवाएं हक में वही है आते जाते जो तेरा नाम ले, देती है जो सदाएं हवाएं हवाएं, मांगी है ये दुआएं हवाएं हवाएं, ले जाए मुझे कहाँ हवाएं हवाएं, ना जाने क्या बताएं हवाएं हवाएं, ले जाए जाने कहाँ, ना मुझको खबर ना तुझको पता, वो 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 सो ये लाइंस मैं डेडिकेट करना चाहूंगा आप सबको. सो लाइफ इज मेंट टू बी इन द प्रेजेंट मोमेंट, और ये मेरे को बहुत खूबसूरत सा गाना लगता है, एंड आई लव दीज ब्यूटीफुल लाइंस. So it's a dedication to all of you, and it has a message and a lesson for us. So I hope you like it, and I hope you learn from this beautiful line. कल पे सवाल है, जीना फिलहाल है, खाना बदोशियों पे ही जाने क्यों, इलाही मेरा जी आए आए, इलाही मेरा जी आए आए, इलाही मेरा जी आए आए, इलाही मेरा जी आए आए. नन्ना 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 शामें मलंग सी, रातें सुरंग सी, बागी उड़ान पे ही ना जाने क्यों, इलाही मेरा जी आए आए, इलाही मेरा जी आए आए, इलाही मेरा जी आए आए, इलाही मेरा जी आए आए. मेरा फलसफा कंधे पे मेरा बस्ता, चला मैं जहाँ ले चला मुझे रास्ता, बूंदों पे नहीं गहरे समंदर पे, वो इलाही मेरा जी आए आए, इलाही मेरा जी आए आए, इलाही मेरा जी आए आए, इलाही मेरा जी आए आए. Thank you so much. I hope you guys are enjoying, and thank you for listening. Thank you for being here. Thank you for being a part of this beautiful initiative by IHW Council, and I
Amazing,
also
Mr.
got to know about this beautiful attempt, this beautiful petition that is being initiated by IHW Council. It's about having a gratitude memorial. So it sounds beautiful, and I guess all of you should sign the petition. And it's we have memorials for people who win battles, who have done great work in the past, and I guess doctors and everyone from the healthcare industry, they are actually fighting. That's
not less than any war uh, that's being fought for freedom. So it's a freedom for life that we are battling for, and I would love to congratulate first of all for this attempt, for being so strong, to all the doctors and the nurses and all the people who are contributing. So thank you so much. Thank you so much for giving us hope, uh, for giving us a ray of hope, and I'm sure we would very soon be past all this and have our lives back. So thank you so much, all the doctors, and congratulate. I would like to congratulate again to this beautiful initiative by ISW Council. And मैं गाना गाना चाहूँगा आप सबके लिए. इट्स अ सॉन्ग अबाउट फ्रेंडशिप, और मुझे गाना इसलिए पसंद है क्योंकि ये गाना आप लोगों को पसंद है. सो आई जस्ट सिंग इट फॉर यू, एंड आप लोग मेरे साथ गुनगुना सकते हैं. सो हियर वी गो, लेट्स डू दिस. And thank you so much for listening. My name is Siddhant Gupta. Before I do this, this is going to be the last song. So you can follow me on
We have
Instagram.
some more requests. We have some more requests, Siddhant.
You can just let me know the request. Please let me know the request. I'll surely try. I'm not sure if I'll be able to attempt the request, but I can surely try. Please let me know.
We have Sham Mastani from Kishore Kumar. If you can do it.
Okay.
I don't know.
Okay. Yeah, I can try that song. It's a beautiful song.
Yeah. So, and Tanha Dil Tanha Safar.
Wow, that's a beautiful song. But I'll try the first song, the first one.
Okay.
So ये गाना आप सबके लिए है, इस खूबसूरत सी शाम के नाम, और गाने का नाम भी है ये शाम मस्तानी. So here we go. Let me just sing it for you. I hope you're gonna like this. ये शाम. Okay, let me just change the scale of the song. Okay, this would work. ये शाम मस्तानी मदहोश किए जाए, मुझे डोर कोई खींचे तेरी ओर लिए जाए. ये शाम मस्तानी मदहोश किए जाए, मुझे डोर कोई खींचे तेरी ओर लिए जाए. दूर रहती है तू मेरे पास आती नहीं, होठों पे तेरे कभी प्यास आती नहीं. तेरी अदा तेरी कसम मेरे होठ सिए जाए. शाम मस्तानी मदहोश किए जाए, मुझे डोर कोई खींचे तेरी ओर लिए जाए. Thank you so much. Thank you. Okay. So talking about friendship, Friendship Day is around the corner, and मुझे लगता है जितने भी लोग यहाँ पे मुझे सुन रहे हैं और साथ में हम लोग एक जंग लड़ रहे हैं. So it's actually a song dedicated to each one of you. We guys are doing our best to get over and to stop coronavirus. So ये गाना आप सब के लिए है मेरी तरफ से. It's a dedication to all of you. I hope I actually feel that I've got made a lot of friends during this live session. So ये गाना मैं आप सबको dedicate करना चाहूँगा. And especially to the doctors and the nurses listening to me, ये line specially आपके लिए. मेरी जिंदगी सवारी मुझको गले लगा के
बैठा दिया फलक पे मुझे खाक से उठा के, मेरी जिंदगी सवारी मुझको गले लगा के, बैठा दिया फलक पे मुझे ख्वाब से उठा के, यारा तेरी यारी को मैंने तो खुदा माना, याद करेगी दुनिया तेरा मेरा अफसाना, तेरे जैसा यार कहाँ ऐसा याराना, याद करेगी दुनिया तेरा मेरा अफसाना। मेरे दिल की ये दुआ है कभी दूर ना तू जाए, तेरे बिना हो जीना वो दिन कभी ना आए। मेरे दिल की ये दुआ है कभी दूर ना तू जाए, तेरे बिना हो जीना वो दिन कभी ना आए, तेरे संग ही जीना यहाँ, तेरे संग मर जाना, याद करेगी दुनिया तेरा मेरा अफसाना, तेरे जैसा यार कहाँ ऐसा याराना, तेरा मेरा अफसाना, याद करेगी दुनिया तेरा मेरा अफसाना, याद करेगी दुनिया। एंड मुझे ऐसा बिल्कुल विश्वास है कि दुनिया याद रखेगी, whatever all the doctors and all the nurses and everyone is putting out there so much efforts to make our lives easy, to have us hope in life. So I would like to thank all the doctors and all the nurses out there for this
So nice of you.
जितना भी मैं बोलूं मुझे लगता है कि कम है. So I would just like to thank. And again, IHW Council, thank you so much for having me here. It's beautiful to be here performing for all of you. With this,
I must
I'll
say
sign
thank
off.
you to
Thank you
you,
so much.
Siddharth. I must say thank you to you, Siddharth. This is an amazing performance, and
Means a lot.
we have
I was a bit nervous also throughout because अब ऐसा हो गया कि 3 से 4 महीने, it's almost gonna be 4 months that I have not been performing. So I've just been sitting back at home and doing my practice and writing songs.
No, but amazing
So
performance. I'm telling you, you have such a. I'm giving you a very common compliment, which you must have received, 1,000 times, that you have a beautiful voice, and such an
yeah,
amazing
that's something
voice you have, and you must be having your fan following. I would request that you personally should sign the petition, and you should also ask your friends and your fans that they
I
should
have
sign. We need
already I have already
maximum.
signed. I have already
That's so
signed the
nice of you.
petition, and I totally the moment I got to know about the petition, I totally felt like doing that right away. So yes, and I'll be also sharing it with more people, more friends and family members. Yeah.
That will be amazing. That we want people to join this, make a movement here in India. We need such activity. We need people's involvement. We have the entire medical fraternity, supporting this, and we need support from people like you. Each and everyone is very, very important for this kind of cause.
Absolutely, absolutely.
Let's make it and promote it. And we would like to, listen to your beautiful, songs and voice again. Whenever you have any kind of program, please let us know. We have audience here, and we all will definitely try and get connected and watch.
Yeah, I would like to tell that I'm so this lockdown actually turned out like uh, I what I try whenever something tough happens, I usually try to find out the positive aspect that probably can be there from that. So I'm trying to use the time like writing my own songs and I'm composing.
So it's a new thing for me, and you guys can support me if you guys. My first song is out. It's called Parvato Ke Pare. It's there on YouTube. You can search it by the
We'll
title name
definitely promote.
Parvato Ke Pare.
Yeah, we'll
And
tell audience to
it would be
Parvato
great.
Ke Pare they can
And there
search
is
and
another
promote.
And there is another song that's coming up, and it's called Thamna Tha Zaruri. So it's a message to the humanity. It's a kind of it's a little
Such a
dark song,
lovely
not a
thought.
very romantic. It's not a
Such a
romantic
lovely
song. It's a
thought.
message to the mankind and the humanity. So this I would love you guys to hear the song. It's releasing on 10th of July. So it will be there
Oh,
on my YouTube channel. If you guys subscribe my channel, you will surely. I'm sure you guys gonna will
we will
love it
surely do it.
because thank you so much for having me here. It's
And
a
we will
pleasure.
promote you also.
Means a lot. Thank you so much, Rajiv ji. Thank you.
We're having an amazing time. Thank you very much,
Means a
Siddharth,
lot.
being here. I hope everyone enjoyed, and most of the doctors, nurses, and they must have had really good time here. We've been having good time for last 3 days, and there's some more days left for this gratitude, and we are receiving so many. I've told you, the schools participating, kids, and we have doctors coming up. We have medical staff. We have most many representatives from Government of India, and I think it is an amazing experience we are having. People also enjoying. So to sum
Congratulations,
up,
congratulations to the team.
yeah.
Congratulations to all of you.
Thank you, Siddhant. Thanks a lot. Thank you very much. Now, I would, to sum up, we had a very amazing day. We had Member of Parliament in the morning, Meenakshi Lekhi, and many other renowned doctors sharing their experience, their life experience, how they converted, their career and help people, many people, and a lot of interaction with COVID-infected patients. They have spoke so nice about the entire fraternity and experience, during their quarantine. Uh, doctors' cooperation. In fact, the staff, the helping staff cooperation. That is something very amazing. And we have more stories coming up. I would now invite CEO, Integrated Health and Wellbeing Council, Mr. Kamal Narayan, to give you a glimpse of the whole day and some of the day for us. Over to you, Mr. Narayan.
So this was our third day of Gratitude Week, which we started on July 1 and are going to continue till July 7, covering the entire gamut of healthcare, pharmaceutical devices, technologies, and everyone who is working in ensuring that the healthcare reaches to us, to everyone who need it, especially during this time of pandemic. I would say goodbye to our audience for today, and we are looking forward to see you tomorrow. And do participate and support our cause and our campaign to request the government of India to set up a gratitude memorial for our healthcare workers as a symbol that remains forever and also can inspire people and remember that health comes first, and each one of us have to ensure that who is working for the health of this society and the nation get our due support and appreciation. Thank you so much for your wonderful participation and support. Thank you, our doctors who spoke today, shared their experiences, and also the artists who paid a musical tribute to our healthcare fraternity. Thank you so much. Goodbye. See you tomorrow.